inspired by the UN Global Holistic Approach to Sustainable Development Goals, is organizing today the second edition of IHW Digital Health Summit and Awards 2022 here at Hyatt Regency Hotel, New Delhi. It is the most awaited platform in bringing together the multi-stakeholders from the digital health world and also understand the digital health revolution market dynamics, demand and supply, and the impact of digital technologies on the masses and the future of health and healthcare in India. This platform also aims to recognize and felicitate the massive efforts of various digital health industry, health information sharing platform, new and transformative technologies, new product startups and initiatives benefiting India through a technology-enabled healthcare ecosystem. This interactive summit would also invite health startups to a dedicated pitch platform for spot funding to a new and innovative initiatives. And ladies and gentlemen, I'm Shelly Rokheja, your host for the day. And on behalf of IHW Council, extend a very warm welcome to all of you and welcome you all to the second edition of IHW Digital Health Summit and Awards 2022. Before we move ahead, we would like to thank our sponsors for extending their support and cooperation for the summit and request all of you to please join me in thanking our supporting partners who have been with us on a mission to ensure good health for all. The IHW Council is delighted to have Niti Aayog, National Health Authority, and Invest India as our supporting partners. SuperConnect as our powered by partner, Optum as our health tech partner, Infosys, our healthcare intelligence partner, Ipsos as our insights partner, Exitel as our customer engaging partner, Genes to Me, Care Expert, Zoho, and Healthfluencer as our associate partners, Transformer as a pitch podium partner, IHW TV as our digital partner, and Teamwork Communications Group as our communications partner. Ladies and gentlemen, before we move ahead, I would request all of you now to kindly have a look at the AV screens as we're going to showcase you a small audiovisual presentation of the journey of IHW Council. Please have a look at the AV screen.
At Optum, we're creating a healthier world. One insight, one connection, one person at a time. Better for you is our promise. That means better health for you and you too. It all starts with better connections at the center. What does a better connection mean to you, to us? Better means
knowing me,
guiding me, more trust,
less confusion.
Better happens when we put intention into everything we do. It means remembering why we care in the first place, because a healthier world is a better one. That's why we're bringing all aspects of health together. We're making it easier for people by designing care experiences around their everyday needs. It means putting people and their humanity at the center and supporting health decisions with personalized insights backed by data. And it means driving health equity through action and advocacy. We're creating healthcare for everyone. Better doesn't happen overnight. We get there through commitment, hard work, bit by bit, person by person. We make progress with every single insight, every connection. Every person better. We're imagining a new kind of healthcare, sparked by optimism, fueled by our people, so we can deliver health that's better for you.
Our Indian tradition, we would like to commence our summit by taking the blessings of Lord Almighty. We would like to light the ceremonial lamp, for which may I please request our dignitaries to kindly come up on the stage for the lamp lighting ceremony. Ladies and gentlemen, please welcome on stage Mr. Kamal Neil Kumar, Deputy Director General, Scientist G, and ceremonial lamp with the aim of filling the entire ambience with light and positivity. Thank you all. And thank you, everybody. May I request Mr. Naveen Kumar to kindly take a seat and request other dignitaries to kindly remain on the stage. I request other dignitaries to kindly be up on the stage as we are now going to start with our summit. Ladies and gentlemen, with the launch of initiatives like Digital India, Skill India, Ayushman Bharat, and National Digital Health Mission, India is at the cusp of becoming a digital health leader by strengthening and empowering the healthcare industry through digital infrastructure. India's venture into digital has opened a plethora of possibilities for SMEs who now are emerging new technologies for providing better healthcare and increasing the ease of operation. However, challenges are immense to create an efficient healthcare system. There are immense challenges such as adopting sustainable technologies and affordable and accessible quality healthcare. We now are going to have our opening session on the topic, India's Digital Health Footprint and National Mission. The session aims to bring together shareholders who would be talking about alleviating the overwhelming and overstraining processes in healthcare and also deliver through transformative technologies, new investments, and capacity building from both regulatory and industry sides to take digital health ahead. We have our eminent speakers up on the stage, but I would once again like to request all of you to kindly welcome all our dignitaries up on the stage. Mr. Kamal Narayan, CEO of IHW Council, Mr. Sunil Kumar, Deputy Director General, Scientist G, Head Health Sector, National Informative Centers, Mr. Anurag Saxena, Principal and Head Digital Health Consulting, IQVIA, Ms. Swati Rangachari, Vice President and Country Leader, Public Affairs and Strategic Engagements, United Health Group. Ladies and gentlemen, please give them a huge round of applause. Our moderator for this session is Mr. Kamal Narayan. But before I hand over the floor to our moderator of the session, we have with us Dr. R.S. Sharma, CEO of National Health Authority, who is joining us here for the virtual address. Ladies and gentlemen, please welcome our guest of honor, Dr. R.S. Sharma.
Can we put Dr. Sharma on the screen? So good morning, Dr. Sharma. So here we have somebody with us, though virtually, he could not attend this summit physically today, but somebody who is in the helm of building the backbone of India's technological digital revolution, from Aadhaar to many other revolution which we saw in the telecom industry, and also now being the CEO of NHA, he is building the digital health backbone of the. And I'm sure this is something which is going to change the whole face of how we have been accessing health in the past, and going to ensure that each and everyone, nobody is left behind when it is coming to getting the essential supports like healthcare. So Dr. R.S. Sharma, over to you.
Thank you very much, and good morning to all of you friends. First of all, my apologies for not being able to be present physically, though the distance is not much. But unfortunately, I had a back-to-back kind of, engagements, and those were fixed, from before. So I could not say no to anybody. I hope I'm able to, I'm sort of audible and visible, because I see my frame, sort of frozen on the screen. Not very sure.
Can you hear, sir?
The-
Our connection is okay.
Our connection is absolutely okay.
Let's check.
Our connection is okay,
Yeah.
but I think
Is it still not coming well?
I mean, I can't see the.
Yeah.
Which need to be filled in. Sir, you are back. Sorry.
Yeah, I am back, but looks like the internet connection. I mean, I don't have any problem at my side, because just now I addressed another, sort of gathering. So, but anyway, I hope I am able to sort of complete this kind of interaction with you. So first of all, thank you very much for inviting me to the second IHW Digital Health Summit and Awards 2022. Some decades back, we used to have a lot of conferences on e-governance. And the idea was that, the digital use of digital technologies in governance is going to transform governance. And that was the basic part. Nobody at that time talked of digital health. Obviously, this was before, its time had come in some sense. Now, I want to emphasize this once again, that the digital health, in the word digital health, what is important is health and not digital. Digital is only an enabler. Digital only, makes things more affordable, more cost effective, more time saving, more quality, more accessible. So these are some of the attributes of digital, and I suppose all of these things are required in our country in the space of health. And that is why the Honorable Prime Minister had launched about a year back the Ayushman Bharat Digital Mission. And the overarching objective of this mission is to ensure that we are able to leverage digital technologies to the fullest extent. COVID has been a disastrous, impact on the entire world, has had a disastrous impact also in our country. But I think one of the positive outcomes of COVID was increased use of digitization in all sectors. We were not able to go out of our homes, and we had to consult our doctors, and therefore we were making video calls to the doctors. And of course, the fact that the data is very cheap in our country, we have 1.2 billion mobile connections. We have 600 million smartphones, 800 million, more than 800 million internet connections. So all that makes it possible for us to communicate in a very effortless manner with doctors, with laboratories, with hospitals, and other kinds of things. Again, I think this has frozen, so I'm not very sure whether what I'm saying is going over to the audience there or not. Yeah. So friends, am I audible, visible or not? Otherwise, probably maybe some other time I can
you hear, sir?
speak.
So they can hear you.
Okay, fine. So now, the one other question, I assume that you are able to hear me, and if not view me, then at least able to hear me. Otherwise, I'll be talking to my computer only. So one is that why India is, you can ask the question that every country has done it in the past. America has done it, Europe has done it. Why? What is so new about this digital mission? Because everybody is digitized. American health system is largely digitized. European health systems are also digitized. What is so different? Actually, I want to propose to you, and I want to assert that what we are doing is pretty unique in its in its approach and its dimensions and its scale. Is it audible?
Yeah.
So essentially, why we are able to, in what way is it different, and why we are doing it the way we are doing it? So one is that from a very start, when we started our e-governance journey, we had taken certain policy decisions. One was that what we will build at a national scale will be interoperable, will be frugal, will be scalable, because we are building for a country of 1.3 billion, which happens to be 1/6 of humanity. So I think these are the attributes. Then of course it should be based on standards. It should be open standard based. It should be open, API based. It should be open source also as far as possible. And these are some of the overarching, design considerations which we have made for our, products or frameworks which we are making. Next part we have done is that we will allow all the ecosystem partners to build applications on top of the framework which we create. So we are not building applications, and we are not at least competing in the market. So for example, Honorable Prime Minister in December 2016 launched the Unified Payment Interface UPI, and he also launched BHIM. But the idea was not that the BHIM will be competing with the payment applications. Idea was BHIM was a reference application. So therefore, we are building frameworks. We are also building reference applications and making all those APIs and SDKs public, so that people can easily make applications on top of that. That's the broad approach which we are taking. We also have certain digital public infrastructures which can be used in these transactions, whatever domain of those transactions might be. Maybe it is health, agriculture, education, or other things. So for example, we have made digital identity, which is Aadhaar. Now, Aadhaar enables you to plug the digital identity into any transaction. And as you will agree with me, any digital transaction, first stage of that transaction is to require the proof that you are who you claim to be. Now, that's a very important consideration that we have. We have a very easy way of payments because of the UPI. Now, I can remotely pay money to anybody using just, without any commission or other kinds of charges. So it's free, it's frugal, it is available on every smartphone in the country. Similarly, we have made products on top of Aadhaar. We have made electronic KYC, we have made consent artifact, we have made digital locker, we have authentication as a service. So I think these are some of the horizontal products or horizontal digital public goods which India has created, which can be leveraged by any application developer who is developing applications. So that is the broad concept. In fact, Aadhaar also was developed as a digital public infrastructure, and people made applications on top of it. Telecom companies made applications to provide SIMs to the customers to do their electronic KYC. Banks made an application to basically do the KYC and open accounts sitting at your home. And we had JAM Trinity, Janadan Aadhaar and mobile, which actually ensured accelerated, financial inclusion of the people of our country. So I think that part is already, that story is done, and it is actually flourishing. It's a very vibrant ecosystem which we have created of these horizontal public goods. Now what we are building is specifically in the health sector is essentially the same framework. Now, what is that framework? The framework is UHI, Unified Health Interface, which is actually similar to UPI in a way that it is interoperable. And interoperability in true sense means that if I have a teleconsultation application A and my doctor has teleconsultation application B, then I should be able to talk to the doctor without the fact that I have to be on the same application. So this is the true meaning of interoperability, and this opens up market. So we are also doing that function of market making by providing a framework which is universal and also interoperable. And that I will give you an example of CoWIN. Now, CoWIN is a platform, but CoWIN is now connected to 150 user 50 applications. Why? Because we have provided open APIs, and now today Paytm is connected to it, Make My Trip is connected to it, health applications are connected to it. Similarly, UHI will actually provide a plugin infrastructure where all kinds of applications can plug in. health management information systems can plug in, the application, personal health applications can plug in, the devices can plug in, the Fitbits of the world, they can actually transmit data to the applications at the edge of this UHI framework. So this is the way we are now creating. Of course, we have also created certain reference, public goods. So for example, we have created the PHR application, we have created the other applications. Next, we have created health registries. Registries are very, very important because that is the only trusted source of data which says that this hospital is a legitimate hospital, a hospital which is recognized by the government, hospital which is proved to be providing services. Similarly, this is a doctor or who has qualified doctor, and therefore health professional registry, health facility registry, drug registry. All these registries will also provide a very good service to all the application developers. So essential idea, friends, of the ABDM is that we have created a framework. Then we have created certain digital artifacts, which are essentially PHR application we have created, which are essentially reference applications. And we expose this entire infrastructure as a digital public goods to the people of our country, the developers of our nation. And that will provide a beautifully connected, interoperable, frugal, scalable framework which will serve 1.3 billion people of our country. And I can assure you that if we can make it happen, because ultimately ideas are there, but these ideas have got to be implemented. And the ideas are worthless if you can't implement them. And therefore, what is required is the collaboration and cooperation of all the stakeholders. Because believe me, this is going to be a platform which is going to benefit everybody. This is not going to be a platform which is benefiting one section and not benefiting another. And ultimately, people are at the center of this platform. So basically, we are creating a framework where a person will be able to see all his medical records, longitudinal medical history he can build on the basis of the records. And these records are not being accumulated at one place. They will be federated architecture, which means they will be there in the hospitals in which they are created. So this is the broad, philosophy and architecture. And I can tell you that this is a robust architecture which has been proven in a number of digital public goods which our country has created. And I'm sure this will also, transform the delivery of health services in our country. But, and this is a big but, that if we are able to make it happen, if everybody is able to come on the same page, it is not that, for example, hospital A can say, oh, I will create digital records, but I will not share the digital records. But look, this is not your records. These are records of patient. And patient is the master of these records. And therefore, you have an obligation to share these records with the patient. And it is the patient who will decide with whom he wants to share, who he or she wants to share. Therefore, for creating this digital infrastructure, we will need the support of everybody. And I'm sure all the participants who are there in this conference, which is basically Digital Health Summit, and it is going to recognize the people, the persons and innovators in this space who have created wonderful applications. Now, this recognition will actually give a further fillip to the this journey of digital health. And I want to compliment IHW for basically making it happen. Thank you once again, friends, and have a very good conference ahead of you. Thank you.
Thank you so much, Dr. Sharma, for first of all sparing time from your busy schedule today and sharing your thoughts, and also the grand glimpse of the wonderful work which is being done under the Ayushman Bharat Digital Mission. This is something which I think the whole industry, all of us are enthusiastic about, because this is what is going to be most critical in ensuring that the delivery of health reaches to the last mile, to the last person at the row. So thank you so much, and thanks to all the the people in the government of India, and also the Prime Minister for his visionary leadership for ushering in the era of digital India and digital health. Thank you so much, sir. So let's begin our discussion for this, and I think Dr. Sharma has set the tone for the discussion. What he has also tried to kind of convey that, and which I also feel that we have to kind of demystify, dejargon the word digital health. When we talk about digital health, many times or sometimes we forget, we think about those gadgets, the technologies, those interfaces, and we forget that this is about delivering the care to the people, the ultimate care, saving lives. I mean, so ensuring that people who are in pain, we are able to kind of bring relief to them. So let me just begin with a small imagery, and this is related to a 2009 movie, Three Idiot. I think all of you would have watched that movie. And if you remember a scene in that, and which was quite emotionally charged scene in the movie, when Rancho or Amir Khan is kind of assisting Mona Singh in a relatively complex, Kareena Kapoor, apparently a doctor from a remote kind of hospital, remote within the city. And you can understand that when it comes to delivering care, sometime it doesn't matter which part of the country you are. Even being in the middle of city may not make you access the healthcare when it is needed. A city like Delhi, Mumbai, if you get some real, kind of emergency, and you may not even to be able to navigate a city road on time. So what I see, almost 12 years back, much before what we saw, in COVID, and, all that digital revolution which happened, we started consulting doctors online, we started consulting doctors on phone, we started getting so many health, kind of support digitally. 12 years back, when we saw that scene, I think many of us would not have, it might have been, something distant. Now, fast forward to 2022, I think what we need to achieve is the same kind of scene. Only change has to happen, that instead of a normal guy, rancho, a technician, a healthcare worker, a trained healthcare worker is helping, performing any kind of treatment, including maybe the what which was portrayed in that. And also on the other side, the doctor may not be in the same city. The doctor may be sitting maybe 500 kilometers away in a multi-specialty hospital, and guiding that treatment at a remote place. That is what I think we need to achieve when it comes to digital healthcare. That's the way I look at it from a very layman point of view. So let me begin with the the lady in the panel. So Swati ji, I was seeing the wonderful AV of your Optum, which is your United Health Group company, and it's the message is that we need to kind of understand, sensitize with each and everyone, and try to kind of bring care, relief, and support to everyone. It's health is very human, and digital and technology is like very sci-fi thing. How do you see that both of them amalgamating in India and trying to achieve what we are trying to achieve, is to deliver the care to everyone, everywhere, and anytime it is needed?
Yeah, thank you. Thank you, Kamalji. And, thank you, IHW, for actually giving me the opportunity to share my views and Optum's views. And of course, I'm here to learn from the panel and from the audience. This is a very pertinent subject. And this is a subject that touches everyone individually across industry, whether they are in business, not yet working, or anything. So, this couldn't have come in a more opportune time. But coming to your question, right? So healthcare, you're right, is very humane. It is about the experience that a patient goes through. It's the experience that the clinician has, so that he or she can actually give better value to the patient. So the entire healthcare ecosystem is something that needs to be very resilient, interoperable. That means access to all, in addition to, of course, being interoperable, and bringing in that agility and scalability. When you're sick, you don't have time, right? And the entire system should be able to build that trust and that value within the patient. And if you saw the Optum, video, one thing that stands out is that every patient should feel very happy about, hey, I know more about myself today and my health, and I really value health. And the entire ecosystem works towards that. COVID stressed healthcare infrastructures across the world, and definitely in India. I mean, we fought strong and hard, and we recognize that there are gaps in the current healthcare infrastructure, and we need an ecosystem that is not only agile and scalable, like Dr. R.S. Sharma spoke about. It delivers high quality healthcare, delivers trust, right? And also is very affordable. Medical inflation in India jumped at its highest in 2021, and it's so easy for healthcare costs to just skyrocket. Many people did not fall sick because of just the sickness. It was the sheer shock of their, lifetime finances going down the drain. So we need a system that is almost like a living, breathing ecosystem that brings all aspects of healthcare together. So it's not only the medical community or the providers, it is the insurers, it is the seamless payment systems, it is all those smart tech professionals who will bring in tech innovation in this digital decade. We recognize that the today's healthcare system and future healthcare system is anchored on digitization because of the advantages of access, quality, and affordability. So my view is this, right? So when we look at India, we went through stress. We actually stood up to the challenge, but we need something that very easily and seamlessly manages many more pandemics, manages individual whole person healthcare, right? And also ensures prevention of health issues in the future. So it's all about empowerment. And here I would say that we are a country with a very smart startup ecosystem. And this decade should be the decade of digital health innovation. The second thing, if I may just add, is that we are also a hub center for healthcare, health data services to the world. Our IT services industry is very vibrant. And here I would like to caution policymakers that when it comes to healthcare data, which is going to sit central to this whole revolution or a transformation that's going to take place, it's very important that policies are sensitively made to ensure easy access yet deep security, ensure convenience and cross-border movement because medical and healthcare is universal, but at the same time, ensure that citizen trust is not broken. And in the same vein, we have an opportunity of becoming the world's biggest hub center for healthcare data processing. And here, when it comes to healthcare data and the trust that other citizens and countries are putting on India, it's important that our policies ensure that their laws and their policies of different countries is anchored on their citizens, and we should not impose anything additionally. So in summarization, this is the digital decade for healthcare. Healthcare innovation is most critical. Our everyday, we are a country of scale and depth and intensity. And the ABDM objectives, which by the way, I'm a big fan of, right? So if ABDM is deeply successful, India becomes a case study to the world and to all those developed countries that can actually learn from us. So
Absolutely. Thank you so much, Swatiji. So we need a system which is enabling, but at the same time is able to deliver empathic, care to the people, because and without breaking the trust, in the long run. Sunil ji, your kind of NIC, some of the wonderful products or applications have been delivered by NIC, whether it is Arogya Setu, whether it is many other, kind of applications. The recent one is the e-hospitals, which is, I think, kind of one of the very important component for ABDM as well. How do you see that? What Swati ji is saying, that the care is something very human. Technology can kind of facilitate it to reach to more people, to reach to them faster, to reach to them maybe even much more kind of affordably. But the care remains, of the same quality. So apart from what you are building as a infrastructure, as a technical backbone, as a kind of base for it, how do we also kind of ensure that the quality, the care, all these things are also retained and continue to reach to the people?
Thank you very much. Am I audible? So we are working on two simple points as far as health is concerned. One is to create the electronic health record of every citizen of this country. So that is the objective, and in order to achieve this objective, we are developing a lot of applications. That is objective number one. And second is, we are not developing only applications, we are converting our applications into service. So that I think if patients are not benefited by the applications, so application within the government has got no meaning until unless it is utilized by the patients, by the normal citizens. So service on one hand and electronic health record on the other hand. And electronic health record not for one or a few patients, it is for all citizens of this country. So to achieve this objective, we have two kinds of products and applications available in NIC. So first is basically we develop products. So we have a e-hospital suite. And the second product is Arogya Setu, I think. And e-hospital suite is basically it's a product which has 5 applications. One is e-hospital HMIS. Second is ORS, online registration system. So it is for the patient. It's a patient portal. It facilitates about taking the appointment from the government hospital like AIMS and NIMANS, RML. You can take appointment using ors.gov.in. And third application in this is e-blood bank. It's an internal functioning of take care of internal functioning of the blood banks. And the fourth one is e-collab DDS. It's a remote. It's a remote say radiology, teleradiology we used to call it, e-collab DDS. And the fifth one is telemedicine. So these 5 applications, they have been clubbed together to make e-hospital suite. And we have implemented these applications from PSC, CSC to medical colleges. So it takes care of all kinds of hospitals. And about more than 700 hospitals are already using these products. So my experience with this is, now let me come to the policy part of it. The government of India came up with the one electronic health record standard, EHS standard, in 2016. And in 2017, there was metadata and data standards for health sector. 2018, there was National Digital Health Blueprint. Out of that, 2019, National Digital Health Mission. Then in 20, ABDM, Ayushman Bharat Digital Health Mission. Now we have a set of APIs which are in the form of ABDM building blocks. So I'm happy. I was part of this my National Digital Health Blueprint say activity. This report was prepared. I was party to it, and I think 5 blocks which Dr. Sharma has mentioned, and they have been put on ground. Now, how this has helped? These are set of APIs. It is nothing. There is no. There are reference applications or set of APIs. Now, these APIs cannot be utilized. We cannot have integrated electronic health record of every citizen of this country until unless we integrate all of our health application with these 5 building blocks. So we have every application which is being developed by NIC, including e-hospital, CGHS, reproductive and child health, and other applications. They have been integrated with the ABDM building blocks, meaning thereby every application facilitate creation of ABA, Ayushman Bharat Health Account. So each individual, whether it is rich or poor, if they approach government for interaction with these applications, if you go to say ORS portal, so you can create your ABA ID from there also. So it means the creation of ABA ID has been facilitated by all the health application developed by NIC. Once this ABA ID is created, if it is available, then it has to be linked with the health record. So our software, all our software, they facilitate, they have been integrated with ABA, and ABA is being integrated with health record. That is the second stage. So milestone 1 is creation. Second is integration of the ABA with the health record. And the third one is very important, which is the ultimate objective of this ABA building block, and that is sharing of health record. So suppose I have a record in AIMS, then I go to RML, then I go to Nimans Bangalore sometimes, suppose I am able to see my health record in electronic form in any of the ABA app, which is being developed by private sector as well as by the government sector. Now, Ayushman, Arogya Setu is not a tracing app. It has been withdrawn because there is no COVID, so there is no tracing. So if it is not tracing, so we have converted this Arogya Setu app into health app. It means you will be able to see your electronic health record on Arogya Setu. So you can create ABA ID, you can link your ABA ID, and you can share your health record or see your health record across multiple hospitals. That is most important. Unless you have that, and ABA facilitate that. And it is because of the Ayushman Bharat Digital Health Mission building blocks, 5 building blocks, which Dr. Sharma has mentioned very clearly. And we are working on UHI, Universal Health Interface. And I think that will change the service part of healthcare. So there are so many things. So let me ask, there may be some question from the participants. So let me take rest and
Sure.
go to Anurag.
Thank you so much, Sunil ji. Yeah, important. These building blocks are important to deliver what need to be delivered. Anurag ji, Swati ji also talked about that the system which we are building has to be resilient enough to kind of make us sail through many more pandemics. Actually, the country of our size and our status or where we are as of now, if we see these pandemics going on simultaneously always. So we see, if we pick up any of the disease area, maybe cancer, it's a pandemic in itself. More than 8 lakh people die in our country every year. Most of them because it is diagnosed very late, or if they are diagnosed, they don't get the treatment, on time, or they are not able to afford it. Now, to make that change, we need the policies which can, kind of create it in a manner to address all these major pandemics which are going simultaneously in our country. And to make the policy, we need data, we need evidence. We lack in data. How do you see this entire digital revolution, which Sunil ji is, kind of building bit by bit? Dr. Sharma talked about those 5 major blocks. All of, I think the entire sector is contributing to it with this being a, kind of an open platform. This is going to be a revolution for data as well. We are going to have a lot of data to actually understand where we need to kind of bring that intervention. How do you see that changing or shaping the health policies going forward?
Thank you. I think, let me go back to your story, right? So you mentioned the 3 Idiots story, right? So if we have to solve that problem and we need to also generate data in the process, right? There are some fundamental requirements. So if you look at where we are today, government has created wonderful highways for digital health ecosystem to be enabled, right? So we have the Ayushman Bharat health accounts. We have close to 23 crore health accounts which have been open till date, right? So that is an enabling block. The health facility registry, the health professionals registry, which is providing credible sources of information on facilities and doctors, that is also there. But if you look at, the highway is there, but the roads are missing right now, right? So if you look at the construct of Indian healthcare market and you look at the number of healthcare facilities in the country, there are only a handful of large corporate hospital chains and private sector hospitals which are onto the journey, right? And Sunilji mentioned about 700 private public sector hospitals are using technology today. But if you look at the overall universe of the problem that we're trying to solve, there are thousands of PHCs, CHCs, the small single doctor clinics that are yet to embark on the digitization journey, right? If you look at what we need to do, we need to make sure that these people are also able to come on board. Now, this requires a bit of policy change, additional funding, as well as innovation from startups and technology players. So I would like to maybe look at 2 separate problems that we're trying to solve, right? If you look at any small setup, any small hospital or a clinic, they don't have the wherewithal to procure technology, right? It requires huge capex investments. They would need to buy a server, maybe set up a server room, etc. They'll need to buy a software, and they'll need trained manpower. Now, today, if you look at the market solutions available in the market, these are very expensive solutions, requires a lot of capex investments, and I don't think any small clinic can afford to deploy these kind of solutions today. So to solve that, what we need is a SaaS-based offering, which is as simple as buying a Netflix plan, right? If my nearby clinic can buy a subscription and get onto the digitization journey, start getting referral business, right? Ultimately, what they bother about is how this technology is actually impacting their business. So if they, let's say, get this subscription and they get more business coming in from the market, any clinic or any PHC or any small facility would be very willing to invest into technology. The second problem which I generally see is there is a lot of resistance from the doctors also when it comes to technology, right? They are not very willing to generate EHR, EMR when it comes to any large hospital. So we have to simplify technology, right? I think one of the challenges that we have seen is most of the solutions today, they are not mobile friendly, right? But if you look at the mobile penetration in the country, it is far more than the internet penetration. So if we can enable solutions and make them mobile friendly, make it simple for the doctors to at least quickly do an entry, right? Because they are treating hundreds of patients today. So for generating that data, if you don't enable mobility, I think we'll not get there, right? And I have seen a lot of interesting solutions in the market, which have been deployed at least in good reputed private sector hospitals. So the same story has to be replicated for public sector hospitals also, right? So Sunilji is making so many efforts to make sure that hospitals come onto this journey. But I think if we have to make it affordable, accessible, and also make it simple for the doctors and users to come onto this journey. And the policy environment has to be supportive, right? So NHA had published the health data management policy, but it pointed to the PDP bill, right? And PDP bill is taking some time, right? We'll have a new shape and form for the PDP bill. So we need a regulatory environment also to make sure that data is handled in the right way. And we follow laws of the land and make sure that data is not misused when it gets generated. Thank you.
Thank you so much. So you mentioned about, again, the interesting imagery here is parallel. The highways are there, the roads or maybe lanes or maybe, the small connecting streets are missing. need to be built further. But we saw a very interesting, kind of experience, and especially when it comes to COVID vaccinations. So we had a highway, which is, let's say, your COVID app. We had, a very strong and very, I think, robust public-private partnership when it comes to, kind of delivering the vaccine to the people. And we also saw a wonderful mechanism of health records keeping, so you pay accessible certification at every, all the time. You can easily kind of get it in your DigiLocker, you're from Coben and all that. Seeing that as a very, kind of effective, experience, and or the, kind of activity which actually took place. Swatiji, how do you see that, this entire technology piece, public-private partnership, and also, kind of the right policy push to, kind of achieve it? Because when it comes to, delivering the care, apart from technology, I think, like the same we saw in the space of vaccination also, a lot of skilling is also important. One of the, kind of roadblock or a hurdle Anurag ji mentioned about that, even many times you don't find the healthcare providers being very enthusiastic about adapting to the new technology. So how you make them the, the entire ecosystem get into this, kind of technology highway with the right kind of movement and with the right and mile, connectivity, and are able to deliver the care as well.
Yeah, and a very, very important question. So during COVID, our country went into mission mode, right? Everyone came together, the government, the private sector, in fact, the citizens too. And all this brilliant stuff got created. But the fact remains is that we did it during crisis. So now, with what Dr. Sharma is saying, what Sunilji mentioned, right? Now we have to concentrate on the fundamentals and go really deep and wide on that, which means that we've got to get our country into 100% health ID environment. And whatever it takes, which means a little bit of a carrot and stick, but get everyone onto the Aadhaar ID, get everyone to invest in ensuring that data depth exists, right, in our system. Because if we don't have the detail of the data, then all that we are doing in terms of digital enablement would actually go for a toss. It will just remain as a superficial convenience. So we've got to concentrate on ensuring the way we collect, store, manage, and analyze data, and of course give access to data, is where it needs to be anchored there. Convenience and security both together. So 100% health IDs of our citizens. Every day they are born, I think they should start with their health ID. You know what I mean? So second thing is keeping health ID very, the EID, if one would call it, to be very easy and convenient. And I think ABDM is already on the right track. The simplicity in the citizen utilizing and owning that, the access is something that's very critical. And of course, more awareness is required there. But the reason is that with healthcare being universal, a doctor in this hospital would want to, let's say, reach out to someone in Denmark or Germany or some other part of the world and say, hey, I'm just sending across the diagnostics. Please take a look at, whatever, there's a rare disease that is coming up. So the agility of the data, the convenience of the data is very important. Finally, of course, as a part of the building blocks, the National Health Authority playing a very critical role in building the trust with the security required. And that's where policies and all that come into play. Not only the NHA, but the way data is secured and sensitively handled in the country. And I'm emphasizing on this again, because it's not only about our 1.4 billion people and growing. It's also about India becoming a trusted partner to the world of healthcare data. And our policy has to follow or rather partner with global standards of like a HIPAA, the HIPAA standards, or for that matter, security standards, where there is, easy movement of data. And I think all countries need to come together and sign on something to say, hey, healthcare data, healthcare universal, human beings are going through, all kinds of issues. And let's try to understand how to solve for it. That's one. The other thing is going back to healthcare innovation, artificial intelligence, so many other, digital technologies where we need to not only concentrate on let's come up with the technology of AI, but really involve the clinician with the technologist. They really need to be tied to the hip here. And that's where there needs to be almost platforms that make them partner very, very comfortably. The government can play a big role there actually in bringing this cross-industry kind of, skilling. So with AI, it's not only about technology, it is about the clinician playing a big role in ensuring this is how the data needs to be captured. This is how we would want to see how we can diagnose it, so that AI, when it brings in the concept of scale and therefore decisions around it, it's actually thinking like a doctor and not thinking like just a technologist. Technology is just an enabler. These are just words of caution. Yeah.
Thank you so much. Very important point you kind of mentioned in that, and I just want to do a quick dipstick here, if all of us, kind of allow me. I think all the people at the audience, everyone has their Aadhaar card, Aadhaar IDs. Everyone, I think, yeah. And most of you are using UPIs. All of you must be using. How many of you have Aadhaar ID? 2, 3, 4, 5, 6, 7, 8, 9, 10. There can be some camouflage also. So, apparently, I think it's still as a people, but yes, thank you so much, all of you, those who have created their Aadhaar ID. To be very frank, I haven't created yet. So I need to do it today, maybe. Yes, so I think there is a lot of gap in terms of awareness. So we are talking about the digital health, revolution, everything is getting digital. We are consuming digital also a lot. But at the same time, when the government is coming up with something like this, which is going to be so critical in kind of, so we never realized when Aadhaar was introduced that it is going to become the, the kind of the most critical thing for doing everything in your life in future, maybe, from bank transaction to getting a driving license to even getting a admission in a hospital, anything and everything is now being done. Or maybe tomorrow, even a movie ticket will come on your Aadhaar ID. So, but the same has to be, kind of started to be understood about Aadhaar, because that is where your, the health care, which you expect, which you, require, and which you want that support around you, and you want the easy access to that is going to be coming through that. So that's one thing. And it's a very good suggestion, Swatiji, about that. Why not create a, Aadhaar ID or, health ID at the very, time of the birth certificate when being issued, or maybe your birth certificate itself become your, health ID. Sunil ji, keeping in that mind, you are building wonderful things, and you are facilitating that everyone should get a easy, kind of inroad to get Aadhaar, kind of health ID, is able to store their documents, kind of in electronic health records, and are also able to, kind of access care through e-hospitals and all that. Just seeing this small dipstick, which I, did here, how do you see the participation of the people? Now, and especially, and so when I asked about Aadhaar and UPI transaction, COVID has a lot to do in that, especially in the UPI. Now UPI has become a global phenomenon. I mean, with the, we have something which is the United States asked, their government that do something. Google wrote to US government to, do something on the line of UPI. So that is something which, we are really generating something global, and I'm sure we are going to generate something really global in the digital health space also. How do you see this, kind of adoption of the technology?
I think very important question is, why do we create ABBA ID? We are not creating it because we are not getting any service out of it. Let me be very blunt on this. So we have introduced, with the help of NHA, with the help of ABDM, we have introduced one of the very simple service out of ABBA ID. So again, UPI, it is, you go to Lady Harding Hospital in Delhi. There are standees, there are QR codes displayed at many places. Create ABBA ID, download any ABBA app, PHR app, personal health record app. There are many from private sector as well as from ABDM. And scan that QR code in that hospital. If you happen to go to any of the hospital, just scan that QR code, and within few seconds, you will get the queue number for registration, and you sit down. Need not to worry. There is a TV display, and your counter number and queue number, it is displayed on the TV. Just go to counter, tell the department in which you want to go. You need not to tell your name, age, date of birth, address, anything you need not to tell, because already has been captured through PHR app. You have to tell, I want to visit I department. That's all. You have to simply say I. Then register, OPD slip is in front of you. So this kind of service has been, so we, since our 700 hospitals who are using e-hospital product, we have enabled our software. We are replicating this service of LHMC in other hospitals also. So that is number one. So that is the reason you have to create your ABBA ID, so that in future, if you go to any of the hospital in Delhi or outside, you will be able to avail the flawless service, at least OPD registration. Similarly, you can create ABBA ID on ors.gov.in, create your ABBA, you need not to enter time and again. You can create your ABBA ID for all the family members also. You can book the appointment for your family members also. So family record will keep on, creating at one place. So this way, this ABBA will definitely.
Thank you so much, sir. We are a little running out of time. Okay.
No, just a minute. I would like to give the answer to Anuragji's query also.
Okay.
This is, see, until unless you understand,
Yeah.
you have ABBA ID, you cannot understand what we are talking about. That is why I am saying. So Anuragji is taking Anuragji's question forward. The important is, we have come up with next gen e-hospital. So all the PSCs, CSCs and small hospitals, what they will be onboarding onto next gen e-hospital like creating the Gmail account. So we are simplifying the procedure. And then next thing is, we are using AI also. We have done a small experiment. Let me explain. It's say we have trained the AI model with 30,000 chest X-rays of TB patient. And now, if small digital X-ray is basically uploaded using AI model, it will tell you whether you have TB or you don't have TB. And similarly, we have trained the model with the 50,000 cuff sound. And we have come up with one API which has been integrated with the eCollab DDS. You upload, there is a small app coming up with the mobile app. You put your sound into it, cuff into it, and you will get the idea whether you have TB or not. So madam was talking about AI. So we are in the process of creating small application where the blockchain, AI, and blockchain, I think it will come very soon, because we will be we have to have a trust onto the health record which we are storing in the e-hospital.
Certainly. Thank you so much, sir. He's already on the podium and kind of nudging me out of the stage. So let me quickly, Anurag-ji, closing remark from you. The last point which Sunil-ji said is about building the trust on the health record, which we are going to keep, and all that data which is being generated. A quick one: where is this distrust you see, and is that the reluctance? There is any kind of possibility of this data breach which is keeping people out of this ecosystem as of now, or this is more of a kind of a policy thought process? It doesn't matter to the people; they will be equally kind of be open to be part of this whole system.
Yeah, I think there are two ways to look at it, right? Why are people not generating health records, or why are health records not getting generated in general, right? So while large hospitals like Apollo, Medanta, everybody has technology, right? But still they are yet to contribute or start contributing to the health record journey. So I think there are two ways to look at solving this problem. There could be a carrot approach or a stick approach, right? In terms of stick, maybe the government would mandate, that you have to use a compatible solution which integrates with the ABDM ecosystem, right? That could be a stick that can come from the government. The other approach, which is much more convenient and which will have a better impact, is the carrot approach, where we start providing incentives to the participants, right? So if you look at the US model, there was financial incentives which are provided for generating electronic health records. Maybe the government can look at that, and we have done that successfully in payment side. So at least for a small duration, if government could also look at providing some incentives for creating electronic medical records, that could be one way. Secondly, what we can also look at is expand the definition, right? We are currently looking at only treatment, etc. Can we make it a wellness-oriented program? Can we gamify, some of these initiatives? So we have seen a lot of corporate programs where people have, step challenges, etc. So if we can gamify it, make it much more cooler for the young generation also to participate, and we'll have far more startups coming up and creating compatible applications, right? So that is my two cents on it.
Thank you so much. So thank you all, panelists. I'm not going to take much time in summing it up. I think all of you spoke, very much in self-explanatory manner. And this is something which is, digital health is, the digital is the medium, as Dr. Sharma also said. This is what the health is something which we all need to work for, which is, the health services are something which is critical and should be accessible, available, affordable to everyone. And that's what this entire, I think, Mahayagya of digital health, which the country is, kind of undertaking, is meant at, is targeted at. And we at IHW Council definitely try to, kind of support and assist, like all of you, in the Western industry and the ecosystem supporting this a great initiative, which is going to change the future of the healthcare in our country. Thank you so much. Over to you.
Thank you so much, Mr. Narayan, for understanding the hint also. And thank you all our esteemed speakers for sharing such wonderful, valuable insights on the digital health footprint of India and our national mission. We would like to commemorate this occasion, and may I request our moderator of this session, Mr. Kamal Narayan, to kindly present a small token of appreciation to esteemed speakers. We would like to present a small token of appreciation, starting with Ms. Swati Rangachari. Mr. Sunil Kumar. Can you have the lights on, please? And Mr. Anurag Saxena. Thank you all, and it was really wonderful to have such an esteemed panelist upon the stage. Thank you so much for your insights. And now moving on, ladies and gentlemen, we're going to have our very first panel discussion on the topic Smart Digital Health Mapping of the States in India. Post-COVID-19, digital health technology has penetrated large parts of urban as well as the rural parts of India. There are government digital health initiatives as well as by the private companies that are working towards the accessibilities of better healthcare through various new digital platforms. However, the issue of accessibility and awareness amongst regions becomes important to ensure the success of these initiatives and schemes. Our very first session will bring together the relevant stakeholders to discuss the impact of digital health schemes as well as other digital health platforms, their implementation, their impact on each state benefiting common people, and identify the opportunities, prospects, as well as the challenges of inclusion and accessibility for the growth of digital health ecosystems in different states of the country. Ladies and gentlemen, to begin with our very first panel discussion, allow me to invite upon the stage our moderator of the session, Mr. Prabhat Sinha, Director, Public and Government Affairs, Boringa, England, India. We can do better with the round of applause, ladies and gentlemen. It is just the beginning of the morning and I need all the energy for the entire day summit. I would also like to invite upon stage our esteemed panelists for our very first panel discussion. Mr. Naveen Kumar, IAS, Special Secretary, Department of Health, Medical and Family Welfare, Government of Andhra Pradesh. Dr. Hira Lal, IAS, Additional Health Mission Director, Government of Uttar Pradesh, who would be joining us virtually. And we also have Dr. K. Madan Gopal, Senior Consultant, Health, Niti Aayog. And Mr. Neeraj Gupta, Founder and CEO, Genes to Me. I can hear the round of applause only from the members of the first table. How about, yeah, that is much better. And now I hand over the floor to the moderator of the session.
Good morning, everyone. And so first of all, today is a day for two things we remember, that this second digital summit is happening, and today is also a World Standards Day and also World Dessert Day. So don't forget to eat some desserts during the lunch. And so I think after a wonderful, a session which gave us a vision about the National Digital Health Mission and a lot of highways. So I think today we will also use two highways to go to UP and also Andhra Pradesh, where a lot of these policies we see going executed. And that's why I have two panelists. One, a very senior administrative officer from UP, who will be, I think, Hiralal sir will be joining us virtually. And Mr. Naveen Kumar from AP, who also have worked in UP. So one state which is new, another state which is a state which is known for its scale. We also have Mr. Madan sir from Niti Aayog, where you see all these cross-functional things happen at this center. And also we have Neeraj ji from Genes to Health, and we know how diagnostics plays the first step role in the healthcare. So a very esteemed panel. And so what I'll do, I know Madan sir, you have to go a little early, so I'll start with you. Now, once we heard about this entire vision of using digital, as Dr. R.S. Sharma said, is a means, it is not an end. It's a tool, but ultimately it's the health of our people and how we optimally use digital as a tool. Now, you talk a lot about equity, you talk about accessibility. Now, how you see a lot of these platforms, mediums, what we create, when it comes to equity in healthcare, reaching out to the last mile, and also plugging and play at the across the country, what is your vision, how you see this is happening?
Thank you very much. Thank you for taking me as first of your panelists. So I thought that you would be starting in the digital age on time, but as usual, we have to adopt the digital thing in a long way. That's one thing. But if you look at the healthcare scenario, healthcare services in the country, it's free for all. Each and every citizen, they can access healthcare. That means in the public institution, you, me, a lower income person, they can access the services there. There have been emphasis on improving the access, right from the Board Committee report, which talks about having a 2,000 bedded hospital in a community at the community level. Having said this, if you look at the progress of addressing the access issues, if you look at the demographic structure, it's still 60-40 differences there. That is 60% in the rural area and 40% in the urban, and the urbanization is happening. But the addressing the access issue, you see the how far we have access. Access include three things. One is provisioning of the healthcare. The second is utilization of the healthcare. And what is the status of the health which we have attained? These are the three things which determine the access of healthcare. One of the important things in the access, if you look at the public structure, because in India, after the liberalization during the 90s, you have seen a lot of private sector coming up. But before that, it was the government structure, and you see, you have a structure right up to a village level. Primary care, because being signatory of Alma-Ata Declaration and subsequent Millennium Development Goals, Sustainable Development Goals, and universal health coverage, we are having an approach that is comprehensive primary care approach. In that, we have created a structure through which preventive, promotive, and the other services are being provided. That's the first pillar of Ayushman Bharat, which we have been talking about. That means, if you look at the structure, at the section headquarters, that is, you are having sub-center, then you are having a primary health center, you are having community health center, then district hospital, medical college. That's the structure there in the system. That means a sub-center, which is now been upgraded as health and wellness center, that caters to a population of 3,000 to 5,000 population. It provides a range of services. Previously, we were providing 6 range of services. Now, people can access 12 range of services through this health and wellness center, that is upgraded sub-centers. The first contact with the medical officer is at the primary health care center. That kind of access things are there. When we were talking about the health and wellness center, when the sub-centers were upgraded to your health and wellness center, there was one component of using IT technology for leveraging or improving the more access to the services. That was the vision during that time. And it formed the first pillar of the Ayushman Bharat, that is the health and wellness center. That's apart from that, for increasing access, because creating infrastructure is a very long term and a cost intensive thing. And second thing, that any health event that is associated with some catastrophic cost attached to that. To address that thing, the second pillar, that is the Ayushman Bharat Kpmg program, is there, which provides an assurance coverage to around 10 crore families. But if you look at the population which is covered, because many of the states, around 11 states, they have universalized the scheme, so that the financial catastrophe due to the health events, that is also taken care. Why the primary, preventive, promotive, and this services are being extended to the health and wellness center. And the financial catastrophe for this set of population is addressed through the PMJ program. After the COVID time, you see that there was a need for digitalization. So you are having the third pillar, that is Ayushman Bharat Digital Health Mission. And there was a felt need for having a impetus on focusing on the infrastructure. We are having the health infrastructure, PMAB, that is known as Ayushman Bharat Health Infrastructure Mission. So these are essentially four pillars of Ayushman Bharat, in which we are working, trying to see that how the access issues are addressed, how the healthcare is then made more affordable, how the catastrophic events leading to the expenditure of the people that have been taken care. Regarding the access, the question which you have shared earlier, regarding the access, these are all manned by people. If you look at the health and wellness center, you are having a mid-level service provider there, who is known as community health officer. It's essentially from nursing background, or he would be, each person would be there. At the primary health center, you are having a medical officer. And at the community health center, the first level where the specialist services are available. That means for 100 villages or 80 to 120 villages, you will be having a specialist care with 4 specialized services, which depending on the population norms, you are having first referral unit, which provides emergency medical obstetric care and the other emergency care. But at that section level, connecting the section to the villages, you are having community health volunteers who will be helping the community to access the services of the system, so that the access issues, as I mentioned, that provisioning we have done, but utilization of that services have been affected by your ASHA worker, accredited social health volunteers, active workers. So you see the utilization is also this. After the access and the provisioning, access and the utilization happens, then you see the goals of the healthcare which have to be attained. I will stop here. Thank you.
No, so I think you brought a very important point, which is ultimately at the primary level where, and it also connects with the other pillar of PMJY, which is health and wellness center. And how do we connect and detect disease early so we don't have much load at the health center to treat. And I think this also takes me to Naveen sir, because a lot of Naveen things are happening in AP under your leadership. And if you can, and 2 things. One is, recently we have heard that in AP you have started e-registry after making cancer a notifiable disease, and this is a breast cancer awareness month, and which is a wonderful initiative. So if you can talk a little bit about e-registry, and also we also heard about startups. We also heard that we need not to create everybody a new thing, because there is a lot that exists and a lot of young minds are doing that. So on these 2, what would be your sharing with the audience?
Thank you, Prabhat. What we try to do in what are we looking at? What is that digital health is trying to do in any state for that matter? You are a tool to give a healthcare to everybody, right? That's the agenda. It's not just when we start talking about digital health, we always think that digital health is the end of things. That is now not how you approach the healthcare. When you come to healthcare, although it's called digital health, digital is a tool for providing healthcare. That's actually how you look at it. So there are 2 examples which I wanted to speak about. One is that he was talking about cancer registry. If you look patterns of disease across the country, across the globe, there are only 4 diseases which constitute 65% of your disease burden, which is cancer, cardiology, diabetes, and hypertension. These are diseases which are preventable. Remember this one. These are diseases which are preventable. When you do an early detection, and treat them aggressively. For example, cancer, you detect early. I think many of us in this room would have had somebody who had suffered from cancer or not. So these are things which we can actually look at. So we have an advisor to the state government. We actually have a specific advisor to state government, Dr. Dhoni Dattaraya. He's a US-based doctor who has been advising on comprehensive cancer care. When you ask me as an health secretary to Andhra government, you ask me what is the number of cancer cases in Andhra Pradesh, I would not be able to give you a number at all. I can only give you a range saying that it is somewhere between 55,000 to 70,000. I think Nitya also would agree with me on this one. Why is that we are not able to tell you this number accurately? Is that we do not have a system of registering the cases which are coming to us, right? So that the first and foremost thing which we have to do in cancer is we need to know where are these cases coming from, what are the kinds of cases which are coming from, and what is it's more of a scientific study, right? So you need to understand this one. So that's the reason we made it as a notifiable disease. And if you had seen, there are only 2 successful cancer registries in the country. When I say successful in the sense, it is run by people with a lot of statistical mind. One is the Adyar Cancer Institute, and the other is the RCC at Trivandrum. Yes, the Tata Memorial also runs a very good, strong the cancer registry. So learning from them, we also knew that digital can be used to identify this one. We have AI, we have fuzzy logic, we have machine learning, which can be used to understand these registrations which are happening. For example, the diagnostic center also will register a case. The doctor number 1 who is treating the cancer for the cancer patient for the first time will register a case, and doctor number 2 will register. But the data would be different. You see, when you see the data points, it would be very different. Somebody has to sit through the data points and see that these are diverse data points, and somebody has to have a mind. So if you sit through 70,000 data, 70,000 cases in a year, and for that, the data points would be in millions. So we should use digital to, we should leverage digital to, digital technology to, do this analytics. That's why we are also looking at establishing India's first digital cancer registry. So AP government will, in fact, we have already gone through our Registry data to find out what kind of cancers come across which regions. If you ask me, I can, maybe not in a very bold tone, but I can always tell you, okay, these are the cancers which would come in the northern Andhra, which is more related to oral cancer. We have some GI cancer across the 2 districts of Andhra Pradesh, which is Krishna and Godavari. And these are the things insights which keep coming. So what happens when you have specific insight, when you talk about healthcare in the future, it is also, we talk about something called 2 parts in healthcare. When you talk about healthcare in the future, we talk about predictive care. When you talk about predictive care, you also think that how can you go, reach before it starts. I think that's the future of everybody sitting in this. What the lessons we learned from COVID is, how can we predict that something will go wrong and start building on it, not after you get hospitalized, right? So that's something, the biggest lessons we learned from COVID. Second would be precision medicine. And this would become very, very important given, I think we are talking about cancer, there is something which is also, lurking in the background, which is called antimicrobial resistance, which would be the next big killer. I don't know how many of you are aware of it. The excessive use of antibiotics will lead to AMR. So these are things which are upcoming. So there are 2 things which would help the digital technology, and the use of digital technology in healthcare would be to create a bigger space for predictive care and also the precision medicine. And when I talked about NCD care, there is what is NCD care? We all take supplements, we take some medicines which on a daily basis. One of the protocols which you need to take care of yourself when you have a non-communicable disease like diabetes or something, adherence to the medical protocol. So there could be digital follow-ups, and that is how, and home care will increase. I think when you talk about the healthcare continuum, home care is going to increase. You're already seeing it. There are services which are coming in the digital. I think there are startups which are already started providing Ola doctors. I think I heard of this name. Some Ola doctors or Uber doctors would start very soon, right? So that is one part. So there's a lot of need for then expanding the continuum, the healthcare continuum. Second, you talked about startups. I thought it's a big topic again. I was told that the current CEO of Roche is the diagnostic head. So there's a very strong message which is coming across the digital healthcare spectrum, is that the digital diagnostic is going to be the most important part. Why is it? There is a connection. As I explained to you, there is a connection between the NCD care. So you need, in fact, I'm told that there is specialized, I see a couple of people wearing a watch with, it also counts whether your cardio activity is in line with what you think or not. And there are some belts, I think I'm told when you go to the gym, you're supposed to wear it, because you know that there are incidents which are happening for excessive stress or whatever you think. So digital diagnostics, not just medical wearables. We are also talking about, consumer wearables. It's like day-to-day life, you will be starting doing wearables. And this space is going to expand. If you ask me, what is that new thing which will happen in the next 10 years of the digital technology? It's not the IT part. It would be more of the diagnostic part involving a lot of IT, data analytics. And this would help us building that what we think as predictive, because when you look at resources, human resources, all limited. I'll specifically use a use case which I always talk about it. I have a digital ECG machine which I can carry to any rural part of Andhra Pradesh. I can pick those signals, I can register that person and record those digital ECG. Now these ECG, normal doctor, when you talk about an untrained doctor, will not be able to pick that murmur, the small murmur which is making sense. Only a cardiologist would be able to pick that murmur. So when you look at it, these ECGs which are digitally recorded can be read by a system which is AI or ML. And these system, they can pull out those 200, 300 records which has to be only seen by a cardiologist. In fact, it could be this algorithm, or we can also send it to 2 cardiologists to make it doubly sure. So these are the ways. And when he is making it and when he is confirming, again the system is learning. So your AI system it keeps on learning, it becomes even better. And it's a typical case study which we are looking at, right? So there are more examples which could come out. And I'm very sure even the lab records can be read by systems and tell, okay, this is how we should. And I'm very sure the digital diagnostic space will change the way we look at the rural healthcare. I'm talking about a rural healthcare. We have talked about how do we connect that rural healthcare. It is not about the people in the cities. It is not about the people who are affluent. When we talked about COVID, we talked about the whole of government, whole of society approach. When we talk about it again and again, we talk about whole of society, whole of government approach. The healthcare must always have this in mind when you are doing something for the public. It is the whole of government and the whole of society approach to take everything to the last man who is standing or the last woman who is there in the rural setup. That's my opening remarks.
Very rightly said. And I think the piece you talked about, that continuum of care, the precision medicine, and also the diagnostic, which we'll hear more from Neeraj later on. But I think continuing from AP, let me go to the state of Uttar Pradesh. And since Dr. Hiralal sir is there, so, and he recently has written a wonderful book, which is going to be a bestseller, I believe. And one of the things that he talked about in his book, and he has been talking, is on governance. Now, in a state like UP, which is bigger than many of the countries, how do you see many of these initiatives which is happening, and also at primary care level, what Mr. Madan sir just shared, training and equipping your health workforce under NHM in UP? What is your vision? How do you see state is gearing to that?
Okay, thank you to our IHW, and I would like to welcome at the outset all the esteemed speakers and audiences.
Sir, currently we are not getting your audio. Now I think.
I'm audible?
Yes, now you're audible.
Okay, so sorry, I wanted to join physically, but it is my bad luck because of sudden some assignments for today. I could not join physically. So as we all know, COVID-19 pandemic destabilized the world economic order. That is the negative side, and its effect will be felt in coming many more years as we are getting news daily. But India's health ecosystem has witnessed a mature transformation in the past 2 years. It has brought down the resistance drastically to adopt technology in healthcare sector. Why? Reason is very simple. During the pandemic, it was the technology which, through technology, we connected, communicated, and cooperated in order to save our life. So it is the technology which alone helped a lot, among other many things. So digitization has opened a new avenue for positive transformation in health sector. What they are, adoption of digital technology is growing at a fast rate, one thing, and new platform for online consultation is growing and increasing day by day, which we know all. And data analytics and data mining is used for the ramping up of healthcare infrastructure and capacity building, which was not in practice before pandemic. So these are the present positive transformation due to pandemic. We always talk about the negative things of any pandemic, but this pandemic has given this positive thing, particularly for the healthcare sector. As regards future healthcare transformation, digital record, we are going to record everything digitally in different schemes, and what will be the outcome of that it will be the real enabler at every level, at worker level, at doctors level, at medical stakeholders level. And this digitized healthcare data will help in facilitate for better treatment, for better delivery of healthcare services in remote areas where we are not able to approach, where we are not able to provide these services in spite of our desire. So that will be a great help through digital technology. Second thing, this digitized healthcare data and record will help in minimizing the time of the diagnosis. The time of diagnosis matters. So that will be minimized and it will help in different ways. And there will be a drastic cost reduction in the treatment. So that is the future outcome of the digitization, for which we are in the process to get it done in the field. One thing I would like to add more, prevention is better than cure. By now, we always talk about the cure. But in the last 5 years, we are changing gradually and slowly our focus from cure to prevention. Because nobody wants to get ill. Everybody wants that we be healthy and happy. And to be that, prevention is one option which is ignored by now, but it is getting our focus. We are reducing our attention from cure and shifting that attention for the prevention. In this, the technology and digitization of healthcare will be a great help to us. As regards UP, we all know UP is the biggest state, vast state, and Government of India is monitoring. Even today at 5 o'clock, we are going to be monitored on the progress of the Kpmg. They have allotted money, they have given all the details to implement in the states. So to monitor the status of the progress, we are continuously monitored by the Government of India so that the required infrastructure, required HR should be in place in coming 5 years to meet our dream, what we are dreaming to provide adequate medical health services to the remote area or the remotest area of the rural. And I hope the way we are moving, the way we are working, the way things are being monitored, it is going to happen and we will realize our dream. So this I want to say. Thank you.
Thank you, sir. And you are also a proponent of model village, Adarsh villager, I think, with integrating some of the digital tools where it is needed more. I think that was a great suggestion, and I'll please be on the line because I'll also open the floor for a few questions. So please be there. Okay. Now, this takes me, so we have heard a lot about digital diagnostics and prevention is cure, especially with the chronic disease, right diagnosis, and also with all these highways and sideways being made. How do you integrate diagnostics, and how do you see ABDM and NHA opening doors for diagnostics in this country and ultimately impacting our lives?
Thank you very much for, first of all, having me and James to me on the platform. It's really a very encouraging scenario for us to share what we have been able to contribute. I think technology plays a very significant role and goes hand in hand with the digital. Any platform we kind of integrate with, and I think technology, but we do have to also realize that 60 to 70% of the Indian population lives in the rural areas and the tier 3 cities, and where it's a very remote, resource limited, and for the healthcare resources as well as for the diagnostic services. And we also heard about the involvement of artificial intelligence in the healthcare, in the digital health platform. But I think this is still far from reality because it's a great technology. It's a future of the technology, I would say. But still, we have a huge journey to go through with a lot of data mapping and correlating with that clinical history of the patients and then implement that at a rural level. And then at the same time also make it versatile for technology to correlate with that platform. So, but one thing which we also got as a positive side of the outcome of the COVID pandemic was the infrastructure that has been able to build across the country at the very most remote areas of the country. I think one of these, the most important technology that has today developed is the real-time PCR technology. So we all did real-time PCR test across the country and this is the only technology which we have a trained manpower and the infrastructure at the every road across the country, I would say, and at the rural level to the urban level. And so how we can leverage this whole network of the resource which we have built during the pandemic, which has proven that the molecular diagnostics was the center stage of handling any advanced based pandemic kind of situation. And at the same time, every state in India has its own set of challenges for various health conditions. Like Dr. Naveen also mentioned about various situations where they have been doing extremely good job with oncology, and so as so many different other burdens. But India is one of the most diverse country genetically across the world, and studying that, how these genes and how genetic diversity we have in our different states can lead to a lot of information. So one of the most important mandate I think we should do using the technology access is genetic mapping across different states. So we, for example, one of the genetic disorder which is very prominent is sickle cell and beta thalassemia. Sickle cell, you will be surprised to hear, in several states in India, it is prevalent to more than 55% of prevalence. And that is also preventable. We heard various initiatives which are around preventable healthcare. So, and how we can leverage this technology infrastructure which is now available. So we can implement variety of solutions, right from cancer to sickle cell, diabetes, or tuberculosis, another women health based program like HPV or HPV, HIV. So these all can be tested at a cost effective manner at the rural level with the installed infrastructure available today in our country. So this is something which is, I think, the way forward for all the integration of molecular diagnostics, genetic based diagnostics, and your different states with the mapping of the infrastructure availability. Another thing which we heard about today was in the preventive and precision medicine. Today, genetics has that kind of a huge insight. And we at Genes2Me today, we have launched a very big solution called Genome Kundli. So we talk about genetic based horoscope of the every individual, healthy individual. And if that information is available, it gives you a lot of insights about a genetic makeup of every different diverse population. And it gives you information about which medicines, which drugs will work for which individual, and they can be treated with a lot more preciseness and accuracy.
So
thank you.
So thank you. And I think before sir you go, I'll take one comment and I go to all the panel member is, while we talk about a lot of promises in future, currently, if you have to put one challenge sitting at Niti Aayog, when you see these digital initiatives getting rolled out, what is that one biggest challenge you see currently everybody is grappling with?
One of the biggest challenge which we have noticed during the COVID times and now also, when the guidelines were released, so a lot of telemedicine consultations have happened. But opening up and having teleconsultation is one thing, and connecting it with the hospital so that a continuum of care is ensured, that's another thing. That's a very severe challenge because these teleconsultations are not resulting into the continuum of care, and how to address that thing. Second thing is how to ensure teleconsultations or telemedicine facilities 24/7 specialists, how to aggregate all these small players so that the person need not to invest, saying that the person, if somebody is in Gujarat and the person is in Assam, he want to talk in Gujarati, he can connect to that. That kind of aggregation network should be created. That's the biggest challenge. How to do that, we have to see. And biggest challenge is that which I have mentioned, that how to ensure that the continuum happens after that. Continuum of care is the biggest challenge, including other things. Thank you very much. I have to leave because I have to be.
Yeah, I know. So give a big round of applause to Dr. Madan Gopalji, and thank you for your presence, sir. So, so I'll continue with the same question, Naveenji, to you also, that when it comes to challenges, currently a lot of future things happening, our health workforce, our system is also evolving day by day. What you see a challenge when it comes to executing and getting this implemented in the states?
Oh, see, first of all, we learned a lot of things from the COVID pandemic, right? So are we able to institutionalize those learnings? I'll put it very simply, right? I don't know how many of you have a very clear memory of how this pandemic started. So there was a lot of disbalances or imbalances, which you call, in the way we approach across the country. So I would call this pandemic in a way as made it a level playing ground. If you see, if you read any state's, response to the wave 2 or the wave 3, there was a streamlined activities. They will talk about a command control center. They talk about their telemedicine. In fact, the AP experience has been like this. What is that? What is the actual, if you talk to me in terms of administrator, what is the pandemic problem? The problem is to supply logistic, have good hospital facilities, and the right people get right treatment. That's exactly what you look at, right? So when you do that, how do? We do it through a triaging. Many of you would have, I don't know whether you've been to an COVID care center, you would first you go to a triaging facility. Since AP was bifurcated from Telangana, we did not have any good tertiary care centers across AP. How did we approach this particular matter? We started doing a home triaging, in fact. So the reason we have so many health records in our ABDM is that only. We started going home to home with a tag, finding out what that person does, he have a fever or not. So the entire fever analysis or fever study was done on a tab, on a digital form. And there are 3 options when you do a fever survey, right? So when you do a fever survey, we have 3 options. One is whether that he should continue or she should continue to be in the home only. Second would be whether he or she should be sent to a COVID care center, which is the next level of it. Third, with excessive comorbidity, should he or she should be referred to an hospital. Doing this, we were able to do I would not call it amazing work, but I would call it as a good work with logistic management. We could, if you actually go, there were people who were squatting in, no, I would not call it squatting. There were people who were occupying beds because they had that fear that something might happen to him. But the right people also, there were people who actually were in need of the bed. So we were able to, bring a balance about this one using this triaging. I think triaging was one of the most things which helped at the end of your wave 2 triaging was very, very important, right? So that's more important. So this is how a digital technology was used. When I started my conversation also, I spoke about how a technology was an enabler or a tool to bring about this healthcare. There are lessons we have learned and we should not forget. That's most important. When you ask me, I think that should be the lessons which we learned should not be forgotten. And when we see a new kind of disease burden happening, these lessons can be used extensively. For example, I also head this AP State AIDS Control Society. This is one extensive system. There is a tracking. They also find whether you are adhering to your medical protocols. These are lessons which are already available in the health setup. So can we replicate these protocols, the lessons, the failures which we came across into a newer adaptation to what we look at using technology? Or what is enabler? When we talk about technology, it brings down the cost, right? When you talk about transactional cost, digital should bring the transactional cost. I think he was mentioning, Neeraj was talking about it. I would be able to give a cost effective. That is the word he used when he made his statement, right? Cost effective. Can we bring cost effective treatment? When we talk about healthcare, there is one important concept which we talk about is out-of-pocket expenditure. How many of us can afford to have a proper, I'm told if there is an ailment in a family, I'm talking about a moderately around the borderline, after an ailment, they actually step back into the below poverty line, right? So there are breadwinners who step back into, if the breadwinner is a cancer patient, what would happen to their family? So these are the questions. I think somebody has also asked me, are we looking at prevention? Prevention is the key for healthcare. When I talk about it very clearly, that is it's not about putting on extra hospital. We should look at how can we reduce that extra hospital. So that should be the agenda for setting up the healthcare continuum in the future. So these are lessons we have learned. There are very strong lessons. I think we should be happy that we learned very good lessons in the healthcare management during COVID. These lessons should be put on in the other aspects of the healthcare also, which would help us. I think it has been a very good leveling ground. So I think that's the challenge. I would not call it as challenge. That's an opportunity. I think that's an opportunity. It is there in our eyes. We should use it. All of you sitting here should use this opportunity to build this nation. Thank you.
Yeah. And I think COVID itself, I think, became one of the enabler to, kind of go for all these digital tools in a faster manner. So if I go back again, Dr. Hiralal sir, जब हम challenge की बात करते हैं in UP again, if I have to ask you कि number one challenge when it comes to adapting these digital tools, वो क्या challenge आपको लगता है UP जैसे state में, which is the number one challenge है?
Challenge is the implementation being vast and wide. We have got huge amount of the fund from the GOI, okay, and resources are same. So right now we are facing this challenge, how to spend that money quality wide and to meet out the expectations of the government of India with the same resources, because suddenly we cannot increase our management. So that is the biggest challenge in our system, and which I think.
Very rightly put.
I've also been a special secretary UP also. So see, if you look at UP in the last, I think Hiralal ji bhi uska part hai. So the way, again, I was also part of, we started this UP journey somewhere in 18. The management of drug supplies has been streamlined. That's one big achievement which UP has already done. If you see, in fact, I'm told that the UP Medical Supply Corporation is one of those agencies which is very popular across the country also. And it did a pretty good work during the COVID management. Second, UP also has a very strong health strengthening system. So we talk about, I think a lot of good work has happened in UP in the last maybe 6-7 years to strengthen what the healthcare facilities would do. I think the only problem, I think even Hiralal ji was correctly mentioning, it's a scale. When you look at UP, whatever you do is like a drop in the ocean. But I think the drop is getting bigger and bigger now. I think it's becoming clear to see the effects of what is happening in healthcare in UP.
Very rightly put. So Neeraj ji, again, coming back to you, when we talk about challenge, if one challenge you have to highlight, especially this whole integration of diagnostics with existing NDHM or with NHA, what is that one challenge that you would like to highlight?
I think one of the biggest is the adoption of technologies at the rural level. So, and since we have these entire digital platform, which is associated with all the ASHA workers to PHC teams. So how can we integrate training programs for implementation of such diagnostic technologies so that it can be implemented at a much more scalable methods, and then adoption of various solutions which can be used for the grassroots level screening programs for various health conditions. Just like one of the initiative which is ongoing on a very big scale in India is the tuberculosis. And that's something which is already at its very upscale. And so similarly, we can adopt many other different technology essays or different parameters which can be adopted for similar kind of programs. Another challenge which we learned during the pandemic time was how we can make technologies much faster. So that we all waited in lines for 48 hours to 3 days to get our RT-PCR report, which should not take more than a couple of hours in general. So how we can make this available as a technology at a grassroots level. So at Genes2Me, we were one of the largest contributor in the RT-PCR solution across the country. We are almost 1 in every 5 tests in India for RT-PCR. We are proud that Genes2Me was behind that as a solution provider. But beyond that, what we have learned during that time, how we can make it faster, how we can logistically transfer these solutions to a grassroots level, which is itself challenged with logistics. So we developed room temperature stable reagents, which were unconventionally minus 20 degrees and storage conditions required for storage as well as transportation, which has become a biggest challenge in the rural level, which was not equipped to handle such kind of solutions. So we developed, and the second solution which we developed was how we can bring a molecular technology accessible at a grassroots level. So that was another challenge which could do. So we developed a portable PCR, which is smallest of its kind and the most powerful solution, which can do the same RT-PCR at a grassroots level in just 30 minutes with no skilled trained manpower required to run that platform. And it has got an automated reporting solution, so that can be integrated much faster and easier for carrying out any national screening initiatives.
Good. So what I'm just conscious of time, and it will not be a justice if you don't get a chance to ask questions to the panelists here. So floor is open. Please introduce yourself and also be specific to whom you want to be asking your question, and be little precise while you ask your question. So anyone? Yes, please.
Thank you all panel members for taking us through the entire journey of the country which is there. Myself, Dipankar, I belong to BeWell Health Tech, which is a pioneer in creating contactless selfie monitoring tool. So my question is that we talked a lot about rural adoptions, training, and not awareness, another aspect. Do you see this is more towards a behavioral aspect, or it is a lack of infrastructures or digital presence or digital divide? What exactly it stands for us?
So you have directed your question to whom?
We can take it from.
Okay.
See, I think we also live in, I have this thing, frog in the well, right? We believe that what we see is all that we see, right? So this is a case with every country. It's not just, you answered all the questions. In fact, I don't even have to answer your question. All your points are the same. If you ask me, it is digital infrastructure. There's a gaps in infrastructure. There's also awareness. I'm putting it like this, okay? How many schemes do you know that it is happening in health to you? You're also well aware, right? So that is the thing. It's always been this across the governance. It's not, I'm not, bluffing you off, but across the governance, these are the issues which will keep coming again and again. What we do as an administrator is to fill in these gaps. How do I fill in awareness? How do I bring in the gaps in digital infrastructure? In fact, we were able to fill in 40,000 posts in AP in the last 3 months. Identify those gaps. Even then, we are not getting specialists and super specialties specialists to go to the rural setup. These, how do we, that's the reason I was talking about that use case which I was talking about, right? Can I be able to put a cardiologist in a center like Padero, which is like 3 hours from Vizag? So how do I solve questions? So that's where you guys are sitting here. So you have to come with solutions. We work together, bring in technology as an enabler to solve these problems. So the infrastructure, when we talked about 5G, in fact, you remember the same thing which the Honorable Prime Minister saw it. We were trying to do it. The case study which I explained was exactly what he saw. There was an ambulance going there somewhere in the rural setup using 5G technology to pick out those ECG. It is readily transmitting to some place, and some doctors saw it. This would work. I would see that the way we look at healthcare would be different. There is a lab technician who would go there, record details and send it to an expert somewhere take his report, medicate or give medical advice, and maybe multiple advice. There's a scale of telemedicine which can happen maybe from an lab technician, you go to an MO or maybe to super specialties. So the way we think the conventional healthcare system would change, I think it has already changed. The COVID was a very good example. We also would look at centralized command center. In fact, there is a startup called Carkinos, which is executing cancer care through using a digital technology. There is an integrated command center for this one. So there are scope for improvement. There are a lot of things which would happen. We keep striving to be the better. My closing remarks was this one only. It is the whole of society approach we will adopt to take the benefit of healthcare to every single citizen whom he or she should benefit from. That's all.
So we will be able to take one question before I hand it over for the next session. So yes, sir, from that table.
This is my question, Ms. Naveen. My name is Dr. Pinak, and I run a digital healthcare fund called Health Quad. We invest in very interesting technology-backed healthcare opportunities which are trying to solve for the real-world issues of Indian healthcare. My question here is that we encourage our companies to take their digital solutions to the rural markets of India, the extra urban and rural markets of India. At the same time, we know that it will not be possible completely if it was left only to the companies to do that because of the lack of experience, expertise, as well as the on-ground infrastructure to do that. And hence, they have to do it in conjunction with the government at some point in time. My problem is that their interaction with governments is not really frictionless. And that is one of the major impediments for companies to actually leverage the government infrastructure to be able to create the digital networks that one would really love to see. And that has a repercussion on their funding also, because funders look at government revenues as one lumpy, unpredictable. There is a delay in payment cycles. All of that. How is the government looking at solving some of these issues?
See, it's an easy question to answer for me. So when you look at, I've been in this IT space for some time, right? So I was there somewhere in 14 when we wrote the first startup policy for UP. I think somewhere in 14 we had the first IT startup policy for UP government. You would not believe, many people when we wrote up this policy, they asked, UP is coming with a startup policy. In fact, if you also go across Noida, which is next to door, because of the UP's electronic manufacturing policy, it is the hub of electronic manufacturing policy. I'm talking about, I've been a part of it for a long time. So the answers you asked, how did Covin win the Covin app? They were able to give usable data for others to use. There is a ready-made change. I do not know whether you have seen the government-scape in the last 10 years and what is now, right? The startup policy itself talks about collaboration with the, partners who are startups. If you see, there have been changes in the procurement policy to use, or you let startups to participate in tenders. That is also very, very important. I think that's something, a big change. Yes, we are evolving. You might not think we have not evolved the way you think we should evolve. And I'm very sure I'm very, very proud when I say this one. Our country has evolved faster than any other country in this space. I think I'm very proud about it. I cannot even mince my words saying this one. I put it very clearly that we have evolved very strongly on this forte. It is something which I'm very, very proud of. Yes, we evolve, and there is a change of mindset. You talk about payments. There's also a system called PFMS. Do you know that we are also, the government has has implemented single nodal accounts where the payments can be tracked? Yes, we have done it. You see, it's a continuous change which has been happening. What we were some time back, what we are different, and it is progressive. That's very important. We have been progressing, and I'm very sure that we are progressing faster than any other body in this world.
I think there cannot be a better end to what you said. Is that hope, is this progression and this accelerated innovation that is happening, and I think government is embracing that, allowing these partnerships to go. I know, sir, you have a question, but if you can just be very precise. Yes.
From Key Healthcare Private Limited, I have a question to Mr. Naveen Kumar. The question is, in metros, the healthcare is not a problem. But what about the rural area where the BPL family or the farmers, those who can't afford the treatment, like, the cancer and oncology treatment? What about them? What the government official they are trying to save many lives? Thank you.
Again, an easy question for me. The expenditure we spent on cancer in AP is 400 crores in medical insurance. And 175 crores has been spent on this CM, the Honorable CM Relief Fund. That the total is what? 575 crores. Where do you think this money has gone? The money has gone for the people who are what you call BPL and all. So the government is already doing it. See, that's the problem when we sit in a hall like this, right? When we talk about it, we do not know. I wrote a post, I think I recently wrote a post. What you see, what happened during COVID is that there was a person knocking your door asking whether you're doing well or not. It is what exactly happens in the rural setup. The ASHA worker goes to every doorstep to find out whether that person is doing well or not. There are registers in, Anganwadis, which is a 13-1 column register, which records what that pregnant lady is going through every trimester. There is a system which is there on the ground. We do not see it. It doesn't mean that just because we do not see it, that doesn't exist. So that is what I can say.
Sure. So thank you with this. Thank you to each one of the panelists. Also, Dr. Yadav, who joined us virtually from Lucknow, and also to IHW Council to create this platform to bring these very good examples from states, which give us a lot of hope. So thank you, and over to you.
And with this, ladies and gentlemen, we have come to the end of our very first panel discussion where we were discussing the smart digital health mapping of states in India. And we would like to commemorate the occasion. And I request the esteemed panelists to kindly be up on the stage. We would like to present them a small token of appreciation, for which may I invite Mr. Narayan once again to kindly come up on the stage and present a small token of appreciation to our esteemed panelists and the moderator. We'd like to present a memento to Mr. Prabhat Sinha. Mr. Prabhat Sinha, who is the moderator of our session. Would also like to felicitate Mr. Naveen Kumar, IAS. And Mr. Neeraj Gupta, founder and CEO of Printing. Thank you all. And now, ladies and gentlemen, it's time to move towards our second panel discussion, where we will be discussing the digital innovation for smart hospitals, diagnostics, and medical infrastructure. India, as we all are aware, is at the cusp of a smart digital revolution. New and innovative health interfaces, technology interfaces are changing the landscape of the healthcare ecosystem. With the smart digital revolution in almost all industries and sectors, there is a huge opportunity for the advancement in urban healthcare delivery infrastructure, as well as taking the smart digital innovation to rural and regional India for better healthcare development and ease of accessibility. This session will talk about the ways technology is alleviating the overstraining processes in healthcare delivery system through new age, innovative and sustainable digital hospitals, diagnostics and medical services with future-ready infrastructures, which is helping the common people at large. Now, to start with the second panel discussion, I would like to invite upon stage our moderator for this session. Please allow me to invite upon stage Mr. Virish Narayan, Director, Kpmg. Can we have a round of applause, ladies and gentlemen? Welcome on stage, sir. I would also like to invite upon stage our esteemed panelists for the panel discussion. Mr. Arun Goyal, CIO, Sir Gangaram Hospital. Mr. Rajiv Sikka, CIO, Medanta, the Medicity Hospital. Dr. Sushil K. Meher, CIO, AIMS, New Delhi. And Mr. Angira Agarwal, Global SVP, GTM and Strategy, Exetel. Why do I have to remind all SC members in the audience to give a thunderous round of applause? Ladies and gentlemen, it would really be helpful if you could give them a thunderous round of applause. And now I hand over the floor to our moderator of the session, Mr. Virish Narayan.
Thank you. Good afternoon, everyone. And I'm in the presence of a very distinguished panel. So I'll not take much time and, coming to the discussion, but just to start, and give you a flavor of the session. The session is on digital innovation for smart hospitals, diagnostics, and medical infrastructure. It is about the possibilities at which we are looking at and how technology can change healthcare of the future. So as we know, there are 5, key emerging trends which are shaping up the digital innovation landscape. And COVID has, brought it or accelerated it, fast forwarded it, and the key to them, the key to those emerging trends, if I may, try to codify them, they're like, the first one I would say is increased patient awareness. We are having more data. Everyone is becoming more aware. And this is, getting into the way patients or consumers approach healthcare. They're even doing, self-care. And that is becoming a problem in instances. Second would be leveraging of the latest technologies. The pace at which new technology is emerging has also accelerated. And it is all at the disposal of hospitals, primary care, clinics, diagnostics. In every field, these new technologies are available for use. And this is leading to a revising of the healthcare delivery strategy by all these players. They have to become leaner, more agile. And this is what we'll hear from our panelists. Leading to a shifting trend in diagnosis and treatment. We have more cutting edge technologies now, which are aiding diagnosis, better diagnosis, accurate diagnosis, leading to better treatment, and more complex treatment. And finally, the workforce has to catch up, has to use up, use those technologies. They have to be adequately skilled. So in a nutshell, these are the key emerging themes which are already happening or likely to pick up in the near future and change the way healthcare is being delivered. And it will cover all aspects of healthcare delivery, from hospitals to diagnostics, and if I may put in a word that, this will lead to not only just interconnected care or interconnected, technologies and applications being interconnected. The infrastructure has to be future ready. 5G was launched recently. So that is supposed to aid. Healthcare is being quoted as one of the most, sought after sectors for 5G for use. In a nutshell, we are at the cusp of a change, tremendous transformation in the healthcare sector. And I think hospitals and healthcare providers would be willing and have to invest in that new technologies to be able to, cater to this emerging requirements. So with that, I'll just, come to our distinguished panelists. And I would like to start with Arunji, you. Taking, the advent of these new technologies, and there are a lot of connected medical devices, we are having with patients, we are having, data coming from people who are not patients, who are healthy, but we have data coming in. And all this, is being, enabled by IoT. So how do you see, what role can IoT play in the Indian diagnostic and, healthcare delivery industry? And, how it can impact the affordability of care? So your views, please.
Thank you, Virish. Yes, IoT can play an important role in patients' wellness. Today, everybody's life, IoTs are playing very important role where people are wearing a smartwatches, smart IoT devices, which taps their steps when they are walking, their exercise patterns, their pulses, their SpO2, everything they are being monitored. And that data is being used to monitor and make the patient and the healthy person aware about their health, be it a diabetic or a cardiac disease related issues. And there are some other IoT devices which are monitoring the sugar level also of the patient, where they can monitor day in, day out their sugar level. That is making possible to make the patient or the healthy patient aware about their diseases and take the preventive measure well in time. So yes, IoT is not only the creating a proper data to create a healthcare strategy to treat the treatments with respect to the respective critical diseases for the patient, but yes, is helping in a big way to improve the wellness part of the patients. Thank you.
Thank you, sir. Thank you for those words. I would like to move to Rajiv ji. You know, as we are seeing new technology emerging, getting adopted in the hospitals and healthcare settings, the staff or the healthcare providers also have to catch up, you know, be skilled on those technologies and be able to use them, you know. So what are the initiatives that can be undertaken for upskilling of employees so that, you know, they are adept at these technologies and can easily adopt them? That would be one. And of course, we would like to hear from you as to, you know, how are you doing it at your Medanta hospital? So over to you, sir.
Sure. So, you know, we all heard about telemedicine platform, which was for doctors. Now let's talk about other staff, because there are heterogeneity of staff in any hospital, right from nurses to technicians to radiologists to lab doctors. And what happened was that, I'll give you an example. During wave 2, one of the hospitals, which was part of Medanta, all radiologists were down with COVID. And it was, you know, how do you treat now patients who are coming for CT or an MRI, because some of them were under the trauma cases. So what we did is that, fortunately for us, we had one common PACS and one common set of machines, so that integration was quite easy. But ultimately, we came out with this, you know, well-oiled connectivity, a mechanism by which, as soon as the scan is pushed, as soon as the scan is done, it is pushed to multiple locations, and then a typical workflow was formed. And all of these was done in one single day. Radiologists whosoever logged in the day, they have to, like a call center guy has to come and say that I'm logged in. So they have to come and say I'm logged in a very simple click. And then, you know, all scan and reporting was done. So this is how we started. Then we realized that if this can be done remotely from one hospital to another hospital, why can't we do it from home? Then we started moving some of this basic scans facility to the radiologists at home. So this was again very simple. Lab doctors, the same story. We bought the analyzer remote interface to laptops, VPN connectivity, job done. So these two, you know, stakeholders are relatively easy. Now let me share some examples with nurses and also with the technicians. We all know that nurses were superly impacted because of COVID. What we did is that very simple. See, tech is never sexy. Tech is never, you know, very complicated. It's the application or the use case which is important. So we all know about Amazon Echo, which are like video, you know, devices. What we did is that we put one Amazon device, video device at each COVID bed ward. So there was a Echo at the bedside. There was a large machine Echo at the nursing counter. And what we were doing is that as soon as the patient says that, you know, I need something. So she, the nurse, he or she was aware that this request is coming from which bed, because these are all numbered bed, and it was getting displayed. And so instead of going all the way to it was like a pseudo nursing bell. So instead of going all the way from the nursing counter to the ward, nurse was trying to answer each and everything then and there itself, unless it needs a clinical attention. I'll give you examples. Most of the requests in a typical nursing unit are for F&B. I need warm water, I need tea, or for housekeeping, give me a blanket. And sometimes AC is not working or TV remote is not working. And what we did is that we used to pick up those keywords, and as soon as the call is meant for an F&B, the call get routed automatically to the F&B station, and the water was served from there. So nurse has do nothing to do with that. So this is again a very simple, example, and definitely we got a lot of help from all the partner ecosystem. I'll give you another example of a technician. And again, these are very simple stuff, but we have to do it. We all know that, a person, when he or she has to go to a CT table, patient has to be positioned in a way by which scan comes to the quality which is expected. And this is the job of a super specialized or a skilled technician. And the technicians were also impacted. So what we did is that we took the remote control of console, and most of these consoles are proprietary, thanks to all big four players. I don't want to name them, but they come out with a proprietary software. So we requested them, and yet I know how to break that OS, but it was, these are very sensitive machines. We don't want to play with them. So we requested them, and we got the control of the console in a typical remote desktop and laptop. And then technicians are also doing this remotely in terms of managing the console. Now just imagine that now after 5:30 or 6:30, if any console has to be managed and the technician is not in the office, we can request him remotely, he can log in, and trauma cases can be handled. And we all know that 80% or some larger number, significant number of trauma cases comes after 5:30 hours when the technicians themselves are not there. So these are a couple of stuff. Now coming back to the skill part. Doctor to patient ratio or a healthcare to patient ratio is pathetically poor. COVID exposed all of us, and India was nowhere better. And you can manage that 2 years somehow, but you can't manage it till infinity. So one clear-cut message was that skill set is a major issue, and Dronacharyas are only for Kauravas and Pandavas. There are many Eklavyas in the country, and you need, to train them. And when you talk about scale, digital is the only solution for Eklavyas to be trained and without donating their right hand thumb, not for dwindling, but for arrow shoots. So what we did is that, and I think I can rattle multiple examples, but I'm going to pick up a use case which is in production in Medanta. Neurosurgeon pre-surgery planning, and we all know that 2D, all CT MRIs are 2D, and translate that 2D image to a 3D image when the actual surgery is done is a skillful job of a experienced surgeon, and this is definitely prone to error, and sometimes skilled surgeons are not there. So what we have done is that we transform that, infuse the CT or MRI and a lot of other X-ray stuffs into a 3D image, and with that 3D image, surgeons can do actual pre-surgery planning before the surgery. And just imagine that we extend this to patient education. You show the same VR set to the surgeon, to the patient, and say that this is how your surgery is going to look like. Otherwise in a classical CT MRI black and white, you're telling patient family this is where the blockage is, and he's trying to nod his head, yes, I understood the blockages, and just translate into a 3D, in a colorful 3D, and the patient will be more equipped, and his or her anxiety levels will be definitely down. So these are some of the skills which are in production, and there are many examples of metaverse which we can probably leverage in the healthcare industry. It's the best poised for leveraging, probably metaverse and many such technologies where real-time experience of our Gurukul, which we are missing now, probably we can be leveraged. That's my take on some of the skills.
Thank you so much. I think it was very insightful, knowing how Medanta does it, plus your views on upskilling. And one thing which I picked from it is further using technology and refining processes to help in that employees to be able to use that new technology. So a focus on process becomes more important, and use of additional technologies, of course. And just to add, as you were mentioning the augmented reality thing, I think Samsung Medical Center in Korea, is a perfect example of how they want to use 5G. So they are using 5G, for augmented reality in medical education, and they're trying to do stuff, hopefully of what we'll see in India in the coming times. So moving on, Dr. Sushil, one of the elements of technology, which is picking up pace is a clinical decision support system. Now, it has the potential to enhance the quality of care, to reduce errors, However, its implementation is a lot challenging. Data interoperability plus, the algorithms which go behind it. Now, this is a question, from a government side. How can the government focus on the adoption and enforcement of common healthcare data to ensure interoperability? Now, NHA is trying to do it. We are seeing, things emerging, but still, challenges remain. So, your views on that?
Yeah, thanks for inviting for such a beautiful, beautiful events. In AIMS, because AIMS is an institute for the national importance, and always you want to do more innovative works in IT field. Since 1988, we have started our digitization. So that's why we have a lot of experience behind it, and we have learned a lot also in between. What about CDSS? Just I'm giving one example to you. We get around 12,000 patients a day, and we have to take care of that 12,000 patients. But our demand is around 45,000. So how to cater this one in transparent manners? When demand and supply has a gap, people will do some things which they can get the treatment as early as possible. So many cures it will come up. So that's why what we have done it. The last panelist from the NIC, because we are using the NIC applications, the e-hospital, that any patients, because we have, let's say 12,000 patients, 30% of the patients, they have to come with appointments, 30% walk-in, 30% which were means revisit, and 10% will find some person need immediate treatments. But how to find out this one? So when you come to the hospital, there is a QR code, they have to scan it. Automatically they can put his demographic details. If the patient has the AVA ID, automatically it will fetch up. If the AVA ID is not there, it will not fetch up, and he has to generate AVA ID there. One thing is there. When you are taking appointments, what we are planning it? Simultaneously, you can book your parking. Simultaneously, you need a wheelchair or stretchers that can be booked, but it is in the plan of implementation. We are not yet implemented. In that cases, what it happens, the people are moving here and there, that will go down. And 12,000 patients means 40,000 people are in the OPD, because each patient they carry one person means 24,000. Some people they get 2 or 3 people. So around 40,000 people are there. So they have to manage in that way. The next thing is that many patients, they are unable to judge themselves that which department they have to show it. So we have developed one bot, so they can feed their basic clinical information. They can guide you that which departments he's supposed to go for a treatment. This is the one thing, one kind of CDSS already been developed. This is AI based, and we have used machine learning also, and that is in the testing forms. Second one, what you are talking about it, when you are using the CDSS, you have to be standardized whole records. Whole system has to be standardized, and our application is standardized up EMR standard 2014. Then we are using SNOMED City for the clinicals, ICD codes. Now we are going to implement HCD 11s. Another one is you are using Wellbeing, and our all the images are in the DICOM standards. So all the standards we follow it. When we will come to the CDSS applications, one application we have implemented in gastroenterology and we have checked it. When we will give the symptoms by the doctors, because our process is that first whole history of the patients, it will be evaluated by the JR, junior doctor. Then it will go to the senior doctors, that is SR. Then it will go to the consultants. So in the meantime, this process already been applied. When doctors will come, they will check with the CDSS, have they leave out any investigations, and if your investigation is left out, then they can check it and then order it, or what it is that what kind of line of treatment has to be done, and it will guide you that you can take another consultation from another specialty, or you can go for any other investigations, and what kind of prescription has to be generated, what generic and what kind of salt of medicine it has to be maintained. That has to be decided by the doctors, as well as they take the help of the applications which is been developed for the CDSS for the gastroenterology. All the data is what doctors is deciding it and what is the CDSS is approaching it. If it is not matching, we are storing it for machine learning purpose so that in futures they can take care of these things accurately. So this is the kind of things we are in the plan to implement it in the large scale. But one thing I'm telling you, AIMS is going for another stage of digitizations, and we have named mobile first. Very user, you have to come to the mobile first.
Thank you, Dr. Sushil. That was inspiring to know, that AIMS is doing so many things around this. And, I'm sure the private players, and hospitals would already be using CDSS. But just to add to, what Dr. Sushil was saying, and we are talking in this session about the possibilities of technology. And, I was personally involved on the government side, trying to take CDSS to the primary care level. So those discussions are happening. I heard a question in the last session, how is the government supporting? So that thought process is already opening and happening there, So whether it is implemented or not, it's not the question, but the discussion is happening, and if we have a repository of data at AIMS, at Medanta, at Gangaram Hospital, all these things, can they be connected? The possibilities are immense, and people are discussing at all levels, whether it is private sector, government sector, whether it is the tertiary care or the primary care, and we are at the cusp of a change, we are already feeling, and maybe 5G will push us, to take us to the next level in healthcare service delivery. Sir, another question related to, this is, around the Indian healthcare infrastructure being able to ensure, cyber security in health establishments and also safeguarding healthcare data. While NHA is doing, so your take on, the sensitive healthcare data and how it is being currently safeguarded and what can be done further.
You're talking to me?
Yes.
Okay. Anyway, infrastructure wise, anyway, we are not lag behind because we have in premises all the infrastructure and our own people, they look after the infrastructures. See, right now, everybody that talks one thing that data is not in one place. Data can be accessible anywhere, anytime, in any place, in any platforms to access their medical records. And we are enforcing by the ABDM to share the records to the patients, those who are registered in the Aadhaar ID. There are two things that you have to look into. One thing is that patient, another thing is that service provider what we are giving it. Okay, I have to empower my service provider, everybody, how to access the health records. Another one is that I have to give the facility to the insecure manner, how the patient can access their own records. And it is a big challenge for us. First challenge, what it is that till date, the government of India has not published or approved the personal data protection bill. But as per law as today's, the patient record is who is the owner? The patient itself is the owner. So that when we can share the medical records to other investigators, whether you can do or not without taking permission from the patients. You see, it is a very complex thing. Even if my husband's medical records cannot be seen by my wife or my parents, if I will not authorize them as per law. So when it's digital, when you are sharing the things, it is a big challenge for us. You have to configure the systems, you have to secure the systems, because if you see, during the COVID time, the maximum hacking has done in the healthcare domains. And I am also one of the, I'm a chairman to the ICMR for their whole data setup. And during the COVID time also, we have upgraded the whole infrastructures to safeguard the whole COVID data. It is in the ICMR data centers. So what we have taken it, we have done very carefully because you have to give the service for the security reason. We can't stop it. Okay. In that cases, what we have done it, we have made a different channels which has been very secure manner. People are using the virtual channels, but in the virtual channel also we have faced a lot of problems. A lot of hacking has been done, but whatever is there, what are the policy we have made it, I can't share with you, but ICMR was more secure and all the data is intact and nothing has been done. But for the AIMS, we have got 2 hacking, but it is very small servers, which is we do not have any important data. Rest of the things it is saved, and we have made a policy which we have to apply it and we have to deliver it in that way. Let's take in the COVID time, test has performed, but doctor has to do that test. He has to see the test and he has to approve it. Without authorization of that test, we can't. You can't display to the patient or doctor. In that cases, doctor is not in the hospital; he's at home. I have to give the access to him. How I have to give the access to him? So that policy you have to implement it within your infrastructures. So it is a big challenge. And one example I am giving you: if you ask for hacking a medical record in US, earlier it was $12. Right now it is $40. If you talk for anybody's bank accounts to hack, it is around $25. So the demand of medical records or information is more vulnerable than any other things. Thank you.
Thank you, sir. And hopefully, we are seeing all the components of the ecosystem, digital ecosystem, taking shape, and our data should be safe and secure. So,
Sir, we have around 5 petabyte data in one place.
Ultimately, all these technologies should lead to better patient experience. And that brings me to you, Mr. Angira, because your company, works in enhancing patient experience. So your thoughts on how technology is helping and, what are the changes which are happening on this front?
So, and I'm going to also narrate a recent experience I had. I still have a bad cough, but when a patient is unwell, the reason they go to a hospital is because they want to get out as quickly, they want to get cured as quickly as possible. Right? And everything else that comes in, having to pay the bill, having to call up and set up an appointment or reach out in any other form to set up an appointment, get the prescription, get the medication, are all fundamentally processes and systems that are required. All I want at the end of the day is my cough to get better. Right? However, the other things are necessary, maybe because of regulation, because of data privacy, but they're all necessary. I'll talk about my experience of yesterday, and I needed to set up an appointment. It was a repeat appointment. I downloaded the app. I set up the appointment. As I set up the appointment and I made the payment, I got a confirmation, but then it said, could you upload the prescription? When I looked at the app, the prescription was sitting in the app, but it wouldn't accept that. I still had to upload the prescription, which means I had to download it. I had to get out of the app, download the prescription, the PDF, and then upload it again. Right? Extra step. I set up the appointment. I set a reminder for myself in my calendar because the app didn't automatically put it in my calendar, my personal calendar. About 20 minutes before the appointment, I got a call, which was legit. I got an automated voice call reminding me it's an appointment that I have in 20 minutes and I need to be ready for that. I did the appointment with the doctor. After the appointment was over, about 2 hours after the appointment, I got a call, which was now an agent, a live agent on the call, telling me, sir, you've done an appointment with the doctor. Can we send you the medicines? We do free delivery. I'd done a video consultation, right? So I wasn't in the hospital. In addition to these phone calls and the work I did on the app, I got 5 SMS messages and 2 WhatsApp messages, right? The SMS message was first, your appointment's confirmed. The second was about the doctor, the time of the appointment. The third was an SMS telling me that I could collect my invoice from the prepaid billing counter at the hospital. I was doing a video consultation, right? I wouldn't be visiting the hospital. And after the appointment, I got two messages, one with the invoice again, and one I got with the prescription link. But the prescription was also sitting on the app. Right now, we are a customer engagement platform provider. We make money if you use all these. We are very happy using all these. But from my experience, it was just too much communication. And when the phone call came the second time, I picked it up because I had an app that told me it's a verified call and it's actually coming from the hospital. Otherwise, I wouldn't have answered because it's fundamentally showing up as a landline number. Now, the reason I'm highlighting this is I knew I was going to be here today, and it was an example of how all my data could have come together and made my life easier. One transaction is all it would have needed for my transaction to be done. Maybe two, one before and one after, but all the information could have been available. The prescription now sits on the app. It sits in an SMS link and it sits in a WhatsApp link. So there are three different places, which is, in my view, A, it's cost for the healthcare provider, but B, it's also, multiple channels. I don't know where the prescription is. I may have clicked on the SMS link and downloaded it, but I would then need to find it quickly and I would assume it's on the WhatsApp. So there was no preference. Which way do I prefer to be communicated to? Captured somewhere. The customer data platform, which could have actually been unified, and the hospital would have known, hey, I didn't visit the hospital, so no point asking me to go and pick up the prescription from the prepaid billing counter. All of these could have fundamentally enhanced the experience. That's one part. The second part is, if I do need to reach out to the doctor, today what happens is, I'll call up the hospital and it's an emergency. They'll say, okay, hold on, we'll patch you to the doctor, and it'll take some time, and the call center agent is then working to patch me to the doctor, and it takes some time. In some cases, they may even give me the doctor's number saying call up the doctor. Now that would happen because the doctor is okay with me reaching out on their mobile number directly. But in a lot of cases, the doctors are not okay with their numbers being exposed, right? Now all of this is what we as a company do, and this is what we've seen happening very rapidly with a lot of hospitals and aggregators that we work with across the country and in other parts of the world. What we have seen is that all of these can actually be unified. So if a call center agent is actually the most expensive resource today, right? In terms of customer experience management. Now, if I had a chatbot, for example, and I just put in, and I was very happy to hear Dr. Meher talk about it. I just put in, medicine is what I need, or a bad throat, and keywords can be picked up. And on a chatbot, I can get, okay, these are the doctors that are available. These are the appointments that are available. Please choose 1, 2, 3. And it happens, and I get an appointment set up without having to do anything. The payment could also be done through a similar mechanism, make it extremely seamless for me to get the whole experience happen for me. Now, I may be someone who doesn't prefer a chatbot. I'm not comfortable chatting in English. I would prefer a voice. Can voice be used to make this happen for me? Right? And a lot of tools are available today to make it easier. Right? If we're talking of patients coming from rural India, they will have a feature phone, they will speak over the phone and get these things done. Now, this is what we've fundamentally been delivering, saying that across all the data sources that exist, let them not exist in silos. Let them all come together and you communicate with the patient in the manner that they're most comfortable with. Is there a feedback mechanism that tells the healthcare provider that Angira clicks on the links typically in WhatsApp? So next time, don't send him an SMS. Right? It's no relevance at all. Angira prefers to be communicated via phone calls. He will typically call us over the phone. If the call center agent is busy, and typically, if I'm calling up the hospital, I'm in a bad situation, sometimes it may be an emergency, I want my call to be answered very quickly. Okay? Can there be a mechanism that this call can then, as I'm saying, okay, your patient number 9 in queue, can I be diverted through a chatbot? Can that call get diverted? Would you instead prefer to chat and have your appointment or query resolved? That experience can significantly change things because, as I said early on, I'm going as a patient because I want to get out well quickly. It's actually, healthcare is one industry where you don't want repeat visits, right? You want to keep them as low as possible, ideally speaking, right? You want loyal customers, but not because of the same symptom, right? So that is something that we've seen happening dramatically now. And I'll give an example. Through the chatbot that we built, integrated with WhatsApp, the customer query started. A video call was triggered. Payment was done, by the way, through the payment mechanism. A video call was triggered. The patient's subscription was sent via WhatsApp while the patient was talking to the doctor. the patient opened the subscription and could ask further queries. Sometimes the patients have queries. Ye dawai kiske liye hai? What is it for? I hope it's not steroids. How do I take it? I'm not clear about this. All of those could be done in that same one single conversation. And that's the kind of journey that we see happening even more and more. Rajiv, you spoke about metaverse, for example, and 5G. That's something that will happen in the future for sure, because then it's more immersive. There's lots of use cases that talk about how 5G can be used to really enhance and improve remote healthcare. But what we've been doing and what we've been seeing happening consistently across is, how do you unify the channels, A, of communication, but B, how do you support them, enable them, empower them to having the data sitting in a single location? And once that happens, the customer experience, the patient experience in this case, can be significantly enhanced. And it was surprising for me because I was consulting with a national level hospital chain, but the fact that the pieces are still broken. So while we can talk about the future, if these basic fundamentals can be put in place today, that's the starting point for a lot more that can be done to enhance patient experience.
Thanks. That was again insightful. In fact, while we are talking of the future, a lot of things are happening in the present, and that maturity is not there. So as the broken, pieces or the broken journey was being narrated by you, I think, all these technology startups, or new processes which are being implemented, we need to look at them so that, from a patient perspective, it becomes more convenient, and, the patient has a better, if not a wow experience. So thanks for that. And I'm cognizant of the time. One set of, quick response to you on a common question. As how do each one of you see the adoption of new technology shaping up in the next 2 to 3 years? And this would be from your perspectives. So Rajivji, maybe from a Medanta perspective, sir, you from a Sir Gangaram Hospital perspective, sir, from an AIMS perspective, from that perspective, and Angiraji from a patient experience perspective. Sir, Rajivji, yours.
Sure. So, before I say that, I think during COVID and the example which I took, one thing is very clear that mobility will play a very, very important role as we move forward. Because, contactless being in the COVID means remote, and remote means mobility. So this is one part. Second thing is that very good example when during COVID wave 2, Government of India specially declared that asymptomatic patient or less symptomatic patient can be treated at home with 21 days, and all that program was there. It was declared on a Saturday, and we were sitting with some district medical officers, and we were asking, sir, how to do this? He says, we also don't know. So now what to do and how to do was a challenge. So what we came out with a very simple app. It's a 2-screen app, open in an iframe. Sorry, I'm using some technical word. Just imagine that it's a web page, which was taking patient information on a daily basis about the vitals, which were everybody, came to know that there is something called SpO2. So we were capturing those basic stuff through an application. And if something is above or below a threshold, immediate call used to go to the patient through a nurse. Otherwise, if somebody is not feeling, even then a call used to go to that patient through the nurse. So what I was saying is that this application, which we in research, we thought otherwise in a normal, application development, you ask for specification, you start building it, will take ages. Saturday, we decided that what happens, but Monday morning will be up. We were in office Saturday, whole Sunday, and Monday the application was up and running. So this is the second part which I want to share. And this also gave a very interesting phenomena that care can be taken away from the hospital. So 3 possible future trends which I am seeing is that, 1, care away from the hospital. So just imagine the kind of infrastructure which private hospitals or AIMS has, and we are still talking about care away from the hospital. Second, mobility. Third, especially in the health tech world, done is better than perfect. Don't look for perfection. Do something, we talk about mobile devices, we talk about devices which are tracking the basic parameters. If you think about them of the diagnostic quality, it will take some time, but start with the screening first. So done is better than the perfect. That's my 3 ways as we foresee future of health tech in the country.
Thank you so much, Rajiv. Arunji, your take on how it will shape up in the next 2 to 3 years.
Yeah, I see the digital transformation into the healthcare in the current current time and the future is in a 3 different way. One is the patient engagement. Second is, as Rajiv said, that care at home. And third is use of digital technology in a telemedicine way, pathology, teleradiology, and telemedicine. You know, telemedicine is bridging the gap between the patient and the clinicians. We already have a scarcity of the clinician. Not only the clinician, we have a scarcity in all the skill set, be it the clinician, pathologist, radiologist, and everywhere. So telemedicine has filled the gap between the clinician and the patient, and we are able to serve care in the remote area. So far as the pathologists are concerned, we also have a scarcity of the pathologist. You know, we through the telepathology, we have filled that particular gap also. In my past experience, we have used that particular thing into the histopathology, where we have digitized the slides and used histopathologist sitting into the remote and got those things done. Same thing is with the radiologist. You know, we have a scarcity of the radiologist, but through the teleradiology, we can fill that particular gap and provide the service into the remote area and where we have a pressures into the radiology. So these are the areas these are the typical areas, use cases where every hospital is working and using it. So far as the MetaServe and virtual reality is concerned, yes, most of the hospitals are working towards it and started using for the second opinion and for the critical surgery preparations, the virtual reality, which has been used in some of the hospitals. And we also are working in collaboration with some global partners to bring in the virtual reality into the surgery planning and second opinion into the future healthcare.
Great, sir. Thank you so much. In fact, it was very heartening to hear that, you know, we are talking more of tackling the unfinished agenda, you know, and then once we do that, we go for the futuristic things. So thank you for that. Dr. Sushil, you are in the midst of a big transformation in AIMS.
Yeah.
So your take on the next 2-3 years.
Yeah, basically my both friends, they have spoken many things. I want to tell something different. Okay, because as a AIMS, it is a institute for the futuristic research. Right now, the concept has come up, 4P concept. Most probably many people know it, the predictive, preventive, participatory, all these things, comes up. This concept, it is related to the precision medicines, healthcare. So personalized healthcare, it will come up because technology has in place the genomic data, which require a lot of storage, which is many people they have, and it is affordable also. So many projects. I'm already have 3 projects for the preventing and predictive for the cancer. This one will come up in the large scale because it is we have a department of pharmacology. They do a high quality of research in the new generation of drugs discovery. Another one is we have a biotechnology and bioinformatics people. They have the lot of data for the genomics data. Another one is we have the IT departments and we have a lot of data. I have already told you we have 5 petabytes of data, and which is been standardized also as per the international standards. So we use the different algorithms to predict it. And right now we are in the final stage of prediction in Indian data to predict breast cancers and ovarian cancer of Indian patients. So this is the main things it will come up, and it will come up with a tools which can be. If time permit, can I give another example to you? It is a very beautiful thing. Many ovarian cancers from the rural area, they when they start bleeding or any symptom has come up, they do not know and they hide it and they do not tell anybody to what is happening. Even also in the urban cases also we have seen it. And when it has been detected cancer, at that time, it is not possible to treat that patient. Just we have to, a palliative care has to be done. So in these cases, what we have done it, this is a pilot project. It is in a final shape. What we have done it, one pencil size stick, okay. There is a camera in the front of the stick, and there is a two lights are there. One is the LED light, another is the neon light. And we have distributed some of the village. There is a ASA worker is there, and they have to go individual house, and those females who are 50 plus, they have to take their clinical informations. If somebody has some symptoms, they have a bleeding or there is some pains, irregularity of the menopause, all these things, if it is there, so they have to put that stick inside, and they have to take the image of that tumor if it is inside is there. And after that, that image which is stored in the stick, it will put in the mobile and they download it. After downloading it, there is a lightweighted AI algorithm is there, they'll process it. And it will screen the patients whether it is some doubts for any cancer or any melanoma tumor is there or not. If it is there, then it will be uploaded to our data centers, it will be uploaded, and we'll use the another high level tools of AI to predict it. If it is there, immediately communicate to them that this patient has a high vulnerable for the cancers, and immediately they have to report to the any cancer center near to this. This is the things, it is in-house, in-house, indigenous and Indian made.
Thank you so much. I think, the next 2 to 3 years, we already got a glimpse of how screening will be impacted by new technologies, data, AI. So great to hear from you, sir. Mr. Angira, your take.
Yeah, so I think we talk about how COVID has accelerated digital adoption of technologies, but I think two things have changed. A, we as patients and B, the doctors have gotten more used to video consultations, right? And of course, what my understanding is a lot of HR personnel are investing in terms of training the doctors to be able to prescribe based on remote consultations and enable the patient or guide the patient to be able to provide the right symptoms on a virtual environment, a remote environment. It of course helps because now that I'm used to it, if I need to visit a specialist in a hospital in Chennai, I don't necessarily need to travel. I could possibly consult sitting here in Gurgaon or Delhi and get the advice that I need. So it therefore gives me access to a lot more specialized skills than happens today. And you, Rajiv, spoke about it. Arun, you spoke about telemedicine, how it's evolving, right? I think increasingly in the next couple of years, this is going to become more of a norm because it also helps improve efficiencies in terms of a doctor being able to serve more patients, be able to service more patients. So I think that's going to change dramatically. The other piece is also in terms of how various technologies will come together, whether it's a voice bot, it's a chat bot, whether it's messaging, it's voice, pure voice calls or apps, all of these will start coming together in a more integrated manner. And I think at the grassroots level, that is fundamentally, that will start to emerge more clearly. We will become more comfortable, not bothered really about the bedside manner of the doctor because he needs to be next to us, but getting used to those skills when you're, talking to a patient, to a doctor remotely, and the doctor also being able to modify and be able to engage with the patient remotely and then drive that forward. So I think at the basic level in the next couple of years, while we get excited about 5G, and I'm personally excited about 5G, the reality is, you can't really do a surgery remotely. And if most of the persons in an ambulance, because Indian roads are in the condition they are, you may end up cutting something else like you didn't. But at least a lot of these things can really, the enrichment that will happen in the user or the patient-doctor interaction, the healthcare provider interaction will go up dramatically. Right, that's my.
Thanks so much. So in a nutshell, we are all very excited about this increased adoption of new technologies. And we are seeing, that change is getting more accelerated, and whatever inhibitions were there, I think COVID, blew away those inhibitions. Providers are willing to accept that change. Patients are willing to accept that change. And hopefully, in the 2 to 3 years, like the panel envisaged, we'll have a far better adoption of technology and a far better patient experience. So with that, I would like to open for a few questions. If anyone has any questions from the panelists, we can take that. So please. Sir, we are discussing, technology. If we can have questions related to the topic, it will be helpful.
Why does you? It's for Rajiv. Why do you charge huge amount than the normal charges from patients?
May I? So, sir, as I mentioned, this is a forum discussion on a different topic on adoption of technology. I think the basic, question which you have can be answered somewhere else. But the point is, private sector has its own costs, has its own charges. Every hospital has its own. So I don't think you should be, asking this question in this forum. This is not the right forum. Maybe have another question, please. Yeah.
So what about the privacy concerns for the patient's point of view, the patient data?
Okay.
Thank you.
Do you have your question pointed to anyone specific?
Any one of the.
Okay.
So let me answer this. There are a couple of stuff. First of all, complete hospital information system, which is only accessible within Medanta premises, only on specialized cases. Like I took the example of remote connectivity to the radiologist or the lab doctors or to the technicians when they have to connect, and it's on demand. It's not that they go to their laptop or a desktop and remotely connect it. So whenever that remote connection has to be done, that request comes through a data center and authorization is done based on that particular duration. Second, all the applications which are patient facing application, which means for patient to download either a report or book an appointment or get a VC done on the device. These are all HIPAA compliant devices, and all the apps which either doctors are using it or nurses are using it are zero footprint. What it means is that nothing will be stored on the device. Each and every time information is seeked about a particular patient or even about an X-ray or ultrasound, because those are also visible. These are zero footprint. They will be fetched from the server, and as soon as the session is end, it will be, nothing is stored on the device. Obviously, you can, take the photo shot like you do it for a typical mobile phone. Nobody can stop that. But apart from that, it's a HIPAA compliant, zero footprint, and geofences device with two authentication: one, user ID password, and third, a runtime OTP which comes to the doctor or the nurse or any user.
Thank you. I hope the question is answered. Yeah.
Yeah.
One more or a couple of them?
Just one.
One more. Okay. So anyone, please. Yeah. Can we have the mic there, please? Yeah. Piche. Aapke piche.
The gentleman standing behind.
Hi, very good afternoon. I'm Sunil Kumar. We are a health tech startup. We're supported by Microsoft Accelerator and NASCOM. I did this PhD in diabetic complication, and so far in digital journey of the patient, I have monitoring from the specifically rural area, because in Delhi and Mumbai, like metro cities, we have the digital adoption. But into the rural area, they don't go for these things. And some of the OPD clinic also there, they don't store the data electronically. So we have developed this SaaS-based data-driven model which can help the future prediction of the diseases, like diabetic can convert into the future like heart attack, kidney failure kind of diseases. But this is a small data point which is missing out of the equation, like home-based checkup, we have the BP and sugar. If this data can be stored, so that prediction model can be increased. So we see these challenges where the hospital, we are unable to connect and deploy our technology. So how we, as a startup, we can connect with the hospitals to deploy our technologies to reach to the maximum population, so the data insights can be more.
We've got your question. Sorry, we're really short on time.
Yeah.
We got the question.
I got the point. I think, you'll have to have the conversations with these gentlemen separately, how you can embed your solution in their hospitals, and for the rural part, of course, you can go and have conversations with the government. They are open, for discussions. So that will help.
Can I still
A quick
answer
one
it?
last.
Yeah,
Yes,
because
please
the
go ahead.
startup, we should. So, let's have a, parallel discussion outside this. But let me, share your algorithm or your predictive model. First of all, it has to go through a proper approval in an ethical way because there is an ethics committee which sits and they look into your model, and it has to be done on some samples data set. And once it is in shape, then only we can do it in any form to the patients, because this has to be controlled. This has to be done in a controlled fashion prior to used in a larger forum which is related to the patient. Your model says that this guy is going to have a kidney failure. Just imagine the plight of the family, because there is some software which is telling that you'll have a kidney failure. Exactly. So it has to be tested in a controlled environment first before it can be taken to a larger population base. That's my one line view, but I can discuss it outside this panel discussion.
So
we can have
so much.
one more last question.
Can you pass the mic here, please?
Good afternoon. I work with AstraZeneca and I'm a patient centricity lead. A very exciting discussion going on. I think if you look at the patients today, they want to adopt the digital solutions. The life becomes very, very easy for them. However, when we talk to people, a lot of doctors don't want to adopt it because they feel that it's a data privacy issue for them, and their health records data will be misused by someone else. But I think now, as you talked about HIPAA compliance or ABDM approval, so what is the panel, or you suggest, or as an IHW is doing to educate the doctors that they should adopt the digital health more in the benefit of patients?
Shall I? Is it okay? See, there's a famous stuff that what is in it for me. So if you are able to show that what is in it for me, prior to COVID, we used to have less than probably 100 teleconsults per day. It was impossible for us to say to a radiologist, sir, it's after hours, can you do this? So response was never great. Now during COVID, we did our teleconsults move to 1200 times because everybody was impacted. And I'll tell you that I have an EMR app which is 100% adopted by doctors. What it does is that a doctor sitting, as and when the doctor starts the day, assuming that he has 50 patients or 100 patients in his ward, he starts his day, he look into the app. There are 4 categories: the patient who are going to get discharged today, the patient who are going to get operated today, the serious patients. And serious patient is a subjectivity of the doctor. He marks, like you mark favorite on your phone, and they comes, and the 4th, the rest of them. Just imagine that, he sits, he knows that these are the 3 patients who are going to get discharged. He look into their medical records. He sees something is wrong in the last lab, or he feels that there is a need for a X-ray to be done. This is a long story, but you have to hear this. And what he does is that he do mobile order X-ray for this particular patient sitting in the car, starting from his home. By the time, and there is a workflow which gets triggered. Radiologists get into action, a technician get into action, nurse get into action, and an X-ray is done. By the time he reaches hospital, by the time he reaches the bedside, he has seen the X-ray on his mobile hand device, image and report both. Now just imagine that the kind of confidence which he shows when he's going next to the patient and the family. Instead of flipping through multiple pages, what he's doing is that he knows the X-ray. He says that I've asked for your X-ray, it is perfect, now you are marked for discharge. And family thinks that this guy knows each and everything about me. He's not flipping through hundreds of pages. And what he has done, what we have done is that we have made important, it's a doctor to choose what are out of 800 odd vitals which are there in any lab. You pick up your important, which are there on the front page of the mobile, and it's a cheat sheet. And we picked up when we were doing the ward rounds as development of the application, that what is this cheat sheet? Because junior doctors used to have a cheat sheet. As soon as doctor asks, they are rattling each and every parameters. Everybody was surprised. So we made that cheat sheet. Doctor doesn't have to call. So ultimately, what's doctor? So this app, which is now used by all the doctors and surgeons, because they simply love it because information is there on their handheld device in a 3A fashion. Anytime, anywhere, any device. We have integrated all our ICU devices, at least in 55 beds out of 220 odd beds, where ICU devices, especially syringe pump, ventilator, all vitals runtime are there on the handheld device. So doctor doesn't have to call a junior doctor or resident doctor, give me complete history of this patient. The complete history is there. Any intervention he wants to carry out from the home. So I think, tiger once tastes the blood, tiger will never eat the grass. So that's my message.
Wonderfully put, and I'm afraid we have really run out of time. We would like to conclude the session.
So Thank you so much. It has been a very insightful, discussion by the panelists, and I would like to thank all of you, Mr. Angira, Rajivji, Ramji, Dr. Sushil, and thanks to you all for a patient listening to all of us. Thank you.
And thank you all our esteemed speakers for being here for this wonderful session. We would like to present them a small token of appreciation, for which may I please invite upon stage Mr. Vivekanand Mishra, Vice President, IHW Council, to kindly come upon the stage to present the mementos to esteemed speakers. I request Mr. Vivekanand Mishra to present the mementos. We would like to present the memento first to Mr. Virish Narayan. Mr. Arun Goyal. Dr. Sushil K. Meher. Dr. Rajiv Sikka. Mr. Rajiv Sikka. And Mr. Angira Agarwal. Can we have a group photograph, please? With this, ladies and gentlemen, we have come to the end of our second panel discussion, which was on digital innovation for smart hospital diagnostics and medical infrastructure. And now, before we proceed for the lunch break, we know that we're really running short on time. We quickly have a small technical presentation of 15 minutes, for which I would like to invite upon stage Mr. Anuj Jain, President of Reliance Jio and board member of Care Expert, to kindly come up on the stage for the presentation.
Hello. Sorry about little glitch. This is about the 5G healthcare and why for 5G healthcare, cloud-based enablement is important. And we basically, Care Expert is a startup as a Reliance Jio-backed venture. And we basically have enabled the cloud-based hospital healthcare platform. So very quickly, so what we actually bring to the hospitals, we bring the future readiness, what we just talked about. For example, we were talking about the 5G. So when we use the GeoGlass, for example, at that time, you can use all the medical records of the doctors to be seen. And I'm going to talk about it, what is the 5G healthcare means inside for the hospitals. So, but for 5G to work, you need certain things in terms of the cloud-based solution. So we enable basically a fully integrated cloud-based solution, which is a plug and play. So in a hospital, typically there are 10 to 15 different softwares which are needed to digitize all operations for the hospital. What we have done, we have actually enabled close to 56 modules of the hospital, which enables like plug and play. Like you use open a Gmail account and start working. So in the hospital, you just connect to the cloud and all the operations of the hospitals gets connected by the cloud. So you see that we can do, you can have your own cloud. We also sign up the partners who enable the partner health cloud, who can become the wholesaler for us, and they can basically onboard the hospitals, and this cloud can be connected to, of course, the other external services also. So the hospital gets by default the data lake, what we have talked about, and this data lake is for every hospital which we are running close to 150 hospitals right now on this health cloud, for these private health cloud for each of the hospital. And these 150 plus hospitals, they all get by default their data lake, which includes all kind of data like patient data lake, the EMR, EHR records, and the provider data lake. And they also get all the other ERP data lake, your financial system, your HR system, your other parts which are basically important to analyze the profit and loss for the hospitals. So very, very important thing that we enable all the screens in 5G. So we basically have the AR, VR reality or NLP devices. Of course, all the mobile devices are available, and it's a next generation mobility platform which basically we enable. So you can see that our mobile apps are basically for all stakeholders. It's not just for the patient, but it's basically next generation mobility like super app technology. So your patients, your doctors, your nurses, your all the stakeholders in the hospital who needs the access, your billing person, your registration desk, your housekeeping desk, your phlebotomist, everybody can basically work on the mobile apps. And this platform is basically available on laptops and desktop, of course. And you can have both iOS and this thing. So we have enabled HIPAA compliant ultra secure health cloud, which enables basically 7 layers of protection. So all the information with respect to the patient, which is the ultra security needed from a HIPAA and GDPR perspective. We are operating in 5 countries outside India. So basically we make sure that all the security and regulations are fully compliant on the cloud. And we are basically one of the pioneer in the ultra secure health cloud from that perspective. The good part is that there's a very ease of deployment when it is cloud. So we are operating, for example, you are going to see one of the use cases, what we are doing. So chain of hospitals, when you have this chain of hospital is very easy to operate when it is operating from cloud, because you can have the patient uniform experience. You can have the digital experience of the patient. You can control all tariffs. You can have one touch monitoring of all the tags which are happening in the hospital. So cloud-based operation actually is a digital transformation for multi-chain or multi-facility chains. And we basically operate all the release upgrades, patch upgrades, they all happen very quickly. Instead of every site, you have to do this part. So basically what we have done for last 4 years, it's close to 2 million lines of source code. So it's whatever you can think of in the hospital, the software is written for it. So that is why it is plug and play. So you don't have to purchase, like you don't have to purchase 15 different softwares and then integrate. It's basically a single platform which is plug and play. And these are the various parts which we address today. We have the complete HIMS solutions, which typically every hospital is working on. But then we have the complete EMR, EHR. When you have multiple facilities, the patient records are auto aggregated. And that is what we are connecting with the Geo Glass also, that doctors, when they visit the IPD ward room, at that time, they don't have to carry the computers or this thing. They can simply wear the glasses and they can see the medical records. Then complete LIMS, RIS packs, of course, pharmacy. And this is basically another thing which is 4G and 5G connected ambulance. So we can enable the complete ambulance, what in the previous panel was shown. Then we have the medical IoT. There is a stall outside. We can see some of the use cases which we are displaying. Medical IoT, medical AI, which is doctor AI. Then AR, VR perspective. Then we have complete telehealth solutions, which are telemedicine, teleradiology, telepathology, telecardiology. And we have a very, very strong eClaim and RCA, RCM integration. This is our health cloud today as we are operating. We have close to 454. This is what has happened in last 12 months. We were operating at 9 terabyte, and data has gone to 454 terabyte in just 12 months. This is how fast the cloud adoption has happened. And this is basically close to 1 terabyte the hospitals are using every month. And close to 12,000 doctors. Close to 12,000 doctors are using it. This is basically the geographical presence which we are operating. And this is our value proposition. We basically go to the hospital, make it paperless, and that is a reality at this stage. We are seeing 30% TAT improvement. For example, if the patient is discharged in the morning and his wheel out is happening at 4 p.m., typically 3 to 4 p.m., we are able to reduce the TAT by 30%. Typically, we are able to reduce the OPD wait time by 30%. And why it is happening? Because the entire workflow-based system which is designed, they are enabling the hyper coordination among all the care professionals. We also enable NABH JCI compliant workflows inside, and 20% better financial KPIs we see. When it is cloud, there are many other opportunities for the hospital to expand the business. For example, the home care, the OMA based business, or any other satellite clinic business, which is addition to it, because the data is one. So this is one case study, which is Center for Sight. This entirely 60 hospitals, 60 eye hospital run on this health cloud. And this close to 2,000 people of Center for Sight, which is Mahindra Group collaboration. It is operating, and they were all using on-site, which is now Cloudify. So when it is a digital transformation of this nature, and they basically one of the largest eye chain hospitals, and this is a single CFS health cloud which runs. Similarly, this is a Kingsway hospital. It is in Nagpur. It is 37 specialties, 350 bed hospital, which runs on purely on cloud. So we enable them. They don't have any server, any of these use cases. None of our hospital has any server, any storage, any compute in the hospital premise. They simply use their laptop and they simply use the mobiles. That's it. That's what the end of the thing for their access. And of course, all the thing what previous panel, Rajiv sir, Arun sir, everybody has talked about. It's all happening in there when nurses are indenting, sitting in the bus, or nurses are doing the job while they were roaming around. not necessarily on the nursing station, because they are all using the mobile also in the hospital when they are not used in front of the laptops. So this is HCL Healthcare. This is one of the largest corporate healthcare major players, which is basically also a complete cloudification which has happened. So why I'm showing all these things is basically a steel also institute in Eastern India. They were also on completely to cloud, and this is like 1500 bed hospital, which is a huge number. I mean, the total patient footfall is close to 10 lakh patients per year. So when these kind of institutes are, of course, using the cloud technologies, which is enablement, the cloudification and the adoption of the cloud has become very high. I'll just go to some of the use cases of how we are doing in the 5G healthcare. So wherever we are going, we are making the gigabit connectivity to the hospital, because cloud cannot work without the right connectivity. So we are enabling the gigabit connectivity. We are also enablement from the Reliance Jio perspective. Basically, Care Expert is one of the healthcare venture, but we offer cloud and connectivity together as a bundled offer, and we enable the complete hospital Wi-Fi. So if you are on Wi-Fi 6 and your doctor is wearing the glasses, and then basically it enables you to access the data in almost real-time basis. So I'll just go very quickly. Wherever we go, we also enable GeoBook, which is basically a cloud PC. So when you are accessing the cloud at that time, the good part is that the cloud PC, you don't need Windows license. You don't need many other things which is sitting in the Windows operating system. You can simply use almost a 1/3 or 1/4 the price of a laptop as a cloud PC. And that cloud PC is a huge infrastructure saving. The good part is that it's fully secure. The user or the operator in the hospital cannot do much on it except the job you have assigned to. And you enablement of this like cloud PC, which is you can see outside in our box. It's like under 16,000 rupees, which you can spend 45,000 rupees on a laptop or a desktop. So it's basically enablement, and everything is browser based. So you just need a good browser to be working to access all our applications. Then similarly, this is GeoGlass. So when the use cases we are thinking for telemedicine, of course, we have the use case outside. So simply the doctor wears these glasses, and then he can see the electronic medical record, because all our medical records are the digital records in the system. So this is basically a hands-free operation for the doctor when they are visiting in the wards. And this enablement of it is coming up through as a pre-integrated platform. And this is like medical IoT. So basically we enable all kind of medical IoT devices. Of course, we connect all the biomedical, cloudify all the biomedical equipments which are there. So all your radiology equipment, they get cloudify with the Care Expert. Patient monitoring or patient level devices, or even these devices are used by the nurses as the vitals measurement and the enablement. Then we have a AI app store. So for example, a hospital which is like CFS, which requires certain AI from an eye perspective, and Kingsway like hospital, which require a AI from a cancer perspective, like we have talked in the past. Basically, we have the AI apps. AI companies, we basically enablement of the AI app store, and we Avigna is a doctor AI which is designed by Dr. Chetan Hospital also. So it's like a very, very, very sophisticated AI model for triage. So these are the app store, like you have the mobile app store on Android, iOS, etc. Similarly, this is like AI app store where you can have the AI enablement for the hospital for the use cases they are looking for. We are connecting roughly 50,000 hospital, 35,000 hospital. The fiber is already outside. So we are creating the health cloud. And basically when we go to each of these 150 hospital which we have lit, there is no other software running except Care Expert. It's a complete, all the modules which runs on Care Expert. So cloudification, it was a little bit technical presentation, but it was an extension of all the work and all the good things you have heard, heard in the previous sessions, the last 3 sessions. So how we can materialize it from 5G perspective. 5G, the cloud is the prerequisite. If you don't have cloud, 5G will not happen. 5G can happen only if you have cloudify your hospital. That is the basic thing. Without cloud, 5G is a distant reality. I mean, for all the full, when you want to unleash the full potential of 5G, cloudification of your hospital is the first step, and then it basically other things will follow. Thank you so much, and your lunch is there.
Thank you so much, Mr. Narayan, for the presentation and briefing us on the latest technology to be adopted. We would like to present a small token of appreciation to Mr. Jain as well, for which may I invite once again up on stage Mr. Kamal Narayan to kindly present a memento to Mr. Narayan. Thank you, gentlemen. With this, ladies and gentlemen, we have come to the end of the first part of our session, and it's time now to break for lunch. But I'm sorry, due to the paucity of the time, we have cut short the lunch break and kept it for 30 minutes. Request all our delegates to kindly stick on the time, and please be back here by within 30 minutes. Hope to see you soon. Thank you so much, and enjoy your lunch. Bon appetit. We are now ready to start with our post-lunch session. Request your cooperation to kindly come back inside the hall. And once again, would like to request you to kindly switch off your mobile phones or turn them in the silent mode.
What's going on, Zoom fans? Welcome to Whiteboard.
May I please request all our delegates now to kindly come back and take your seats. We are ready to start with our post-lunch session. Well, welcome back, ladies and gentlemen, to the post-lunch session. It is one of the most difficult sessions as after everybody is fueled up, it is very difficult to be attentive and alert for the sessions that are to follow. So I expect the best from all of you. And you're all fueled up, tanked up for our digitally powered session that we are now about to resume. Well, before the lunch break, we had our esteemed panelists and speakers who were deliberating on the various innovative ideas, use of technologies, and the digital health revolution that has taken place in India, the challenges it faces, the footprint, the digital footprint, and how it has reached the urban as well as the rural areas. Well, in this session, in our post-lunch session, after the lunch break, we have our next panel discussion on the overview of digital transformation in the pharmaceutical industry. The digitalization of control processes plays critical roles in the profitability of the pharma business and improves the public health infrastructure. The advances in the digital technology accelerates the drug discovery, streamlines clinical trials, eases up pharmaceutical manufacturing with access to healthcare infrastructure, information, and pharma companies. The session which we are going to have now will discuss the new age digital experience and technology covering artificial intelligence, data and analytics, flexible production, precision medicine, additive manufacturing, blockchain, extended reality, and real-world data. The session is being moderated by Ms. Urvashi Prasad, Director, Development Monitoring and Evaluation Office, Niti Aayog. Ladies and gentlemen, may I please request all of you to kindly welcome Ms. Urvashi Prasad up on the stage. We would also like to welcome our esteemed panelists for this panel discussion. We have two panelists who are joining us virtually. Mr. Mukesh Rathi, Global CIO and CDP, Dr. Reddy's Laboratories, and Mr. Atanu Roy, Group CIO, Biocon Group, who would also be joining us virtually. I would now like to invite up on stage Dr. Navneet Singh Tiwatia, Associate Secretary General, IPA. Please give him a big round of applause, ladies and gentlemen. Ms. Gauri Pathak, Country Service Line Leader, Healthcare IPS DS. IPS OS, my apologies. And last but definitely not the least, Ms. Shweta Arora, Senior Vice President, Global Head of Industry Solutions and Services, Infosys Limited. We have the power of women in this session, and I hope this session would also turn out to be enlightening. Ladies and gentlemen, now I hand over the floor to the moderator of the session.
Is to look at digital transformation in the pharmaceutical industry. So we'll be looking at different dimensions of that. I think it's very clear that, and by now at this point, you would have had other sessions also, that digital is obviously a very important enabler in the entire healthcare space. And also more specifically now that we'll be talking about the pharma space. In terms of bringing about efficiency, in terms of bringing about customer centricity, and also innovation. So I think we're going to touch upon all these different aspects in terms of how digital is really transforming the landscape. And we have a very eminent panel to discuss this with us. We have a short panel, so we'll request everyone to keep their comments to 3 to 4 minutes, so we also have some time for discussion. So I'll begin with Mr. Mukesh Rathi. And my question to you is how, in your experience, you're seeing digital transformation really change the patient experience in particular, because patient centricity, patient satisfaction, these are very important goals for the pharma sector. So in your view, how you are seeing the transformation happening from a digital lens? Request your thoughts on that, please. Mr. Rathi.
Sure. Can you hear me?
Yes, yes.
Okay, thank you. So first of all, thank you for the opportunity. Very happy to be connected on this platform with all the audience, and very happy to join the esteemed panel of speakers to have this conversation. When we look at the patient journey, I think one big shift which the whole industry is seeing, number one, is thinking from overall illness to wellness. I think that is one big shift all of us are seeing. And keeping that in view, the roles pharmaceutical companies or all healthcare companies are wanting to play is to how to be connected with the consumers. And I'm not using the word patient on purpose. How to be connected with the consumers so that we are with them through the good health cycle. Yeah. And in case of those in good health, how do you allow them to maintain good health and remain like that? And those who have certain conditions, how do you work with them in the journey from illness to better health maintenance, and then continue to keep a good health? I think that's one big paradigm shift, and that's one shift all of us are seeing. Now, given that context, I think the another context which we are seeing, which is purely from a digital perspective, is there is lot of devices. Most of us all consume them. It began with mobile phones, etc., but now the whole world of wearables has drastically shifted the way consumer data, health data, all of that is starting to aggregate. Yeah, so that's the second trend. The third trend is on overall health record. Patient health record is getting digitized in many different forms, while we are yet to see as a country one standard which will allow to sort of bring all of this together. But still it is getting picked up in different pockets, either through diagnostics or in hospitals or in interaction with doctors in polyclinics, etc. But there is different parts of patient health record which is getting collected in different parts of the ecosystem today. I'm hoping that sooner or later we will see standardization coming in, and something like the Digi Health Locker would become omnipresent, wherein all of this data comes together for a patient, for a consumer, and with his consent has the ability to truly use it to provide personalized service or personalized health recommendation for himself. So that's sort of the overall spectrum and trend. Now, what's happening from a digital intervention or a transformation perspective is, number one, organizations like us, like pharmaceutical companies, are wanting to play an active role in the whole journey, in the whole illness to wellness journey. So there's enough and more we are trying to do as companies to look at the whole therapeutic or the disease life cycle and be with the patient, not just in the episode, but in the whole life cycle. And this is coming together in the form of either health platforms, in the form of digital therapeutics, in the form of various other aids, which one could provide to patients to be successful in the whole journey. Second, there are a lot of innovation, lot of startups are showing up in various spaces. I mean, multiple examples, but even say from a provider perspective, now there's an app which essentially aggregates demand from, say, mid-tier towns for high-end surgeries, so that the surgeons could actually travel to these mid-tier towns and provide that service, which was always a challenge for mid-tier small towns actually to go to a bigger city for a specific intervention, etc. What one is looking. So there's a lot of intervention there. There's a lot of intervention on ongoing good health. Again, I mean, multitude of apps. I'm sure each one of us is using one of them in some form or the other. So that's the whole spectrum we are talking about. Big transformation ahead of us. I think the big challenge is the standardization, and I'm hoping to see in some form it should come together, ensuring that there is enough data privacy, and with consent, every consumer or patient is able to bring this together to get the best personalized service for himself.
Thank you. Thank you for those very insightful comments. And I'll now move on to Dr. Navneet and request your thoughts on innovation in the digital healthcare space, and how do you see that panning out, and what can we do better from a regulatory perspective, policy perspective, to provide a better enabling environment for innovation in the digital healthcare space? So request your thoughts on that.
Thank you. Thank you very much. Good afternoon, everyone. I represent Indian Pharmaceuticals Alliance, which is a consortium of Indian research-based pharmaceutical companies. We have 24 big pharma companies from India in our alliance. And today I'm here representing the organization. Thank you very much for inviting. Digital aspect connecting with healthcare and how innovations can help. I'll go a little backwards, not only healthcare, but in the pharmaceutical sector. Pharmaceutical sector is highly regulated, right from the early discovery to the development to manufacturing, sales and distribution, dispensing. Every aspect is highly regulated. And within this regulation, complying to the regulation, it adds to the compliance burden. We talk about ease of doing business, but when companies and all the stakeholders who have to comply, it adds to lots of burden. So bringing digital innovation can really help easing out those creases, reducing the compliance burden right from the discovery stage. It can help, digital innovation can help the clinical development process be shortened, revolutionized, fast-tracked. When it reaches to the regulatory stage, that's where the digital can really help. We have a Sugam portal in our country at the national level. If it can be integrated and all the submissions, tracking of the submissions and the approvals, the authorization, if can be given digitally and which are valid, I think that will go a long way in improving our overall healthcare, especially in terms of the health commodities, pharmaceuticals. Digital will also help a lot in the personalized medicine space. So yesterday I was reading about a portal, the Navya portal in Tamil Nadu. It has helped patients in big way, the cancer patients, where how AI is being used for bringing better patient outcomes, giving the better results using the artificial intelligence. In big country like India, supply chain is a very big issue. So digital innovation can really de-risk the supply chain. It can make the stock availability available to the policymakers and all those who need it in a real-time basis. So digital has a big role to play. Last aspect, our human resource. We are one of the largest producer of generic medicines, but going forward, as we move into the innovation space, we will need lots of skilling, reskilling, upskilling, and there the digital can play a big role in terms of online education to our professionals. So with these words, I think I would say the dots connecting healthcare with all the other aspects in the ecosystem, digital has, innovation has a long way to go. Thank you.
Thank you. And you touched upon several important points there. We'll go deeper into some of them. My next question is for Mr. Roy, who's joining us virtually. Mr. Roy, how do you see the whole issue of data integrity and data privacy in relation to this whole digital space? Because it's obviously very important to have data sharing. And also it's an issue in terms of, sharing between pharma companies, also regulatory agencies. So how do you see this whole issue of data integrity and privacy in this context?
So you have raised a very important point, and I would cover it in 2-3 aspects. One is that actually digital transformation and digitization of the various processes and systems are helping in data integrity. So in the quality space or in the manufacturing space, by having convergence of architecture and connecting various systems, that is helping in data integrity, which was earlier a big problem for many pharma companies. And companies who have embarked on integrated systems connecting data from the source have to a large extent addressed the data integrity problem. However, as we do Industry 4.0 and as we integrate level 2 systems with level 3 systems and level 4 systems, and create a connected factory, smart factories, and the connected labs and the labs of the future, one of the challenges which happens is, which was not the risk earlier, is if there is a cyber attack, then it is very easy to, it affects many of the systems and it stops operations. Second thing is intellectual property and data leakage can also be, it is more vulnerable to that. Earlier, when it was disconnected systems, there was less chance of data leakage happening. And now with connected systems, it increases. So how do you create the cyber security infrastructure and how you do micro segmentation of the entire ecosystem to prevent data thefts and data leakage and protecting your intellectual property while you collaborate with various business partners is an important part of the architecture, which needs to be thought about. So just to summarize, I would say that with digitization, data integrity has improved significantly. I have seen in the last 10 years, the state of data integrity, which was there in the most of the pharmaceutical companies in India, compared now with significant digitization, which has happened in the QC labs and manufacturing, data integrity has improved many notches higher, which is a good thing. But with Industry 4.0 and connected factory and smart factory, which are currently, most of the companies have embarked on that journey, how to protect data leakage and intellectual property and prevent cyber attacks. There is a lot of thinking which needs to be done on that.
Thank you. Thank you. My next question is for Ms. Gauri Pathak. And my question is really, and Dr. Navneet also touched upon this, capacity building. Given this whole digital transformation, how do we really build capacity of different stakeholders, whether it's in pharma, whether it's the doctors, the patients? How do we build capacity, and what shifts do you see happening, or do you think we need to make to do this better?
I think we need to first understand how the lives of doctors are changing because of the digital transformation. Because that has a direct impact on the strategies that pharma companies will make. As we rightly recognized earlier, the Indian pharma market is a branded generics market, which means for every molecule, there are at least 100 brands which are present. In the traditional model, pharma companies promoted these brands to doctors through the medical representative. Now, the doctor's life is changing. I mean, personally, when I saw a doctor prior to the pandemic, I would go sit there, chit chat. He typically knew about my profession, my family. He'll ask me questions about it. And we had a very healthy discussion. At the end of it, he'll say, lose weight, don't take so much stress and all that. Today, I go and meet a doctor. It's an altogether different scenario, right? A recent consultation I had, he's sitting in a cabinet which is enclosed. And I felt as if I'm answering a questionnaire by him, because he has to punch in that data on his software. It's very important. All the big data analytics that we are talking about, essentially the medical practitioner is punching that data through information received by from the patient. So he's trying to do his best. He's also doing virtual consultations with patients and using his time for maximizing the patient load that he sees. So his life is different. Now, in the whole gamut, a pharma company now has to build capacities to promote brands to these doctors, right? And that is not easy, because digital transformation does not necessarily translate to the doctor having more time at hand. In fact, in certain cases, it might be the opposite, because he is using that free time to do more patient consultations. So in terms of building capacities, most pharma companies are embracing an omni-channel strategy. They cannot solely rely on the rep to transform information, clinical evidence, brand-related data to the doctor. So they are looking at innovative ways of using digital technology to reach the doctor and convey the message.
Thank you. My next question is to Ms. Shweta Arora. And the question is, what do you think are some of the critical factors for developing sustainable digital health models, and where do you see the role of public-private partnerships in these models?
So for the success of any digital health would be if you can disrupt, I really call the three vertices of the golden triangle of healthcare: access, cost, and quality. It's all about disrupting that and making an impact. I think if I look at the factors that are very critical for a digital health model, I think a lot of it has been talked, I think, in the previous sections. But if I summarize, it's really about creating one networked ecosystem, right? Pharmaceutical industry talks about molecule to market, but digital transformation is making this literally from molecule to patient. How do we ensure that there is one connected ecosystem with interoperability, right? That's, I think, it's preaching to the choir. Everybody's talked about it. And that is second factor is the data standards. We adopt data standards that get followed by all the participants. Third factor is, which is where a lot of the problem also starts, is regulatory. The nature of digital innovation globally has been that regulation is, digital innovation has been that regulation is always catching up, right? And that's how it is. It's the speed at which this innovation works, and that results in a lot of misuse of data that happens, whether that is, privacy laws or, telemedicine laws. And worst is that a lot of rip and replace happens. Entities invest and then suddenly a regulation changes and you're having to rip and replace. So I think we have an opportunity. Being a laggard sometimes is an opportunity to learn. So how do we bridge this gap? If not eliminate totally. I don't think we can ever eliminate it. Regulation will take time to catch up, but we ought to reduce this, this gap. And I think from our experience of working with clients in Infosys, change management is very critical, extremely critical. There's lots being talked about how telemedicine got adopted through the pandemic. Yes, pandemic was absolutely a catalyst. What could have taken us 10 years to change behaviors happened in just about a year because of the dire circumstances. It's an opportunity, but let's not fool ourselves that it'll be long lasting. I think in one of the earlier panels, we saw a user experience journey of a patient. The experience still is very clunky in most of the solutions out there. I won't be surprised if, how many of you raise your hands, you consulted a doctor during the pandemic over WhatsApp and got another, somebody else's prescription forwarded to you. So of course, I'm taking a very rudimentary example. But we have to, we've talked about patient, and I'm glad you mentioned, Gauri, about doctor's experience, right? You can put this very beautiful infrastructure, but if we are not focusing on that experience design, getting into the life of that doctor, none of these systems will get adopted. See, the entire burden of the data that you're gathering through this connected ecosystem falls on the patient providing you the data, the clinicians providing you the data, the doctors putting it. If you're not making it easy for them to put that data, these systems will never take shape, right? EHRs, EMRs have been around for so many times, for so many years in other countries, but never got adopted. But I know we are now doing quite a pilots as to how do we make that easy, right? At the point of entry of a doctor, when he's inputting the information, can we use speech to text speech to text APIs to make it easier? Can we embed clinical decision support systems? So there's a lot being done, but the focus has to be that user in the whole system. And last but not the least is an ecosystem of local innovation, and which is to your next question here. I think local innovation ecosystem extremely important. I think we know that our culture or our cost structures, our healthcare system, is very difficult to translate something from the outside. It has to be groomed from within. So that melting pot of local innovation ecosystem is very important. So that brings me to your next question about what can public-private partnership do in this space. I am actually very gung-ho on the whole Digital India blueprint. Starting with the public investment that's happening in, let's say, through the BharatNet on laying that fiber infrastructure. Fantastic blueprints on building the India stack, over which we are laying the national health stack. It's a very innovative and a very new concept where the government is literally creating the what we call as the digital plumbing, the whole a set of APIs that are really the foundation that's being built. But what that national health stack is doing, right, is that it is creating a sandbox for innovation, right? Very easy access to data. Private sector will be able to innovate a lot faster on our solutions for this market, for our market. And those that become successful, you have the infrastructure to translate that into large-scale commercialization. It's a phenomenal blueprint. It's yielded us results. I don't know if some of you follow fintech would know India Stack, the UPI innovation that has happened. Most of you must be reading about this whole open digital commerce network that we've started. I think the national health stack has that same capacity. So as a technologist, I get very excited about what that potential that holds, right? Another layer of public-private partnerships, which I'm not necessarily I've seen that happening in India as yet, is if we could build a corridor or with hopefully with physical proximity to something that is very similar to, let's say, what a Silicon Valley is, right? What does that make that whole innovation ecosystem sustainable with a virtuous cycle? It's coming together of your academia, some very large private sector, startups, and venture capital. All those four aspects coming together is where that entire virtuous cycle of innovation begins. In the pharma space, you have, let's say, example is the Golden Triangle in UK, the Cambridge, Oxford, and London. It hosts AstraZeneca, GSK companies. It hosts startups. The UK government provides that rich data from NHS, right? That single payer system data that comes in. And all of us have taken the Covishield jab. Right? It's Oxford and AstraZeneca where it all got done. I'd love to see some of that kind of a government stepping in and engineering such an ecosystem that creates what I call as a virtuous cycle of innovation. That's how I see this working.
Thank you. We'll now do another round of discussion with our panelists. And for this, I have a common question really for everyone. If you can just summarize or highlight for us one key challenge and one key opportunity from your perspective when we look at digital transformation in the healthcare and the pharma space. And also if there's any learning that we need to draw or any major lesson that you think we can learn from another country or maybe something that we've seen in another state in India, that would also be very helpful. So we'll begin with Mr. Rathi.
So the way I look at it is, I think the challenge and the opportunity is probably similar. The challenge is that the industry is a laggard with high regulatory, overhead. And over a period of time, at least when I look at pharmaceutical perspective, a lot of focus has always been around compliance, and in some form, tends to become tends to create a mindset issue whenever one thinks about transformation beyond thinking compliance, beyond thinking data integrity, etc. I mean, all of those are given and one has to cross that bridge. But ability to think beyond and shift mindset to true transformation, truly using Industry 4.0 for next level of manufacturing transformation, thinking about digital to thinking from science to say digital science, thinking from PSR meeting doctor to true omni-channel 360-degree connect. All of these are talked about, but I think there is a big gap between where we want to go versus where the industry is. And that is also the opportunity. When you have a big gap from where you are and where you want to go, there is an opportunity to leapfrog. One can learn so much from the external world right now that one does not have to follow the steps the other industry has followed. And you could leapfrog and directly go to the end state, sort of take 5 steps instead of 1 together. And that is a big opportunity ahead of the healthcare industry to, make this happen. Learning wise, I think the big learning is in the tech industry. I think Shweta spoke about standardization. My sense is this industry is still missing the USB. The tech industry had USB as one great example of standardization, which transformed the way data moves. I think this industry needs that USB standard, which allows data interoperability with the right level of standards, privacy, and security. And that would truly enable both transformation at patient level, doctor level, and at the industry.
Thank you. Dr. Navneet?
Yeah. So what challenge we have, and also I was asked about quality. I would say that we have an opportunity and challenge together. Indian pharmaceutical industry, it's called pharmacy of the world because of the reason that we supply medicines to one of the to the most stringent markets, US, UK, European Union, Japan, Australia, but still there are questions on the quality. So the issue is that this system of dual quality, different quality for exports and different for domestic market, We need to, going forward, do away with it. India should become member of the PICS, which is a global consortium where there are quality standards. Everyone accepts that. So we need to move up, but that's a long journey. What comes in the way is also the stringent pricing control on the medicines. So we need to be more liberal, and especially the products which are not very high priced doesn't need to be under the price control. Rather should work on more on health financing, providing options to the patients so that they do not run out of money through out-of-pocket expenses. There are various challenges. I'll not talk about that, but opportunities. We are largely a volume-driven industry so far, almost $50 billion industry, 25 billion exports and 25 domestic. But that's a very small proportion of the global pharmaceutical industry. If we need to move up, we need to get into the value space. And digital transformation within the pharmaceutical research, manufacturing can go a long way. We need to move up into the future technologies. For example, during the COVID time, when the people working in the plants, they were infected, the plants were shut down. The manufacturing capacity came to almost 20% of the total capacity. People working on the machines in the research labs, especially the quality control, quality assurance labs, people were not able to attend. So how can we use more of automation, digitize our operations, use virtual reality? I recently saw one of the exhibit where the plant operations can be operated using VR, where the operator functioning can be standardized so that we have a consistent quality, less chances of human error. Because if you have quality health commodities, only then you can have quality healthcare products. So these are, but we have huge opportunities going forward to become maybe in the top 3 pharma markets in the world. Thank you.
Thank you. Ms. Gauri.
I think the opportunities are many, but if I were to prioritize them, I would say the first one would be, faster drug delivery processes. Who would have thought a few years ago that big pharma is going to collaborate with the tech companies for drug discovery, right? And now we hear it everywhere. So that is number one. Number two is, as we discussed earlier in the earlier sessions also, is faster, earlier diagnosis, which means better quality of life for patients. The other one I would say is more power to the patient. Thanks to the digital transformation, the adoption of digital health among patients is on the rise. The patient is more in control of her health, and that gives her more power. So I think these 3 really, to me, are the key opportunities. In terms of the challenges, I think data privacy will continue to be a challenge, no matter how much we try to tackle it. There will be ways that will challenge us as far as data privacy is concerned. The other one is to make digital more relevant to the patient. We've seen across multiple studies that we do at Ipsos that while adoption of technology is increasing and there is excitement around it, continuous usage of technology still has a long way to go. There are many dropouts because patients don't see the relevance in the long run. So the solutions that we offer have to be relevant to the patient in the long run as well. Thanks.
Thank you. Shweta. So I think if one is to take some examples from outside, interoperability will have its challenges. I think you talked about data standards being adopted, but I think we also have to look at how do we create the right incentives. It has to be a combination of incentives and governmental mandates to get every participant onto that ecosystem that you create, right? I'll give examples to say, despite interoperability being a desire in the US healthcare system still hasn't reached. For example, a provider sector or a hospital sharing its patient data openly on, let's say, one registry which is accessible, the electronic health records registry, which is accessible to everybody. That entity is giving up their competitive, it's competitive information. It's the entire, information about the hospital, which can then be used by anybody, right? These concerns are probably, can be seen today that despite the interoperability standards, right? US is also taking one step at a time, like a peer-to-peer interoperability or the mandate to exchange information is still not worked out, right? Because they don't want to share their member data because that's giving up their competitive advantage. So I think that has to be very well thought through as to what incentives we create for the participants and where it has to be a governmental mandate. You don't do it, you're an information blocker, and therefore it'll have consequences. So I think that's a challenge that we'll have to weave through very careful deliberations between the government and the participants. So that is a challenge. The opportunity is immense. I think the biggest opportunity for us is to really make healthcare very inclusive in this country to everybody. We've all talked about, we are one of the lowest when it comes to total healthcare spends. We have the worst doctors, to patient ratios. I think digital health has the opportunity to bridge that, and the opportunities are huge. We look forward to a whole innovation ecosystem building this country to start churning out those applications, that can be then translated across. So I think that's really the biggest opportunity to make healthcare truly inclusive in this country.
Thank you. I don't know if we still have Mr. Roy with us.
Yeah, I'm there.
Yeah.
Most of the panelists have covered most of it. So the way I look at it, one of the challenges, the pharma manufacturing R&D is actually very complex, and it has also a lot of regulatory things. And what was being talked about as that is one of the hurdles to the innovation, but I see also maximum opportunities coming there. For example, as we get into the value chain of more complex manufacturing processes, more sterile processes, that is where digital technologies can actually help in the manufacturing process with much more sophistication, ensure that the drug qualities are proper and the regulatory norms are being followed. We don't have to have people to oversee things. Lot amount of advanced technologies like robotics, metaverse, the remote operations of machines. If the machines are in a sterile place, operator can be sitting outside or even at home and start operating the machines. So those are the opportunities which are there in pharma manufacturing. That is extremely complex, and as pharma manufacturing, especially the many of the companies who are focused on advanced drugs, the sophistication of manufacturing is increasing. Their digital technologies are going to help in the manufacturing process to ensure proper quality is produced. So I think that as an opportunity, while the challenge had also been that the complexity of manufacturing processes and regulatory norms were quite difficult.
Thank you. I think we have just a few minutes. So any quick comment or question from the audience? Yes, we have one hand up there. Could someone help with a mic? Any of the organizers, if you could help with a mic in the audience? Yeah, thank you.
I have a question. Am I audible? Yeah.
Yes, yes.
I'm Dr. Kavar from Key Healthcare Private Limited. My question to Mr. Roy is, what do you think, the biggest challenge in my view is the lack of digital expertise in pharma industry or the manufacturing. How we can overcome from that? Thank you so much.
Yeah, so actually, this is a very, very important point you have raised, and I think this was also covered earlier that there has to be significant amount of skill development which is required for the pharma, for digital in pharma manufacturing. I encountered that in all the companies where I have earlier worked. So I think the change management process and the skill building process, all modes has to be worked out, right from the pharmaceutical colleges in their curriculum, right from there, the digital technologies in manufacturing needs to be introduced. There are other countries, for example, in Ireland, there is a facility where Industry 4.0, the whole model is there, and it is a functioning plant owned by operated by supported by the Ireland government, where interns can come and work there, get experience. So right from the pharmaceutical graduates, it should start, and then we should have facilities like that as well. So model plant of the future, where people get experience, and also people who are working in the industries, they can come to these facilities and get experience in the multiple technologies. So the learning path for pharma manufacturing graduates and people who are working in pharma manufacturing, digital technology should be now integrated as part of their overall curriculum, not only when they are colleges, but while they are working in the industry. And the SOPs have to be also modified accordingly.
So I would also like to add a few points here. From Indian Pharmaceuticals Alliance, we are working with the Pharmacy Council of India for course upgradation. I passed out from Pharmacy College 21 years back, and today still the course is same, where it need to be fit for the purpose. So this work is happening with the PCI. Second is the Life Sciences Sector Skill Development Council. It's undertaking courses for upgradation of the skill set, especially in the people who are working in the technical space. Luckily, right now, the Secretary General of IPA is also the chairperson for the Life Sciences Skill Development Council. So we have this unique opportunity where we can club the pharmaceutical sector with these two organizations which have mandate for the skill development.
Thank you. I think we're...
One more to Dr. Navneet. So we are talking about the digital and all, but still I believe we are lacking in the chain system, the channel partner, especially in the life-saving drug like insulin and all. They are not maintaining the temperature, the 2 to 8 degrees centigrade. I believe I hope you agree with me. When it reaches to the patient, if patient will not able to take the right insulin, it will go to the hypoglycemia or hyperglycemia. Thank you.
Yeah, I agree with that. That's a long way to go. And I understand the cold chain management in case of the thermosensitive products, it's very important. But it's also a matter of sensitization and awareness.
So, yeah, we've had a very rich discussion, and we'll just bring this panel to a close now. I think we've discussed many different aspects. Right from regulatory policy to innovation. We've spoken about data sharing, interoperability, data privacy, capacity building. I think we've had a very important discussion on capacity building, skill development, how we need to perhaps relook at our curriculum, and then customer satisfaction, patient empowerment, patient centricity. So I think we've touched upon many different dimensions. I think as Ms. Shweta had put it, the pandemic gave a fillip to a lot of the digital transformation, but we now cannot afford to sort of sit on our laurels or just be comfortable with what we've achieved. I think both the public and private sectors need to come together so that we can keep up this momentum and continue to accelerate what we've seen in terms of digital transformation during the pandemic. So with that, we'll conclude this panel. Thank you very much to all the panelists and also to the audience. Thank you.
And thank you so much, ma'am, for conducting the session so beautifully. Yes, with that, ladies and gentlemen, we have come to the end of this panel discussion, and we would like to commemorate the occasion and felicitate them with a small token of appreciation, for which may I please invite upon stage Mr. Vivekanand Mishra once again. I request him to kindly come up on the stage and present the mementos to our esteemed panelists. We would first like to honor Ms. Urvashi Prasad. Ms. Gauri Pathak. Ms. Shweta Arora. And Dr. Navneet Singh Tewatia. Thank you so much. Can you please have a group photograph? Thank you, everyone. And now, ladies and gentlemen, we move towards our next technical presentation, for which I would like to invite upon stage Mr. G.N. Balakrishnan, Director, Sales and Business Development, APAC, Zoho Corporation. Along with him, I would also like to invite upon stage Ms. Aarti Elizabeth Anbu, Head of Marketing, Zoho for Healthcare. Ladies and gentlemen, please welcome them up on the stage. Can you please have Mr. G.N. Balakrishnan? Oh, there he is. Okay. Just getting digitally ready for the presentation. Well, after this technical presentation, we will be having 2 more sessions, and after which we'll be having the Transformer Pitch podium as well. But right now we have the technical presentation. So are we ready? You can come up on the stage and take the podium in the meantime.
I'll get the slides then. Okay, good afternoon, everyone, and welcome you all for the second IHW Digital Health Summit here in Delhi. Before I move on to the presentation, our sincere thanks to organizing committee on behalf of Zoho for giving us an opportunity to be part of this event. By the time the slide is getting ready, I'll just a small brief about Zoho. We are a cloud-based product development company offering online. Okay, say, can I have the slide? Thank you. Okay, sorry for that. We are a cloud-based product development company offering online office suites and business tools for small, medium, and large enterprises, okay, to run the entire businesses. We have been in existence for last 26 years, operating in 160 plus countries, offering 45 plus integrated application with 75 million users worldwide. We are based out of Chennai with the current employment of around 13,000, and we intended to double the resources in next 2 years with a growing demand. Next slide. Next slide. Okay, because it's okay, fine. Our journey started as a network management company way back in 1996, and we expanded our footprints to global market in 2001. In fact, we are the early movers and adopted to cloud way back in 2005 with the launch of Zoho Writer and CRM. Zoho achieved its first milestone of 1 million users in 2008, and in the next 14 years could able to successfully onboard 73 plus million users worldwide. Next slide. Next, no. Okay, Zoho was not built in a day. We have been designing, developing products for last 2.5 decades that could able to make a meaningful difference in business operations. Either it could be sales, marketing, finance, HR, business operation, business intelligence, communication, and so on. Next slide, please. Okay, Zoho is known for its individual product. In fact, 2017, we launched the game-changing unified business application called Zoho One. You know what it does is, okay. Just, okay, can you? Can somebody do that? Okay. We launched Zoho One, the unified software platform with 45 plus applications, offering the integration and scalability across multiple business function. In fact, any businesses can effectively run right from the business function to IT operations end to end through one sign-in of Zoho One. In fact, we onboarded 50,000 customers in last 4 years, out of which majority are the larger enterprises, and 7% is from the healthcare industry. Okay, the vision for Zoho in healthcare is to empower the evolving technology. I'm not going to talk about this much because healthcare challenges across the key stakeholders have been enough discussed and debate from morning, right? However, to reiterate few of the things for the administrator, access to data is becoming critically challenging, right? Even you have an access to data is not consistent across the providers or the centers. And one of the major challenges about the privacy concern with reference to patient data, security concern with reference to technology. And as far as the clinicians are concerned, there is no secured central system on patient data and lack of collaboration among the clinicians, nurses, and the other healthcare staffs, which we see very, very commonly, right? On the patient front, even access to care itself is one of the major challenge now. Even the last session, people were talking about this. More importantly, the continuum of care with growing evidences of mortality in patient with non-communicable disease, including the younger generation. This is one of the major challenge. And the other one is absence of longitudinal health record. This is very, very critical. Again, this is connected to the continuum of care. Today, at any given point of time, patient do not carry their past records or the past medications in a structured, standardized manner, right? And the last one is about the concern on self-data about the security and privacy. Okay, Zoho is known for its non-healthcare products. In fact, now we started designing, developing solutions or trying to customize the solution for the healthcare. Today, many hospitals, are using these products. For the administration, we do have Zoho Forms, where an hospital can able to easily create, customize, configure the forms to collect the patient data, including the demographic, past illness, current medication, and so on. Zoho PRM, which is to maintain all the patient record securely with improved accessibility in one place. And then Zoho Shifts. This is this is an employee scheduling app which provides a holistic view about the workforce management. We do have Zoho Sites, instant website builder, which hospital can use to create an visually appealing websites in a click of second through the drag and drop intuitive tools. And we have integrated this with a payment gateway. And we are using our sites. Zoho Analytics, which is now becoming very, very critical because today hospitals do have data. Do they have a clear analysis or analytics? Do they have the dashboard? The answer is a real question mark. So Zoho Analytics aid the hospital through the business intelligent and analytical platform to have the analysis of the larger data and thereby providing the dashboard and the reports. On the clinician side, we do have electronic health record. Probably many of you might not know that Zoho has an electronic health record. We do have the healthcare IT vertical called Medical Mind. This is based out of US, and we've got a very strong presence of the electronic health record in the US market with 2+ million users, right? We do have electronic health record. The key distinct feature of this, oh, sorry, what happened? Okay. The key distinct feature is about the configurable templates, including the SOAP with this template library. We have recently designed a hospital information management system with 11 core modules, primarily for the Indian market, right? And there is a reason to come out with an HAMS. People talked about the standalone devices. In my subsequent slide, I'll be showing what exactly we would intend to do in the healthcare space. So we've got electronic health record for the outpatient management. We have got HAMS for the IB. We do have intelligent ICU. See, one of the major challenge what we see in India is about the structured data form in ICU, right? ICU patients are critical. Do we have the structured data form of the patient? The answer is no. So we have now designed a platform called Intelligent ICU. This is primarily an ICU monitoring and care management, where you can able to have an holistic unified patient dashboard, real time of video streaming. In India, most of the hospitals are open ICU. It is the treating physician who admit the patient. So we have done a video streaming on the bedside to make sure, despite the fact that the doctor is not in the ICU, still can able to see the patient through the remote and guide the respective intensivist who is in the ICU. And then the managing progress notes across the healthcare stakeholders. And more importantly, early warning scores. This is something which doctor can use through the templates, right? Either it could be Apache 2, SOFA, or News 2. Similarly, Braden scales. Everything can be pre-configured to make sure that this is user intuitive and can able to add the real value to the clinicians. And the efficient record keeping and so on. We do have a telehealth. I was just sharing during the break to one of the hospital key stakeholder. We have integrated our telehealth platform with the tool which can able to cater 5 basic vitals, including the random sugar as well as the ECG, right? This is called Green Ocean, and this telehealth platform, integrated telehealth platform, is being currently implemented in one of the India's largest rural healthcare activity called Arogya Parivar, run by Novartis, the leading pharmaceutical company. So every year, their objective is to adopt 12,000 villages and cater around 2 to 3 lakh patients every year. So the entire Arogya Parivar platform runs on our integrated telehealth, including the places like Northeast, right? And we do have Zoho Work Drive, a unified space to store, share, and work together on the files of real time. And many of the hospital today uses WhatsApp, right? So we do have the Click the Real substitute for WhatsApp, one-on-one communication with the stakeholders in the hospital, team communication. Even a surgeon can able to schedule and group as and when he's posting the patient for the surgery, right? Today, what happens is that everything happens through an unprofessional way of communicating to an OT physician and then scheduling and booking an OT theater and so on, right? So this can be streamlined through our Zoho Click. ICU dashboard I was talking about. Okay, this is a standardized format of monitoring in ICU. It is currently getting government hospital in Deep South, which is Asia's first neonatal ICU, 30-bedded ICU in Tirupattur. They are using this platform, and with the BPL patient monitor, we are with a monitor, and we have also integrated with syringe pump, and we are planning to integrate with most of the ICU devices that are used in India. So eventually, the record will seamlessly flow from the devices to IntelliICU. From IntelliICU, the data can actually get into an HAMS, which is by that entire product. This is again the subsequent screenshot. Last slide I talked about the holistic view of the ICU dashboard. Now you can see the patient-specific dashboard, where you can able to see which are all the what are all the devices which got connected with the patient. What is a care plan which is created by the visiting physician in the ICU? Like a patient who is very sick can be reviewed by a nephrologist, neurologist, and so on. Whatever the care plan which is getting created by the respective physician can be viewed by the intensivists and other stakeholders as and when they come and see the patients. And ECGs can be stored, and you can able to have the trends in a real time. This is the architectural diagram of intelligent ICU, what I was talking about. So you have a server model which can be placed in the hospital, and you can actually integrate with the HL7 communication devices. If it is not HL7, at least HL7 supported protocol supported devices. And then from IntelliICU, this can actually move bidirectionally to HAMS and can be given as an application in desktop and systems. In case the hospital would like to have in cloud, we host it in cloud too. And again, many of you might not know, Zoho do have a medical devices company. It's not a startup. We have been in medical devices for the last 10 years. What we do in medical devices space is to build medical devices or the products that otherwise would have been dreamed to India. And we have first time built the patented syringe infusion pump. For the first time, the syringe pump is getting patented for the closed loop motion control technology, which drives better accuracy. So how this is related to the entire slide, what I'm presenting now is about, this is Wi-Fi enabled. So we have also integrated this with an intelligent ICU. So what happens is that you can able to efficiently remotely monitor the entire live real-time data of syringe pump, and then the configurable drug library. From a tablet, from a system, you can able to configure the drug, and then you can push it to the syringe infusion pump, which otherwise the pump is being taken to biomedical and it takes 1 or 2 days for them to configure. And we have got an infusion audit report, right? Any given point of time, you can generate a report of last 7 days, which patient, what infusion was given, when the alarm was initiated, what was the necessary intervention, and so on. And this can be, taken as a Excel format. This is yet another product which many of you might not know. This has been designed, developed, and built in Zoho. None of the components, what we manufacture, whatever the product we have is not from the China. With all due respects, we want to design, develop everything out of India. That's our objective. This is a drip rate monitor. See, we have got for ICUs, we have got syringe pump, we have got large volume pumps, we have got ventilator, we have got CPAP, high flow nasal cannula, and so on. But do we have an device monitor and when the gravity infusion has been initiated in patient? And what? The answer is no. I'm sure would vouch as and when the patient is getting admitted in the ward, when NS or DN of the time the patient attender goes to the nursing station and say, hey, IV got over. So in the bargain, there's a backflow of blood. When there is an stable comparing to ICU, there's a swelling in Venfan site. Many a time patient fiddle and do the overflow. So now with Wi-Fi device, we have actually moved the entire monitoring to tablet. So nurse in the nursing station can have a holistic view of all those entire rooms. When the gravity infusion is getting initiated, which is less than 100 gram, and you can remotely monitor the complete IV status. You can take an audit report, you can generate a report IV for how many times. And this again is getting integrated with our IntelliICU. This is on the patient side. We've got the mobile applications, and people talked about that. You know, how do patients get connected? Continuum of care. I was talking about continuum of care. How do we really build a continuum of care? Unless or otherwise, patient can able to connect to the provider whom they have been regularly seeing without an hassle. So we have built a Zoho. We have built a product called Zoho Booking. Patient can able to book an appointment at any given point of time. We have got Zoho Desk. Again, can be integrated with the hospital HAMS or the hospital system, where you can able to raise the ticketing on your past consultation and so on. We do have patient portal to have the longitudinal patient health record and current medication, past medication, and your own personal health trackers. And finally, the telehealth. I talked about the telehealth for the hospital. It can be downloaded as a mobile application. A patient can able to actually schedule an appointment with the hospital for the teleconsultation, and data can be shared seamlessly. Okay. Again, even the last session, people were talking about the security. Privacy and security is a major concern in India, despite the fact there are a lot of ecosystem is getting built now. To just highlight, we are GDPR compliant, SOC 2 and HIPAA compliant. We do two-factor authentication and ISO 27001 certified organization. Okay, I talked about the medical devices, and I talked about the integration with our IntelliICU and then the HAMS. Okay, now we are also building in first time. This is a patented product. We have licenses from one of the doctor from Ramachandra Medical College and Research Institute in Chennai. This is needle guidance assistant device for doing the biopsy. So what it does, it reduces exposure or doctor getting exposure to the radiation. It has got a better angulation so that the patient need not have to be subjected for frequent pricking as and when they want to do the biopsy or ablation. This is patented across US, India, and this again is being enabled by software. I don't know, today you got devices getting integrated with HAMS with the other hospital system, but still the gap is about the high-end devices like CT machine and the MRIs. So we are building this ecosystem. It's a work in progress, but the device is getting launched in the month of November. Right? The closest combination of this device, ablation device, is from Cashinex in Germany. It costs 3 crore in India. We are building it at 25 lakhs. So relatively, we are bringing the cost to a greater extent where every hospital can able to go for this procedure, where you need not have to have a seasoned, practiced interventional radiologist to do a procedure. See, in India, if suppose you see a mask and ablation need to be done less than 3 mm, doctors do not touch, radiologists do not touch. They ask the patient to go back and come or to the bigger institutions, right? So the risk of that is being relatively reduced with the launch of this product. Okay, this is something which would be really exciting. Zoho, for the first time, is building portable MRI in India, right? Today, MRI is a big dream in India. It's been dominated, 90% of the market is dominated by GE, Siemens, Toshiba, and Philips, right? So it is getting built in Bangalore. It will get launched next year. Already the CDSU approval is done. There are some clinical trials which is getting done as we speak now. So portable MRI can be moved across hospitals. And the most important thing, we moved away from helium. It is dry magnet. And second important thing, it is 50% lesser in weight. Conventionally, any MRI weigh around 4.7 ton. This is 2.3 ton. And 80% power consumption lesser than conventional MRI. And what's so significant about this is about, again, the software part. We have got an patented scan patent acceleration. So you, okay, 1.5 Tesla, but it can able to produce the image of what the 3 Tesla can give. This is again patented across Europe, Japan, US, and so on. So eventually what we want to do is to provide the complete holistic healthcare system. So right from the patient outpatient management, inpatient management, telehealth, and then the patient portal, for the continuum of care, then building the ecosystem around the HAMS. You have an HR solutions. We have got an CRM. We have got an scheduling app. So we have got an infrastructure management. In case you feel that I want to build something which is new to the institution, we have got a creator. It's a low-code platform where you can able to create and product which you intend to. And then we have got the complete medical devices. We already have in the market drip rate monitor, syringe infusion pump. We are building large volume pumps. We are coming out with the heart patch, again, which will get integrated with the ICU. We are coming out with the thalassemia pump for the first time in India. India do not have thalassemia pump. There's only one pump which is getting imported from Greece, which costs 45,000. Our thalassemia pump is going to be 16,000. Every year, 10,000 new patients is getting added to, thalassemia major. So we'll provide the entire medical devices, and then finally the Zappi Works, which is an implementation, customization organization within Zoho with implement the projects. So the complete ecosystem is what Zoho intend to build over the period of next 5 to 10 years. Okay, this is the architecture of how. So this is something what we want to build. Again, this is connected to the slide what I presented. So these are all some of the testimonials, global testimonials. I don't want to take much of time on this. How the Zoho, the healthcare organization. These are some of the reviews by the leading business magazines and technology research and consultancy firm about Zoho. You see consistently, last 5 years, Zoho CRM has been rated as one of the top rated CRM in India as well as in the global, apart from Zoho One. That's it from my side. Thank you so much.
May I request you to kindly be on stage, sir? Thank you so much for the wonderful, informative technical presentation. We would like to thank you by presenting you a small token of appreciation, for which may I please invite upon stage Mr. Vivekanand Mishra once again. There he is. And request him to kindly present a memento to Mr. G.N. Balakrishnan. Thank you so much, sir. Thank you. Moving on, ladies and gentlemen, we now are going to have our spotlight session on investment gateway and opportunities for startups in the digital health. This session is being moderated by Mr. Ashu Agarwal, India Lead and Global Founding Member, Asia Tech Journal. I request all of you to kindly welcome Mr. Ashu Agarwal up on the stage. Please welcome Mr. Ashu Agarwal, our moderator of the spotlight session. Joining him up on the stage, we have Ms. Sabhyata Verma, Senior Manager, Invest India, Mr. Binil Matthew, Manager, Startup India, and Ms. Nikita Kocher, Assistant Manager, Startup India. Please give them a huge round of applause, ladies and gentlemen. And now I hand over the floor to Mr. Ashu Agarwal.
These are sessions which are usually very difficult one to pull off, right, post-lunch. We'll try and keep it as exciting as we can. It's good to be here in an August company, right? At Asia Tech Journal, we continue to do a lot of sessions which are virtual in nature. I think it's good to be back. Healthcare is something which is, I think there's this renewed love, right, between, I think, everybody, especially after what we've experienced the last 2.5 years. Through the course of the session, we're going to talk more about policy, the role of the government. Invest India, Startup India have been playing a very, very active role in evangelizing and ensuring that the newer startups innovation which is happening in the country gets the right pace, momentum, and more importantly, the capital, to grow. And I think we're going to be talking about all of that in the process. But before I start, I'd love to start with Binil. If you could introduce yourself and tell us a little more about the vertical that you handle and the work that you do.
Yeah. Thank you, Ashu. And it's a privilege to be here at the second IHW Digital Health Summit and Awards. And as Ashu was saying, healthcare is a sector which all of us are working towards, and is a sector which in the country has had a lot of the government focus. It's a great honor to be here and be in this room where a lot of our stakeholders are there. My name is Vinil Matthew. I work with the Startup India Initiative. The Startup India Initiative is housed under Department for Promotion of Industry and Internal Trade under Ministry of Commerce and Industry. The Startup India Initiative was set up in 2016 to go ahead and facilitate the growth of the startup ecosystem in the country, working with private and government stakeholders in helping the ecosystem grow. I specifically work with different ministries in going ahead and streamlining the work of the ministries with innovation and also with country partners like UAE in going ahead and looking at our international collaborations. Thanks, Ashu.
Super. Sabita, if you could.
Hi, very good evening to all present. Thanks, Ashu, for the introduction. Just a quick thing about myself. My name is Sabita. I am from Invest India. I lead the healthcare and medical devices practice in Invest India. Just a very quick introduction about what we do, what the organization typically is doing. Most of you would be aware, but just a reiteration. So Invest India is the National Investment and Promotion Facilitation Agency for the Government of India. We are typically the first point of contact for any foreign investor who's looking at investing in India and sort of promoting India as the most favorable destination, getting the FDI in various sectors, sort of helping all of these investors starting from their initial journey, trying to understand what sort of business advisory research they would require till the end in terms of the aftercare services. Within the healthcare domain, we're very keen and excited with respect to the new investment opportunities that are opening up. Digital health being one of the most important ones, and the government initiatives that are being done almost on a regular basis. The kind of thing that we've seen with COVID-19 and the work that's been done. So that's something that we work very passionately with our different stakeholders from the private sector as well as public sector. So it's basically a public-private sector partnership that's also being done. So over to you, Ashu. Thank you.
Thanks, Abhita. Nikita.
Thanks, Ashu, for the introduction. Good evening, everyone. I'm Nikita from the Startup India Initiative as well. I think Binil has given us a fair introduction. I'd just like to say, I think the goal has definitely been to facilitate and drive the growth of startups across sectors, but health tech has taken a front seat in the past few years. I've been leading the healthcare initiative from Startup India for the past few years, and I look forward to see what this panel holds. Thanks.
Super. So I think clearly a very, very interesting company that all of us are in. Guys, I think, let's try and decode the opportunity that India is, right? I think, India is not one nation. It's many, many nations, right? It's a complex market. It's a heterogeneous market, right? The rate of savings, for example, is, very, very different, right? When you start looking at, this market, when you dissect this market, right? It's not a homogeneous market, right? A lot of other countries enjoy, a position which is slightly more predictable, right? Here, that's not really the case, right? Employment, again, continues to be a big challenge. Now, why do I say all of this and these macros become important is because this brings in inconsistency in delivery of healthcare, right? And delivery of healthcare is something which you have to solve at many levels, right? So I would love to understand, when you look at it, right, at a policy level, how do you break it down? What are some of these opportunities that are clearly very, very large, something that India needs, not just within, say, certain sectors, segments, states, but more at a macro level, so that the foundation gets so much more strengthened, right? For specializations to, kind of take off. Sabita, do you want to start with your view, because you're promoting it internationally as well? So I think I'd love to hear from you. And I think Binil and Nikita, I'll come to you to understand more on what states are doing on this front, right? Because, you need to sort of have a concerted effort. So Sabita, over to you.
Thanks, Ashu. Just to sort of help understand with respect to how we started our healthcare journey, the kind of complexity that exists in India, that is probably not the case with a lot of nations. We do have a lot of private participation that comes into play. We do have a lot of government schemes that come into play. But what really happens is there are a couple of gaps which we see on a daily basis, and how healthcare is being seen. We did see COVID-19 being the case right now, and how India is sort of fighting and coming up with all of these nitty-gritties that's there. At the public policy level, I think a lot of speakers here would have spoken about the national health policy that was started back in 2017, followed by the National Health Stack, the National Digital Health Mission. So all of these are basically sort of a founding stone that was started in the healthcare space to identify areas which our healthcare system could not sort of think of when we started back some 6 to 7 years back. So these these policies that are being driven by the government of India, that's there at the central level, the image that's being presented for India. So all of these are basically an enablers that are presented for various people to help understand the things that are being done. So with respect to a couple of areas in terms of interoperability, in terms of a macro number or macro scale that we see India in terms of performance, we see a lot of improvement that's been happening in terms of the way India's position, not just within our own country, but with respect to what the standing has been globally. And all of these initiatives are obviously driven by the kind of feedback, the kind of areas or the opportunities that we see on a daily basis, not just pertaining to digital healthcare, but a lot of other areas, other space also. We've been seeing areas in terms of e-pharmacy, in terms of telemedicine. All of these areas have been coming up very recently. And we realize that India is in need of this only because a pandemic made us realize all of this. So it's very imperative that the position of India at the level in terms of micro as well as macroeconomics, it's positioned in a way where all of these areas coming from in terms of feedback from both private as well as public sector, it is taken in a way that all of this is presented and strengthens the position of the country. So I think, as Ashu mentioned, that we do come from an area where nothing is homogeneous, but these policies, the feedback that's being taken at both public as well as private space is what is enabling and positioning the country to sort of move forward.
Yeah, thanks. And as Sabhyata mentioned, the kind of work that is happening on the policy level is also being extended in terms of how startups in the ecosystem are being supported. Like currently, when we see the number of startups who have gone ahead and registered with DPITs from the health tech sector, from the health sector largely, what we have seen is that during the pandemic years and in the last few months also, we have seen a consistent increase of the numbers almost doubling from pre-pandemic years. And the reason why these startups go ahead and do register and are coming up in the ecosystem is because there are three main pillars that they are getting support from. They're getting support from central government policies, which go ahead and make them a key stakeholder in development of the healthcare infrastructure of the country. A second primary support that they're also getting is from state agencies, where state governments are actively going ahead and working with startups and procuring from them, in going ahead and giving them procurement orders, in beefing up the infrastructure, in providing the support where necessary. What this does is functions on two fronts. It goes ahead and allows startups to get market access to the existing infrastructure of the state. And what it also does is it allows for innovation and R&D in the ecosystem, where, as the speaker from Zoho was talking beforehand, where Zoho is developing certain, say, products. What it does is that it gives startups the incentives to go ahead and look at what new products can be developed in the medical devices sector. What is a new service delivery mechanism that they can look at? How is it that they can innovate more on telemedicine, make it more regional in its approach, make sure that it is accessible in more languages, they get more people on board from across the country. And the third main pillar where the startups have been getting support from is in terms of, in India, as we have seen, that the kind of healthcare needs, as Ashu mentioned, are different across different states, and the kind of needs that are being addressed at even different district levels will be very different depending on the time of the year, depending on what the need at that particular point of time is. A lot of our startups are being given incentives in the form of going ahead and innovating for these by going ahead and also working with our international partners, with our private partners who are going ahead and actively scouting from our healthcare startups, who are going ahead and providing them innovation places to build innovations, and B, also working with our incubators, with our state agencies, and especially the state startup agencies, in providing them incubation space, in providing them acceleration programs where their devices can be taken up, their devices can be used across different paradigms. And one of these examples that I do remember, like always, is in terms of Blue Frog Technologies, where one of the challenges that during the COVID time we were facing was in terms of last mile accessibility of vaccine, especially because of cold storage of vaccines and how they need to be stored at a specific temperature. And Blue Frog Technologies worked with multiple states across the country in going ahead and being that device where it was kept. And I think that's one of the key things that the ecosystem is doing for startups, and at a macro level is being done from startups from the states.
Sure. So I think, as my colleagues mentioned, we've seen exceptional improvement in the healthcare space, more specifically in digital health tech over the years. We've seen it in telemedicine. We've seen it in wearable tech. We've seen it in various durables as well. I think this, of course, the macro kind of support that's been provided by the government is extremely pivotal here. We have the eSanjeevani OPD, which actually facilitated that during COVID as well. As my colleague mentioned, we've had various innovation challenges actually being run where the Scouted solutions are provided this platform, to grow in terms of R&D. And I think that comes in very specifically in terms of the health tech sector. In terms of startups, as my colleague mentioned, we've seen almost 146% increase just in the past 3 years. And that's not a small number at all. So the kind of support provided in terms of, market access, the kind of markets we're allowing them to kind of get to. We, in fact, most recently, at the Dubai Expo that was hosted for about 6 months, we had multiple delegations, that we had just in the health tech space, whereas other sectors were actually limited to 1 or 2. So, that is the kind of growth that we've seen also through, of course, all of the supporting, facilitating factors that we've heard of from my colleagues.
Thank you. Guys, I want to break this down a little, right? I mean, when we talk of health tech and healthcare in general, right? I think in the Indian context, we see a large number of companies essentially, solving for the services part of it, right? And there's nothing wrong with that. That's not what I mean, right? There's clearly a requirement for institutionalizing certain practices, right? And I think services, clearly is a faster moving sort of a play. What we've not necessarily seen is a focus or a lesser focus or a slightly weaker focus on the hardware side of it, right? Now, India, with its complexity, needs certain hardware that needs to be done for our market. I mean, there's some attempt which is happening, but it has to go through a variety of approvals. I mean, we essentially benchmark against ourselves against some of the best. Those are lapses that exist, right? I mean, in a market like India, we need low-cost solutions, right? Would love to understand from you what is happening on that front. Because this is a massive opportunity, right? I mean, a shift like this, we can possibly be leaders in this entire category, right? Even from an investment standpoint, right? I think a lot of hardware companies, global majors, would want to come in and be a part of some of this. I'd love to hear from you on what's happening on that front.
I think with respect to services within the healthcare sector, yes, that is true. We do have a lot of focus on the services sector. But with respect to hardware or typically products, if we actually categorize, medical devices is a very, very prevalent space where we're seeing a huge sort of rise. In fact, the Department of Pharmaceuticals and the Health Minister sort of touted that as the sunrise sector. So within the healthcare space, again, there are a couple of sub-segments that have been demarcated. And within the service sector, maybe there are a lot of investments that are coming up. However, within the products that are also coming up within the healthcare space, medical devices is probably one of the most interesting, as well as a sort of an area where we're seeing keen interest from the investors. There have been a lot of the PLI schemes that are coming up with respect to hardwares in the medical devices sector, again, pertaining to healthcare in general to sort of promote Make in India. So all of these schemes, all of these areas are sort of an increase in opportunities within the healthcare sector to sort of not restrict them to one particular area, but sort of understand and identify areas where India's healthcare space can grow, where we can invite more people, where there is actually a need, where most of the imports are happening currently. So that's where and that's how typically the Indian government or India is sort of making a decision at this point in time to, as we've also heard about being Atmanirbhar. So Atmanirbhar Bharat and the idea actually came from or seeded basically to identify areas where India is sort of competent to manufacture and at the end of the day export to such countries or stop the import. So that was the whole idea. So all of these initiatives are basically a diversion from the services sector and catering more towards a very specific product or hardware basket that we're looking at. This is also supporting a lot of foreign investors who are looking at Indian market growing in terms of the healthcare space for India. So in terms of opportunities, I think that's one area I would definitely sort of call out. The other areas in terms of, I think, again, coming back to digital health, we've also heard about the National Health Stack that was released. So that's basically the backbone that's being created to sort of set up the digital health infrastructure, the digital apps that are being created to sort of promote interoperability. So all of these spaces, when combined, is sort of opening up new avenues and areas within the healthcare sector that India had not seen before, or this sort of information was not told to the people of India. So that's where I think the opportunity lies. We've heard a lot about, I think, telemedicine, e-pharmacy that Nikita also spoke about, that we've seen as a jump in a couple of months just during the COVID time. But these are areas that will eventually take time to come up. But other spaces in terms of products, in terms of hardware, in terms of an infrastructure that is set. So all of these areas are an upcoming field in terms of opportunity within the healthcare sector that the Indian government is actively promoting right now.
And just adding on to what Sabhyata said and something that Nikita was also talking about earlier, right? Like how the sector is going is in terms of wearables. And when we are looking at startups and innovations, especially when we expect our startups and innovations to build something in hardware, there are requirements in terms of testing facilities. There are requirements in terms of capital. There are requirements in terms of R&D support and having expert go ahead and look at your work, right? So how is it that we are going ahead and helping and working with partners on these specifically? In India, if you see how the incubation support over the last few years have gone, you now have incubators who have been set up across all over the country, not only by private institutions and academics, but academic institutions, but also by state government agencies. You will see that most of our IITs will have incubation centers with them. Most of our states do go ahead and have specific incubation centers that they're building. And these incubation centers are being built with the vision of providing the R&D and testing facilities and the equipments which will allow our innovators to go ahead and innovate in this specific sector. And that's why when we're looking at healthcare and like specifically the devices that we are looking forward in healthcare, right? The two things that we are looking at is, of course, cost reduction in terms of the device, but also in terms of how the accuracy of the device is working. And the way that our innovators are working, specifically in going ahead and tackling some of the key challenges which we test for on a very regular basis. One of our national startup awardees, Narayan Healthcare, goes ahead and has created a device which detects breast cancer at an earlier stage and without that invasive a procedure. So why is it that these hardware companies are coming up, right? The hardware companies are coming up because of the fact that over the last 3-4 years, there's been a very specific focus on building up incubators across the country, because the R&D specifically for this is one of the key drivers. In addition to this, when I was talking to you about how capital becomes an extensive need for this, right? When you're building R&D in hardware, you also need to test it out. You need to have capital resources. Now, if your capex in terms of going ahead and having your capital cost in terms of your machinery is being provided by incubators, and you need another funding source which also goes ahead and supports you while you are building that. And that's where schemes like Startup India Seed Fund Scheme come into play, which specifically focuses on those innovators who are at the early stage of innovation, who are less than 2 years old, because it's at that stage of their life cycle in a startup that they're most likely to fail, because they're not able to either access funds or they're able to access resources. Now, funds like these, what they do is go ahead and provide the base for the startups to go ahead and further innovate. They use the funds, they work with incubators because the funds work through incubators, and then use the incubators testing facilities to develop this R&Ds. So while the uptake has been slow over the last few years, in the last year, 2 years, especially with the focus that COVID has put in terms of what we do need in terms of going ahead and having healthcare infrastructure when it comes to devices. A lot has been done, and we are only going to see a rise in terms of the startups who are specifically working on healthcare devices in the years coming forward.
Super. Well, I think an important point that you highlighted, right? And I think that automatically brings us to talking about capital, right? I think the government has been very, very proactive. There are a lot of announcements that have happened. There's been a fund-of-fund structure that they've created, right? Where they've been supporting a lot of funds which are, investing across sectors, right? Healthcare clearly being one, right? But I think more importantly, early stage funding and early stage support that you highlighted in the process through this network of, incubators and accelerators that have come up, right? Privately or by institutions, has been amazing, right? While of course you've talked about, what we get. I think I'd love to understand some of the schemes which are out there, which have been designed, right? Where and the amounts of funding which is available for founders, right? So I'll come to you and I'll have you to sort of add a comment on this.
Thanks, Ashu. Sure. So I'd like to actually start, this question with a little bit off of schemes. But, we've seen the rise of about 108 unicorns in India now, which are companies exceeding the 1 billion valuation. And that is a huge feat for a country like India, which was, trying to learn to innovate and kind of build more infrastructure and R&D capabilities over the years. I think what has facilitated a lot of the funding also, both global and domestic, is the collaboration of multiple industries and sectors. We see that health tech today is not simply hospitals, it's not simply clinics, it's not simply, creating a stethoscope. We see the amalgamation of sectors in artificial intelligence, robotics, virtual reality, actually coming together to make one big compound. And I think that's where a lot of the focus on, investment and funding in health tech also comes. I think needless to say that one of the largest driving factors of focus on health investment has also been, just change in how we as consumers look at health today. I think COVID has transformed that, psychologically for many of us. And I think in that sense, it has also created an opportunity for health tech companies to further innovate and build that infrastructure and bring in that investment from the right stakeholders. Coming more specifically to your question, I think the government has facilitated various avenues for funding for startups. I think I've reiterated this, again and again. We have the biotech ministry also looking at this. We have the health ministry. We have, the Department of Pharma focusing specifically on it. But I think that, building infrastructure for health tech testing, for health tech pilots is extremely important. But we also have companies that are at their early stages and are looking for that rapid growth. So the government specifically has the seed fund that Binil mentioned, which will typically maybe give you funding between 20 to 50 lakhs, depending on the evaluation metrics that you fall into. And, typically the reason to which, this is directed from DPI, I think the reason that this is driven through incubators is because they become the launch pad for these companies. They become the centrifugal force, so to say, to kind of help them build that model and take it to market. Incubators, accelerators, and that's where a lot of the evaluation, so I think giving that power of attorney to the stakeholder ecosystem enablers that are actually central to the process is actually what the seed fund is trying to do here. As you mentioned, we also have the fund of funds, which will typically look at startups that are also scaling, that are also at validation stages, later stages of their journey, and are looking to kind of expand further. And I think that has been that has been an extremely rigorous kind of process of evaluation for our startups as well. And a number of health tech startups have actually taken that funding. I think the third very important avenue I want to mention in terms of funding is the kind of innovation challenges or the kind of corporates that, actually are seeking innovative tech in terms of startups from India, solutions completely built and made in India to actually be supporting them in their future endeavors. I think the innovation challenges driven in collaboration with ministries across the government. One, of course, they provide, in terms of mentorship, in terms of incubation, acceleration, any kind of services that a health tech startup may need. But I think one comes to mind most recently. We had a collaboration with, with Sweden, wherein they were actually seeking specific solutions to deploy within their economy as well, and ended up actually shortlisting a number of 10 startups in India and providing them both non-fiscal and fiscal benefits. I think that also gives startups that impetus to kind of continually build their models and grow at a rapid scale. I'll leave it up to my colleagues.
Well, of course, I would want you to sort of make a comment on this, on some specific schemes, right? That say some of the founders, entrepreneurs who are sitting out there, aspirants maybe, right, can immediately sort of look at, right? But I think more importantly, what I want to talk about is, when you talk about the government infrastructure, right? When you talk about the kind of funding coming from, say, a variety of these initiative sources, right? It takes forever, right? And in an industry like healthcare, you need money like yesterday, right? Right. Unfortunately, our R&D spends are also much smaller vis-a-vis what developed nations would typically do, right? I mean, our appetite is pretty much larger. Would love to hear from you some of the specific schemes, and how, for example, the momentum in capital is changing. Is there a sensitivity around that? Would love to understand that.
Yeah. So the thing is, I think now when we're looking at policies, right, when we are devising policies which are specifically looking at funding, they come with time-bound manners. Like if you go to a website which talks about seed funds, what it specifically does is a seed fund which has an overlay of 950 crore rupees, and the intended impact is for over 3,600 startups through 300 incubators over the next 2.5 years. And at the launch of the scheme, which was in 2021, the overlay was for over 3 years. The way that now the schemes are being devised is in terms of there are specific milestones that pertain both to the startups, to the incubators, and with the scheme within itself. Because what are we trying to do? And as you were mentioning, Ashu, in terms of how and when is the money flowing into the startups, right? If we are going ahead and asking startups to apply to the scheme, they have a specific time period that they have to apply to. And the incubators also have a specific time period in which they have to respond to the startup and either tell them explicitly in terms of if there was something lapsing with their say application, or is there something more additional document that they're looking at, right? So if you're looking at the idea of in terms of when the money comes in, a lot of the focus has now shifted to also ensuring that startups get money in terms of seed fund, in terms of debt fund that they're getting through the seed fund scheme on an expedited basis, and the timelines are explicitly mentioned on the website, right? And this is where I also want to come in and as Nikita talked about innovation challenges, right? Also talk about how the innovation challenges that we do with our partners also play a key role in getting startups to go ahead and consistently engage with us. Process is one of our partners who we are working with in terms of a specific challenge which looks at accessibility. And that was one of the areas that we also noticed that there was not a lot that was being done to incentivize startups to work in accessibility. Because while we do talk about how the impact of many illnesses is chronic, and there are many ailments that you live with through your life, what is it that is being done in the ecosystem to support startups who are looking at these specific areas, to support startups who are working with this, right? This is where our innovation challenges come into play, where there are timeline specificities to it, where we go ahead and specifically work with these startups, where funds are given by our partners at a specific point of time. And more than that, what's also given to them is market access opportunities, where we work with different partners like Social Alpha to go ahead and give them a mentorship opportunity. When you have a process going ahead and being the corporate partner for these challenge, you have sessions with them where they go ahead and talk to you about your fund, your pitch deck building. This also helps you gain greater access to investors where your conversations get expedited.
Sure. So I think momentum still needs to be worked upon, right? Private parties need to possibly be incentivized to be bringing in more capital, right? I think the speed essentially has to solve. I understand where you're coming from, right? There's an ecosystem that is there, infrastructure is there. We've covered some part of it. We still need to sort of cover a little more, right? Especially for the size that we are. Savita, my last, almost like a second last question in this panel, right? I mean, we are amid a funding winter, right? There's a global slowdown, right? Everybody's kind of talking about it. We're saying where the currency is, right? Health.
So I think Various areas within the pharmaceutical space, within the bulk drug space, within the API space, could be in the area of medical devices, as I spoke about. So that's where the actual investment is needed. That's where the government's focus is right now. So with respect to, as you said, that there is there's sort of a slack that's there in terms of funding and how sort of startups are coming up with their funds with respect to the investments that are coming up at the central level and how the government's intervention is coming in play to sort of expedite the interest of these foreign investors is actually of utmost importance. It's also sort of the right time to identify the areas, the right stakeholders, right private partnership that would be required at the ministry level. So what really happens is there are a lot of stakeholder consultations that are done with the Ministry of Health and Family Welfare, with the Department of Pharma. And that's typically done with a couple of associations, with a couple of private partners to identify such areas and when and what would be the right time to get the funding. And I think the last 2 years have been the best learning experience for all of us to understand how to sort of expedite all of these things. What is the right time? When should the investments be coming? When should an investor be incentivized? What sort of subsidy should be given? So these kind of areas in terms of investment opportunities and when, as you rightly said, in terms of time is what the government is looking at in terms of these stakeholder consultations that keep on happening. But with respect to, I think, startups and how the funding sort of takes place, I think I'll let my colleagues from Startup India comment on it.
Sure, but very quickly, if you want to sort of add to.
Yeah, so it's quite interesting that you bring up the funding, right? Because health tech and healthcare has been the top 5 in terms of deals and the amount and being the most funded like sectors in India for the last 2-3 years, right? Even in this year's investment reports, if you see, it's among the top 5 sectors. And what this has done is that when we talk about a funding cycle is not immediate. A funding cycle takes a startup where they reach out to investors, pitches are done, where due diligence evaluations are done, and takes a few months up to a year and a half for it to efficiently close and for the money to flow in, right? And this is agnostic of whether it's a government fund, whether it's a private fund. With government funds or private funds, there are certain accelerated funds then that focus on that acceleration. Now, on this specific point, there are then 2 things that the government has done, right? How is it that we are mobilizing domestic capital? Due to the new regulatory reforms that have been brought in by the government last year, now EPFO, which earlier was not like allowed to invest in, say, for example, startups through AIFs. Now EPFO can go ahead and invest in startups through AIFs, right? Why is it that this has been done? This has been done to mobilize more capital from domestically in the country to ensure that there's more capital available to startups through AIFs, right? And when we look at our international partnerships is another key venture where the government is specifically looking at. India and UAE signed the SEPA agreement earlier this year. And as part of the SEPA agreement, we also went ahead and launched a bridge with UAE, right? And it's fortunate that you're asking that right now, because just yesterday with the Ministry of Economy in UAE, we have launched a program where 15 specific startups will go ahead and get the opportunity for market access in UAE. We'll be able to work with more leaders in the health tech space in India, because health tech is one of the key focus areas, even on the Ministry of Economy of UAE side. And that's the international bridge that we are building, that where we are going ahead and working with international partners, where our investors come from, right? When we look at the Dubai Expo, which was one of our biggest participations in terms of taking like our startups abroad, at the end of the Expo, we had a huge roundtable with investors, both sovereign wealth funds, and private equity investors from India who traveled to Dubai, with whom also we are launching programs. So there's a lot being done on the investment side, and I think like a lot of the partnerships will come from both private and public players.
Interesting. Guys, in interest of time, I was past a slip, right? I think we got to wrap this up very quickly. What are the next 2.5 years like? This is a mammoth task, right? We're not against anything small, right? And with the complexities that we have, right? And we tend to kind of, healthcare is a key priority sort of area. Nikita, I'm going to come to you first. What are the next 2.5 years like? As a professional, somebody who's working with Startup India, right? What are the kind of things that you were driving and focusing on? I'd love to hear from you. Each one.
Sure. Thanks, Ashu. So I think, of course, as we say, miles to go, definitely. I think we've come a long way in the past couple of years in terms of health tech. I do see, I mentioned this earlier as well, I do see much greater collaboration, cross-sector collaboration in the health tech space. I think even at Startup India, we strive to consistently work across the government, across multiple ministries, because I think no one sector kind of operates independently at this stage. There is constantly cross-functional utility. I think, secondly, it's also important for us. We see the next, actually, we have about 15, international bridges that we're currently facilitating, where we're actually helping our health tech startups get to the forefront. And, Japan is one big partner of ours in that endeavor. We see the next couple of years actually building that model with more and more countries as we go on.
Sure. I think what typically I'm doing and what I see with respect to the work that's being done in the healthcare space, what Invest India is also doing is we work very closely with the Ministry of Health and Family Welfare, Department of Pharmaceuticals, and right now the ministry's one of the major projects that they've undertaken is the Heal in India initiative, which is to promote the medical tourism. So these are couple of areas in the healthcare space that is Invest India's interest in sort of taking it forward and positioning India as one of the most favorable destinations in the world for healthcare. So that has been and will be one of the most key initiative under the healthcare space that Invest India is very keenly facilitating with the Ministry of Health. With respect to digital health, we're also working very closely on building a portal with respect to the Heal in India initiative. So I see my next 1 to 2 years with respect to Invest India, and what the government's focus would be is typically in the areas to identify how to sort of increase the access within the healthcare space, how to sort of digitize the activities that are going on. Along with that, how to sort of promote and make a conducive environment for all the investors in India.
Super. Thank you. Well, very quick comment.
Yeah, just 3 things. First, in terms of, I think like what's going to be the focus is right now we have startups specifically in the healthcare space from over 380 districts over the next few years, especially the next 2-3 years. We hope that it spreads across all districts of India, and we have at least one startup focused on healthcare from all districts. Second, building with our international partners. And thirdly, and most importantly, also going ahead and ensure that the kind of investment schemes that are coming into the country and the startups that we are matchmaking for them, we are able to build long-term impact.
Super. Thank you so much, guys. It was an absolutely smashing panel. I think policy is something which is not necessarily understood at a distance, right? I think it becomes important that, forums like these continue to, invite many, many bright stars like yourself, right? Who are working on, creating a system and an ecosystem which is relevant, which helps get to the last leg, right? And the impact is something which is visible, right? In a market which is as big as India's, you can get lost in the process, and that's a massive challenge, right? What you have at hand is not easy. We cannot even fathom the complexity. I'm sure a lot of professionals who are sitting here can understand some of these complexities because they're dealing with it day in, day out. But I think for one to bring in, the policy and the execution together in harmony with so many moving variables, I think is difficult, right? So kudos to all of you. Thank you so much. It was spectacular having you. Over to you.
And we would like to thank all our esteemed speakers also for taking out your precious time and deliberating on the topic. We would like to present a small token of appreciation to all of you, for which may I please invite once again upon stage Mr. Vivekanand Mishra to kindly present the mementos to our esteemed speakers upon the stage. We'd firstly like to present the memento to Mr. Ashu Agarwal, Ms. Nikita Kocher, Ms. Sabhyata Verma, and last but definitely not the least, Mr. Vinil Matthew. Can we have a group photograph, please? Thank you so much. With that, ladies and gentlemen, we have now proceeded towards our last session of the day, which will be followed by the pitches from the startups. Our very last session is the investor's perspective on raising capital, which is being moderated by Mr. Bharat Radhakrishnan, founder and managing partner, Arohan Healthcare Services. This interactive session of ours will have the prospective investors giving insight on the due diligence required in raising the capital process and other key aspects for startups and new businesses, which they must know to make the entire process easy for the investors. For this very last session, I would like to invite up on stage Mr. Bharat Radhakrishnan, our moderator for the session. Joining him up on the stage, we have Dr. Pinak Srikhande, Director, Health Court Capital Advisors Private Limited. Mr. Abhishek Mishra, founder, SuperConnect, who would be joining us virtually. Next, we have Mr. Ankit Gupta, Senior Director, Optum Startup Studio, Optum Global Solutions, India. Dr. Suchin Bajaj, Founder, Director, Ujala Cygnus Hospitals. And Mr. Raghvendra Prasad, Founder, Project Step One, Co-Founder, Kickwell, and Angel Investor, who would also be joining us virtually. And now I hand over the floor to our moderator, Mr. Bharat Radhakrishnan.
Thank you. Okay, good evening, everybody. On to the last session for the day. So we just heard about the government policy and all the things the government of India is doing to facilitate an ecosystem. And here now we move on to a very important topic, which is the investor's perspective on raising capital, or let's say the private sector part of everything. So I'm not going to reintroduce the panel since that's been done. But very quickly, I think just to understand the breadth of what we have here, we have two of our panelists are joining us virtually. Mr. Abhishek Mishra. He's the founder of SuperConnect, which is a network angel fund backed by some of the biggest corporates in India. And also Mr. Raghvendra Prasad, who's the founder of Project Step One and co-founder of Quickwell and an angel investor. On the podium with me, I have to my extreme, my right to your left, Dr. Pinak Srikhande, who is the director of Health Quad. Health Quad is a healthcare-focused venture capital fund which aims to invest in early-stage healthcare companies. Next to him is Mr. Ankit Gupta, Senior Engagement Director with Optum. Optum delivers care aided by technology and data, empowering people, partners, and providers with guidance and tools. And right next to me is Dr. Suchin Bajaj, Founder Director of Ujala Cygnus Hospitals, an experienced founder with a history of working in the health, fitness, and wellness industry. So what we have over here is a mix of founders, investors, people who have exited, and I think a very esteemed panel who will be able to take us through this conversation. What we intend to do is talk about investment policy and philosophy, and then get into some of the challenges and opportunities that are currently facing both the investors as well as the startups. So I'll start off with a few questions and then we'll probably have a round for the audience and then a quick wrap up. So starting off with Dr. Pinak. So Dr. Pinak, as a healthcare-focused VC fund, what are the key success factors that you would look at while evaluating a proposal?
So, so we are a health tech focused fund. We invest in companies which have demonstrated their product market fit, have been able to generate a certain amount of revenue. Our threshold is about $1 million of ARR, and obviously the market size for the service or the product needs to be large, whether it's large in India or whether it has a play outside India in low and middle income countries which have similar healthcare challenges, or even in the developed market where the focus is on cost reduction, optimization of resources. If that is a market that the company can explore, then obviously it is a more holistic market to look at. But I think the two key factors that we would definitely like to look at is one is the large market opportunity. If it is there, then obviously it's exciting for us. And secondly, is the understanding of healthcare and its nuances of the founding team. That is very, very critical for us. We assess it from various angles to appreciate their understanding, knowledge. Have they understood the nuances of healthcare? Which stakeholders are they targeting? And if so, there are two very key stakeholders in the entire ecosystem. One is the patient and the second is the doctor. And one cannot, if you are investing in a healthcare, or if you're a promoter of a healthcare startup, these two stakeholders can never be ignored. So this is something which is very, very critical for us to understand whether the promoter has the understanding of this or not.
Thank you, Dr. Pinak. So basically the market size potential and the founding team. Now I'd like to move to Mr. Abhishek Mishra. Your model is a little different. It's still an angel fund, but clearly a corporate focus. So we'd love to hear from you. How is this similar or different from the way usual funds work? How would you look at things differently? And what would be the possible advantages? Because you have this very strong, let me say, corporate focus or the backing from the corporates. Over to you, sir.
Namaskar. So when we're talking, see, at this point of time, if you look at the overall investment sector, the type of different avenues which are available in XYZ sector, we are more focused on building partnerships, startups with large corporates. You have an exciting example available in the room right now, where we have not been involved, but that's a very good example. Look at Care Expert. It is an excellent partnership of a young entrepreneur with a large enterprise like Reliance, wherein they get the overall plethora of infrastructural services, experience, marketing, everything. So this is what we do with the large corporates. In terms of, so we are not an angel fund as such. We are more focused on building larger brands with corporates, where there is an intelligent startup founder who comes in place and we co-build a very large startup. We are more focused on building sustainable entities. We are not focused on just exiting the company. We are there to stay, which is the focus of every large corporate. So there is a difference between PE funds and how a large corporate will look at a startup, I would say. Over to you, Bharat.
Very interesting. So what you're saying is going beyond just the funding, actually the entire ecosystem that comes with it.
Absolutely.
Next, I'll move to Mr. Ankit Gupta. And this is purely from a health tech point of view. Again, a similar question like I asked Dr. Pinak, but since you come from Optum and from that health tech background, what are the parameters or the basis that you would look at if you had to evaluate? Because now you're getting into a startup studio and so what would be your focus? How would you evaluate any proposal that comes your way?
Thank you for that. So I think a lot of what Dr. Pinak mentioned would apply to us also, right? You have to have a big market for the product that's out there. The profile of the founder, do they have a good understanding of the solution and whether it even addresses an unmet demand? And I think that's fairly generic in terms of how you would typically look at any investment. But specifically from a health tech perspective, some of the additional things that we definitely want to look at is whether the specific proposal has taken an integrated solutions approach. And what I mean by that is, we routinely see a lot of companies and proposals that have taken a very point solution. So for example, if it's a clinical decision support system, it might focus on a single body part or on a single disease area. And they might have a great solution to solve just one problem. But if you look at it from a user perspective, a user cannot be expected to download a different app or a different platform for every single disease or every single body part. So it becomes very essential to understand that the founders have taken a whole person systems approach or a platform approach, if you will, to develop that end-to-end solution. Or even if that solution doesn't exist right now, at least there has to be a vision to get there in the future. So I think that's definitely something that we want to look at. The second element I think that we definitely look at is the regulatory framework. Given that we are a US company, a lot of what we do through our startup accelerator program is to enable India's health tech companies achieve global standards and global scale, right? So a lot of companies that are coming into our program or that apply to a program might have regulatory approvals in India, but we definitely look at whether they have global ambitions. And if so, are they already thinking about the relevant regulatory frameworks and approvals for the foreign markets? Do they know about the FDA approval process? What kind of FDA standards would apply to them? Have they started those conversations at least? The third thing, definitely health data standards. And I think since morning, there's been a lot of talk about ABDM and the National Health Registry and data standards. But I think there are two things to this, right? So a lot of companies actually directly adopt international global standards when it comes to health data. And I think that's a good thing because healthcare is fairly universal. But at the same time, if you want to operate in the Indian market, you have to adapt to Indian standards. But is there a vision to also look at HL7, FHIR, health data standards, HIPAA? Because without those, some of the foreign markets would be a complete no-go. And your solution has to be adaptable to adapt to those changes. And the one thing that I'd like to add is tech stack maturity. Because healthcare has such sensitive data requirements, some clients prefer an on-prem deployment, some prefer a cloud deployment, and some are relatively flexible. So is your solution adaptable, be able to cater to these different client needs? So those are some of the key things that we look at when we evaluate any proposal.
Thank you. So I suppose most of this would be applicable for all kind of health tech funding, right?
Yes,
it
yes.
Apply to all such cases. Great. Moving on to Dr. Bajaj. So you have been on both sides, founder as well as an investor. So really, it'll be very interesting to hear from you. What exactly is that sweet spot? That meeting point for both sides, whether it's that moment or the magic or the metric, I don't know what. But when it comes together and you say, okay, now it's a go.
So I think, I've been investing in a lot of companies, started out with health tech and now have completely become agnostic because I've realized that a lot depends on the founders and their adaptability to change. The world is changing very quickly, more so the technology world. Every day we hear new things and new prospects coming out. And I think if the founders are adaptable enough, if they can pivot from thing to thing, I think that works very well. So I just mostly look at the capabilities and the attitudes and the emotional intelligence of founders now, rather than what they've done with the product itself, because I truly feel that that can change very quickly as you go along the journey. So as a founder myself, I've seen myself also changing a lot. I've gone through, I think, multiple levels of learning and change through my journey when I started out from a small 10 by 10 clinic. And the willingness to change with times is sometimes the most important factor for your survival in the industry.
Very good. Nice. I mean, it's really interesting. The point of the founders coming up again and again, and you used the word of emotional intelligence rather than anything else, adaptability to change and emotional intelligence. Really interesting. Okay, so now moving on to a different track, I'm going to pull in Raghavendra Prasad here. I think most of them have spoken about investment philosophy. One specific point which we had in mind, and I thought I'll check with you on that, is how do you look at innovation as a key factor for an investor? How important is that in the overall scheme of things when you are looking at funding an entrepreneur?
Sure. First of all, Bharat, thanks for having me, and thanks to IHW Council for having me. Though this time I was actually planning to be there, but due to be there physically, but due to some other commitments, I had to stay back. Would have loved to be in person there. So, Bharat, the healthcare is very different because health systems are very different in each country. So, unlike other sectors, like for example, food delivery or e-commerce, it's fairly similar in terms of organization. Regulations are, very similar. But health systems greatly differ from country to country. So, you can't actually copy a model that's working, for example, in the West or the US or somewhere in Europe and apply that to India. So you need to be very true to the Indian problem and come up with an Indian solution. So from that standpoint, innovation is extremely important in healthcare compared to any other sector. So it is a crucial, extremely crucial factor, and you need to, go back to first principles to see, if the solution that the entrepreneur is employing for the problem actually ends up solving the problem as well as scaling. So innovation is extremely important. And one of the things I usually tell entrepreneurs is, the value that they are bringing is typically not the absolute value that their solution delivers, but it's delta of the next best alternative that the customer has. So if the delta between what the entrepreneur is bringing and the next best alternative for the customer, be it the consumer or the patient or a healthcare service provider, if the delta is too little, then the solution does not find market acceptance, or it doesn't find scale. The delta should be extremely large. There should be a significant differentiation compared to an existing solution or an alternate solution to the problem, to what's being proposed by the entrepreneur. So this makes innovation extremely, extremely important. And typically, in Indian markets, you have to apply first principles thinking to be able to figure out whether this innovation works or not.
Right. Thanks, Raghavendra. You mentioned something, and I'm going to take this up with Dr. Pinack since he has started his career as a practicing clinician. So one of the things I think found startups in healthcare especially are accused of is that we sometimes copy models. We copy models from the US, from the UK. We try and apply it here without taking into factor the facts of our market, our doctors, our working conditions. How would you advise startups? How not to fall into that trap? Keep it real.
So this is a common problem that you see with companies trying to emulate models which have succeeded in the US. And it's not wrong that some of the consumer-focused models which have succeeded in the US do have had similar successes in India. But healthcare is slightly different. There are three major components to healthcare here, which are completely different in different geographies. The first is the provider. So how do healthcare systems in India work against how do healthcare systems outside India? And when I'm saying outside India, there is a difference in how healthcare systems in Germany work versus how NHS works, against what the US works. So there is and of course how we work, where we have a public and a private system, and to a large extent the public system is by the government. On the other hand, the private system is all either out of pocket or insurance driven market. So the second aspect of of the ecosystem which comes into play is the payer ecosystem. And one needs to have a very, very clear understanding of how payer ecosystems in India work versus what happens in the US or in other developed markets, where what the, say in the US market, the payer ecosystem is moving towards outcome-based payments. That means what they are looking at is, if you are able to improve outcome and the overall cost of care goes down, then I am ready to I'm ready to pay for that incremental service or a product that will be used. Unfortunately, in India, all of us are aware of the level of health insurance penetration, and more importantly, even if you are insured, health insurance does not cover for experimental therapies, or it does not have an outcome-based approach. It is a very, very vanilla product in India that health insurance companies offer, and hence, and 60% or more than 60% of healthcare financial needs are actually paid by the patient out of pocket. So all of this means that an incremental innovation, whether it's a service or a product, needs to be paid for by somebody. Unfortunately, as the last speaker said, if the second best option is very least expensive and is still it gets the job done, then do you require this incremental research to be funded for? And lastly, one has to be very, very clear that Indian patient is a very discerning patient. I mean, as Indians, we are very, very value conscious. So anything that increases the cost of the service or a product, people will first be skeptical unless they are proven by significant amount of evidence that this actually works. And last but not the least, the most important cog in the wheel, the doctor. The doctors, and I having practiced medicine for 20 years, I can also blame myself to be in that situation, that doctors are technologically challenged. And more importantly, unfortunately, the medical profession as such is very, very, practices medicine based on very strict guidelines. Doctors are not taught to think out of the box because, it's a protocolized care or care pathways that one needs to adhere to, lest if you are outside that pathway, then and if something goes wrong, then there can be a litigation against you. So we are very careful to follow a certain kind of protocol pathway, and that could be one of the limitations to what new innovations can actually, if it is breaking that pathway, doctors are skeptical in utilizing that innovation.
Right. So just picking on that, given this, like to bounce this to Ankit, which do you think are some of the areas within the healthcare space that technologists and budding entrepreneurs should actually focus on and should be looking to solve? Something which is actually, you think, a problem here.
So I think regardless of whether it's here or global, I think healthcare is universal. The problems are very universal. And I would say for any entrepreneur that is looking to solve or create a solution, focus on the triple iron aim of healthcare, which is access, quality, and affordability, right? So when you think about access, access is essentially how do you enable access for the patients? So can you create a solution that is very patient-centric, which keeps the patient at the center of everything that you're doing, which is able to preempt patient needs either through data analytics, clinical alerts, which enables the doctors to provide the right care at the right time to the patient, and so that the patient actually feels that they're cared for and they're part of the patient journey. So that is one aspect. When it comes to quality, I think equally, and like Dr. Pinack said, right, the last cog in the wheel, I think one of the most important ones, which is the doctor. How do you then enable the doctors to focus on what matters most? I think increasingly as healthcare is being digitized and, as there are a lot more administrative processes that are coming into play, increasingly doctors are being forced to shift time away from clinical to administrative tasks. So is there a way that technology can enable doctors to focus more time on providing care, again, through clinical alerts, through clinical decision support systems that are powered by AI, which give them the next best action, which really help them focus on providing care to the patients and not so much on clinical tasks. And lastly, cost of care, again, affordability, which is again, automation, pure play automation that removes bottlenecks from a clinical standpoint, administrative standpoint, that provides last mile connectivity to patients in the remote areas. I think there's significant demand, even if companies can focus on any of these individual levers, but the benefit or boon of technology is that you can create solutions that actually tackle all three problems at the same time. So if entrepreneurs focus on these three and can checkbox that, the solution actually addresses each of these in a meaningful way, I think there's a lot of need and success for such a company.
No, makes sense. Thanks, Ankit. In fact, two of the points which you touched on, I'm going to bounce it to two of our other panelists. So, you mentioned about how technology is, in fact, that's one of the things that's come out from the data also that, and I'm going to bounce this to Raghavendra, is that the tech-enabled healthcare is still focusing on, the data, the operations, the access, which is important, no doubt about it. But can startups bridge up the gap of actually using tech-enabled treatments and diagnostics? Is there a play and opportunity there for entrepreneurs that they should be focusing on? This is a question for you. What do you think?
Absolutely. Yeah, absolutely. Actually, this is one area where I would say the next wave of innovation is going to come. India, unfortunately, is a little behind in terms of regulation on allowing, automated decision support systems for healthcare, whereas the US and other Western countries have already allowed it. As well as, there are several use cases within healthcare where computers are essentially doing the treatment of people. Of course, there is a regulatory process and an approval process for the same, but the laws in these countries allow for that, whereas in India we are not yet allowing that. A lot of innovation is actually happening in that area. In fact, I've been lucky to have a few investments in the US in startups which are actually moving the needle on that front. In fact, and also I think Vinod Khosla has an entire fund dedicated to using AI and computers for providing treatment. We actually are also seeing a few startups doing this in India, though in not so much in terms of the computer or the system itself being able to take the decisions, but making it possible for a lot of tasks which are currently done by the doctor to be done by machines or by people who are not doctors. In fact, a large part of the COVID effort for Project Step 1 was in deploying systems which would help in patients in self-triaging or provide support for providing decision support systems which would evaluate what patients, what kind of care each patient wants, and so the basic triaging was actually being done by computers. So I see this as a huge opportunity. In fact, I think the dream of universal healthcare will only be met if we are able to deploy machines for common healthcare use cases, rather than depending on humans or doctors to be able to actually be involved in that problem. I see few successes already in the West. For that, I think Zipnosis is a company which has actually taken the load off primary healthcare in the US. They've done a fantastic job in providing coverage-free care for primary healthcare scenarios. What would typically cost hundreds of dollars to walk into an urgent care or emergency care, can be done for a few $10 online. It's fantastic how technology can not just reduce costs but also reduce the burden on the healthcare systems. UK, I think, has done a lot in in that area. I think the NHS has also been pretty, though NHS has always often been accused of being slow, this is an area where they have actually done a lot. So I see this as the next wave of opportunity. I think AI has the highest potential in healthcare. It's one of the areas where we have not seen enough of application, and I'm very bullish on startups picking up specific use cases and trying to solve them. But to your question, I think diagnostics is an area where I see a lot of technology already being applied. So that's an area which I would say is well covered already by startups, which are furthering the frontier on both what type of diagnostics and can be done, as well as using a lot of technology to be able to interpret those diagnostics. We are seeing that seeing new innovations in that actually getting launched in the marketplace pretty much on a regular basis these days. That's an area where I would say doctors are finding very hard to keep up because the pace of innovation is so rapid that I see that there needs to be a startup to be able to help doctors to keep up with this change of innovation. So it's a very exciting time, and I see the next decade to be very defining in making this shift here, Bharat.
Thanks, Raghavendra. So, like you said, a lot of potential, but probably needs some regulatory and framework support as well. The third point, which Ankit, you had mentioned, was about reaching out. And here I'd like to go to Dr. Bajaj, because he actually has experience of having worked a lot of focus on, I think, Tier 2 and Tier 3 cities. So again, what is your advice or the learning that you've had to entrepreneurs, especially in tech? What should they be looking at to bridge that urban, semi-urban, rural divide?
I'd like to have a slightly divergent view on the popular sentiment of doctors not being technologically aware and being technologically challenged, as everyone likes to call us. Unfortunately, what has happened is when we come to doctors and technology, we've equated technological awareness with using a laptop instead of pen and paper or a tablet, which other industries have successfully been able to do. So they've stopped using those ledger registers and gone on to using Excel sheets, and stopped using those slides and started using PowerPoint and ad nauseum. So everyone says that, oh, doctors must also do that, right? You should use your laptop or tablet to write a prescription. Why don't you do it? It's what Rag said earlier, right? The delta is too little. The technologists have not been able to offer doctors enough delta to shift. But doctors have been historically using technology much more advanced than other industries. What do you think CT scans and MRIs are? Aren't they pieces of technology? We've been using X-rays forever. Since when the accounts and the marketing people had those pen and paper and pencils in their hand, we've been using technology a lot. A stethoscope is a piece of technology that we use every day, right? So if you can force us to wear a stethoscope each and every day, this ugly piece of tube on our necks everywhere, you can, I'm sure, give us something that we would love to use every day, right? So it is up to the technologists to give us the equipment and the technology that doctors would love to use. Otherwise, with this little delta that, you say that, okay, we can analyze your prescriptions much better, we can analyze your disease process much better, we can give you clinical decision support systems. The younger doctors would love to have that. But we must understand that medicine is as much of an art as it is science. The diagnosis I make may not be that accurate if it were to be made by a machine, unless and until, of course, you have supercomputers working, which we've seen. solving exercise instead of making a solution and then expecting doctors to use them and then cribbing out, oh, they don't never use it. We've given them such a beautiful system. And this I've seen in each and every solution that is given. Whenever we buy a solution, our IT person would be like, oh, this is brilliant. This is fantastic. The finance people would be like, oh, this is so good. And then we give it to the doctors and the nurses, and they're like, horrible. What have you given us? We cannot work on it. So this divide needs to be bridged by the entrepreneurs who want to work. As Dr. Pinaki said, the doctor is the most crucial cog in the wheel. If you ignore him from the start and expect at the end that he should use it, he will never do that.
No, fair enough. So I think you took that point to its conclusion. Just a brief comment from you on the urban-rural part. What do you think the entrepreneur should focus there?
So again, I think we are too smug in our thinking that there is a digital literacy divide in the rural areas. Again, if you give them good technology, they will adapt to it quicker than you can imagine. Just go back to the early days of Uber. When Uber came in, they had this device that you needed to master. You had to financially master it. You had to master the maps, the technology to put it on. But the money was so good that people would travel from all over, the villages and everything, would land in Delhi and Bombay and get onto that Uber device in a day and would be driving the car the next day. How do you think they learned that? Because the incentives were so high. So you just need to incentivize them. I think technology is now very, very evolved. A 3 or 2-year-old child can operate it. So it is smug for us to say that the rural people cannot. They can very well if you give them enough delta.
Fair enough. Fair enough. Moving over to Mr. Abhishek Mishra, just to kind of wrap off this conversation. So there's been a proliferation of startups. I think 7,500 and counting health tech startups and more coming up. So that looks very promising. But in your view, what do you think are some of the challenges that the investors and the startups are likely to face in the recent future, let's say the recent future in India?
भारत, इंडिया बहुत तेजी से आगे बढ़ रहा है. In the coming 10 years, you will see massive investments in the health sector across the globe, not only in India. Why? We have a reason. हमने कोविड देखा, हमको बेसिक मालूम है कि हमारी इम्यूनिटी कमजोर है. आप 70% लोगों को उठा लो, उनका विटामिन डी आपको पुअर मिलेगा, कैल्शियम वीक है. न्यूट्रिशन वैल्यू में आप कहीं भी चले जाओ, प्रोटीन वैल्यू बहुत लो है. हमको वही बेसिक 2 फूड खाने की आदत है, व्हीट, राइस. क्यों? बिकॉज दैट हैज बीन हैपनिंग सिंस इटर्निटी. उसके अलावा आप देश में देखिए, आप कह रहे हैं 7,500 स्टार्टअप हैं जो हेल्थ सेक्टर में. इस देश में 140 करोड़ लोग रहते हैं, जिनके बीच में हमारे पास कुछ 70,000 हॉस्पिटल है. इस 70,000 हॉस्पिटल में अप्रोक्सीमेटली 60% प्राइवेट हॉस्पिटल है, कुछ 25,000 सरकारी हॉस्पिटल. लेकिन आउट ऑफ द 60,000 एज वेल, अगर आप देखने जाएंगे तो 5,000 हॉस्पिटल से ज्यादा नहीं मिलेंगे जो बहुत अच्छे होंगे. आज हमारे यहाँ डॉक्टर त्रियान के यहाँ से भी बैठे हुए हैं. तो जो फैसिलिटीज हैं, सबसे बेसिक क्या है, प्रॉब्लम समझने की जरूरत है कि इंडिया एक देश है जहां पे हम इंफॉर्मेशन ही सही नहीं दे पाते हैं. सबसे बेसिक प्रॉब्लम है. आज जो कैंसर का ट्रीटमेंट कराने जा रहा है उसको रेडियोथेरेपी होता है, लेकिन उनमें से कितने लोग को ये अवेयरनेस है कि उनको पेरिकार्डिटिस हो सकता है. और लेकिन अगर आपको वो समय से बता दिया जाए तो वो आप उसको कंट्रोल कर सकते हो टू एन एक्सटेंट. सिमिलरली, सो इंफॉर्मेशन इज वेरी पुअर. ये जो मैक्सिमम स्टार्टअप्स जो हमारे पास आते हैं, जो सबसे बड़ा गैप हम देखते हैं, दे कम इन अ ड्रीमिंग स्पेस टाइप. सो उस गैप को सबसे पहले खत्म करने की जरूरत है कि इंफॉर्मेशन है. आज की एक नॉर्मल बात मैं आपसे करता हूँ. आई एम सीइंग अ लॉट ऑफ पीपल हियर, दोस हु आर टॉकिंग, दे हैव गॉट इमेंस नॉलेज. यहाँ नीति आयोग से भी लोग हैं, इन्वेस्ट इंडिया से भी लोग हैं, स्टार्टअप इंडिया से भी हैं, बजाज साहब हैं, हॉस्पिटल चलाते हैं, वेदांता से भी हैं लोग, एस्ट्राजेनिका से लोग हैं, डॉक्टर रेड्डी से लोग हैं. लेकिन एक्चुअली आज का ये पूरा का पूरा जो ये लाइव चल रहा है, आप इसको अगर ये सोचेंगे ये आम आदमी के लिए नहीं है, ये कंटेंट ही मिसिंग है इसके अंदर से। व्हाई? बिकॉज कोई भी ये बातचीत नहीं कर रहा है जो नॉर्मल लोगों को समझ में आए, उसके बारे में कोई बातचीत नहीं करता है। कोई समझाना नहीं चाहता कि कैंसर से बचा जा सकता है, या उसको एक एक्सटेंट तक आप उससे यू कैन कीप बेटर। तो इंफॉर्मेशन इज द मोस्ट पावरफुल थिंग, कंटेंट इज द मोस्ट पावरफुल थिंग। आज इतने सारे स्टार्टअप है, अपनी इंफॉर्मेशन नहीं लेके जा पाते लोगों के पास। जियो क्यों पॉपुलर है? क्योंकि वो लास्ट माइल रीच आउट करता है। क्यों टाटा पॉपुलर है? क्योंकि वो लास्ट माइल रीच आउट है। आपको डाबर च्यवनप्राश ये गांव में भी मिल जाएगा, लेकिन जो बेसिक प्रॉब्लम है क्यों, उसकी इंफॉर्मेशन मल्टीलिंगुअल होना बहुत जरूरी है। इस देश में जब लोगों को समझ में आएगा ही नहीं तो वो सीख नहीं पाएगा। मेंटल हेल्थ की लोग बात करते हैं, मेंटल हेल्थ कैन बी सॉर्टेड आउट ओनली बाय टॉकिंग। लोगों को कुछ नहीं चाहिए अगर आप उनसे, आई फील दैट देयर शुड बी एन एनोनिमस प्लेटफॉर्म वेयर पीपल कैन जस्ट गो एंड टॉक। कोई किसी को देख ही नहीं सकता, उससे बड़ा मेंटल हेल्थ का प्लेटफॉर्म नहीं बिल्ड हो सकता, क्योंकि जब तक आप अपनी बात ही नहीं रख पाएंगे ना किसी के सामने, आप आगे नहीं बढ़ सकते। सेम इज द केस। तो ये बहुत इंपॉर्टेंट है इंफॉर्मेशन की को सही तरीके से पास ऑन करना। स्टार्टअप फाउंडर्स आते अपने आप को एक्सप्लेन नहीं कर पाते, बिल्कुल नहीं कर पाते। दूसरा, उनके अंदर सस्टेनेबिलिटी नहीं है। आप प्रोडक्ट बना रहे हैं, देखिए एक पर्सपेक्टिव है अलग अलग, इन्वेस्टर का पर्सपेक्टिव अलग है। आज पी फंड आ रहा है, उसका पर्सपेक्टिव है कि मुझे इसको स्केल अप करना है और उसके बाद मेरे को इसमें से एग्जिट करना है। लेकिन कितने लोग हैं जो एक्चुअली इन स्टार्टअप्स को इंडस्ट्री बना रहे हैं? कितने सारे स्टार्टअप हैं जो एक्चुअली प्रॉफिटेबल हैं? क्या कोई स्टार्टअप है जो ऊपर के 1000 में लिस्टेड है? देयर इज नोबडी। व्हाई? आप पहुंच ही नहीं पा रहे हैं वहां तक, क्योंकि आपका फोकस केवल रेवेन्यू पे है कि मैं अपना रेवेन्यू कैसे बढ़ा सकता हूं। हमारे पास एग्जांपल है, आप एडटेक की बात कर रहे हैं, आप जितनी भी टेक्नोलॉजीज की आज की तारीख में बात करेंगे उसमें हम पूरा दुनिया देख रही है कि जब हम पैसा पंप कर रहे हैं तब तो मेरी कंपनी ग्रो कर रही है, मेरे इन्वेस्टर ने एग्जिट कर लिया, लेकिन वो कंपनी कहाँ जा रही है? आज बायजूस परेशान है, आज ओला परेशान है। एक एक्सटेंट है जब तक आपके पास पैसा आ सकता है, लेकिन सस्टेनेबिलिटी है अगर आपके पास, तो आप एक अपने आप को एक इंडस्ट्री में कन्वर्ट कर सकते हैं। तो ये बेसिक, देयर मे बी अ डिफरेंस ऑफ थॉट प्रोसेस, हाउ वी ऑपरेट। लेकिन आज अगर हम हेल्थ की बात करते हैं तो हमारा बेसिक, मैंने इन्वेस्ट इंडिया में बात करी, मैंने उनसे बोला कि सबसे मैसिव जो प्रॉब्लम मिसिंग है वो प्रॉब्लम है देयर इज, कैन यू क्रिएट अ सिस्टम लाइक एन IIT कि जहां मेरे पास एक स्क्रूटनी प्रोसेस है, मेरे पास दिन में 400 लोग 500 लोग अपनी प्रोफाइल भेजते हैं, टीम किसी के पास भी टाइम नहीं है। तो अनलेस एंड अनटिल यू आर रीचिंग आउट द राइट वे, देन ओनली यू विल बी पिक्ड आउट ऑफ दैट 100-200 पीपल। तो वो इंफॉर्मेशन सर्कुलेशन बहुत पुअर है लोगों का। तो ये इंपॉर्टेंट है कि देयर हैज टू बी अ सिस्टम इन प्लेस। हमको मालूम है आज मेरा बच्चा कैट करके जा रहा है, IIM अहमदाबाद में पढ़ रहा है, तो ठीक है, वो ऑब्वियसली वो एक पूरी लड़ाई लड़के आया जिंदगी भर की। लेकिन जब वही बच्चा मेरा स्टार्टअप स्टार्ट कर रहा है तो उसमें प्रॉब्लम हो जा रही है। आज IIMs के कई सारे बच्चों को फंडिंग नहीं मिलती है। बहुत सारा लार्ज कॉर्पोरेट है जो बहुत कुछ करना चाहता है। डिपेंडेंसी ये नहीं है कि हमको, एक नॉर्मल चीज है कि आज अगर आपके पास रिलायंस ऐसे पार्टनर है, जो मैंने केयर एक्सपर्ट की बात करी थी पिछले बार में, आज रिलायंस को $1 बिलियन मिल जाएगा उसी प्रोडक्ट के लिए, एंड दे कैन गो ग्लोबल इन नो टाइम। लेकिन वही अगर वो निधि अपने लेवल पे उसको ग्रो करने की कोशिश करेगी तो शील हैव टू एंटर 4, 5, 7, 10 राउंड्स एंड इट इज गोइंग टू टेक 10 years फॉर यू टू बी देयर। Not everyone is a Mark Zuckerberg. It has taken 20 odd years for these people to go there where they have reached now. And हमारे देश में हेल्थ एक बहुत बड़ी प्रॉब्लम है, सबसे बड़ी प्रॉब्लम है। आप पीपल विल हैव टू कम अप विद सॉल्यूशंस जहां पे आप डीपली जा सकते हैं, जहां आप सोसाइटी लेवल पे जा सकते हैं। यहाँ पे डॉक्टर पिनाक है, तो ही हैज डन सम ऑफ, आज मैं इनके इन्वेस्टमेंट देखता हूँ मुझे बड़े अच्छे लगते हैं। हेल्थीफाई है, इंफॉर्मेशन दे रहा है कि मैं अगर पोमेग्रेनेट खा रहा हूँ 100 ग्राम तो मेरे बॉडी के अंदर कितना कैलोरी जा रहा है। वैल्यू, अगर कोई भी चीज आपको इंफॉर्मेशन सही देगी तो उसकी वैल्यू है। आज ये प्रोडक्ट चलाते हैं स्टैंड प्लस जो एम्बुलेंस में है, लेकिन आज मैं बोलता हूं कि इस देश में कितने लोगों को ये मालूम है, जो भारत सरकार का नंबर है एम्बुलेंस का, उस पर यदि आप कॉल करेंगे वो आपको किसी प्राइवेट हॉस्पिटल में लेके नहीं जाएगा, दे विल ओनली एंड ओनली टेक यू टू द गवर्नमेंट हॉस्पिटल. नोबडी नोज दैट. इंडिया केवल दिल्ली, बॉम्बे, चेन्नई, बैंगलोर में नहीं है वैसा. भारत का 65% आदमी टियर 2, टियर 3 में है, गांव में है. इतना बड़ा इंफ्रास्ट्रक्चर है, कोई एक्सप्लोर नहीं करना चाहता. हर गांव में, हर एक तहसील में एक पोस्ट ऑफिस है. इनके पास बहुत जगह होती है. क्यों नहीं ये हर पोस्ट ऑफिस के अंदर कोई जाता है और एक क्लिनिक खोल लेता है, जहां पे एडवांस डॉक्टर्स लाइक त्रिहान साहब के यहाँ से मेदांता के लेवल के आपको लोग मिल सके, जो वहां से बैठ के आपको जज कर सके. एक छोटा डॉक्टर जो किसी छोटे शहर में बैठा है, अगर उसको, पीपल नीड एडवांस क्लिनिक्स, people need advanced life support, you need first responders. First responder is not ambulance. That is a very large mistake, because by the time जब तक आपके पास एम्बुलेंस पहुंच रही है और वो आपको हॉस्पिटल लेके जा रही है, लगभग आधा घंटे से ज्यादा निकल जाता है. अगर मैं नहीं मान सकता, कोई भी मेरे से आके इसको चैलेंज करता है, तो यू नीड समबडी कि आपने एक कॉल किया और एक बंदा आया है आपके पास एक बाइक से. मैं ये आइडिया दे रहा हूँ, आई वॉन्ट, मैं चाहता हूँ स्टैंड प्लस में ऐड कर सकते हैं पिनाक साहब, कि आपके पास एक फर्स्ट रिस्पॉन्डर आना चाहिए, एक बंदा जिसके पास एक ऑक्सीजन टैंक है, जो आपको इमीडिएट कुछ मेडिसिन दे सकता है, जो आपकी जान बचा सकता है. मेरी डॉक्टर त्रिहान से बात हुई तो उन्होंने कहा इस देश में कितने सारे लोग तो हॉस्पिटल पहुंचने के पहले ही मर जाते हैं. तो अगर हमको हेल्थ में सीरियसली कुछ करना है, टेक्नोलॉजी बहुत जरूरी, AI/ML बहुत जरूरी, बिकॉज विदाउट द लर्निंग प्रोसेस इमेजिंग बहुत जरूरी है. तो जितनी ज्यादा टेक्नोलॉजी आएगी, जितने ज्यादा इंटेलिजेंट स्टार्टअप फाउंडर्स हैं, उनका अमलगमेशन होना चाहिए. हमारे यहाँ रिसर्च बहुत पुअर है, डोंट माइंड इट, बट लेकिन आई हैव सीन देयर शुड बी रिसर्च फंड्स. व्हेन आई लुक एट अ कंट्री लाइक इजराइल, दे हैव गॉट सुपर रिसर्च. आज हम भी कुछ प्रोडक्ट्स हैं जो हमने बिल्ड करे हैं. आज हम देश दुनिया में, आज चाइना हमारा सबसे बड़ा कॉम्पिटिटर है टेस्टिंग के एक पर्टिकुलर प्रोडक्ट में, लेकिन आज हमारी एफिशिएंसी उससे 5 गुना ज्यादा है और मेरी प्राइस उससे 5 गुना कम. लेकिन बट दैट हाउ इट हैज हैपेंड थ्रू ग्लोबल पीपल. इट इज नॉट हेल्थ में हमको एक अमलगमेशन चाहिए कि इंडिया के लोग, इजराइल से लोग, हाउ इंटरेस्टिंग इट साउंड्स दैट यू हैव गॉट अ पॉली बैग which you can put up in your glass and you can in water and it dissolves and you can drink that water and it is sustainable. आज गवर्नमेंट प्लास्टिक बैन करना चाहती है, ऐसे प्रोडक्ट क्यों नहीं है इंडिया में? सो हेल्थ में बहुत ज्यादा इनोवेशन की जरूरत है, बहुत बेसिक लेवल पे जाने की जरूरत है. लोगों को नहीं पता है कि डायबिटीज, कार्डियक की प्रॉब्लम, विटामिन डेफिशिएंसी, न्यूट्रिशनल डेफिशिएंसी, इसके कारण एक बच्चा जो पैदा होने वाला है उसके ऊपर कितना ज्यादा असर पड़ता है. आज हमारे साथ ये नीति आयोग से सर हैं, आज डॉक्टर विनोद पॉल हैं वहां पे, मेरी उनसे भी बातचीत हुई, तो वो भी एक बड़ी बेसिक बातचीत है. न्यूट्रिशन मिसिंग है सर, न्यूट्रिशन मिसिंग है इस देश में. क्यों? क्योंकि हमको वो बताया ही नहीं जा रहा. तो इंफॉर्मेशन ही अपने आप में इतनी बड़ी एक टूल है कि आप हर एक प्रोडक्ट के साथ, आज केयर एक्सपर्ट है, आज मैं इसको देख रहा हूँ मेरे सामने, तो मुझे एक चीज दिखती है कि भाई अगर आप बेसिक इसको और कितना अंदर ले जा सकते हो, लेकिन इसको अंदर लेके जा सकता है रिलायंस. ये अभी 147 अनुज जी ने बोला कि कुछ 147 हॉस्पिटल के साथ काम कर रहे हैं. क्लाउड इतना स्ट्रांग है, उस क्लाउड पे आने वाले समय में आप बहुत कुछ चीजें कर सकते हैं. सो इट हैज टू बी अ मिक्स ऑफ ह्यूमन टच plus technology, then only, and there is a very, very, very vast potential market. This market is, I would say this is anytime much bigger than e-commerce, much bigger. That's all I think. This is from my side. Thank you so much.
Thank you. So I think a combination of, like you said, information integration, technology is an enabler, and mainly what you were talking about, last mile connectivity. I think I think that point came out in many of the earlier things. So what we're going to do now is we're going to throw it open to the audience. I think we should be able to take a couple of questions. We're running a bit late. So if there are a couple of questions, we can take it right away. Otherwise, we'll wrap up the session. Yes, sir. Yes, please go ahead.
something on internet, we are said Google करके आ रहे हो तो मेरे पास क्यों आ रहे हो? Sir, have you understood the question, sir? Sir, if you go to a doctor, I repeat again, and if we say that we have read something from the Google, the doctor says, आप Google में से पढ़ के आ रहे हो तो मेरे पास क्यों आ रहे हो?
So, Abhishek ji, would you like to take that, or should I bounce it to one of our doctor colleagues here?
Yes, you can always take it to the doctor, but I would like to jump in.
Please, sir.
So, देखिए एक बात समझाता हूँ मैं आपको. इस देश में जो सबसे पहले बैन होना चाहिए ना, वो है OTC मेडिसिन. आप गूगल पे पढ़ते हैं, आप जाते हैं, आप देखते हैं वहां पे कि मैं डाइक्लोफेनाक, सोडियम पोटेशियम कुछ खाऊं और वो मेरे बॉडी के अंदर मेरे पेन को कम कर सकता है. लेकिन इनमें से कितनी मेडिसिन हैं जो ये बताती हैं आपको कि आपके लिवर किडनी को क्या डैमेज कर सकती है? आज सिगरेट के बॉक्स के ऊपर लिखा हुआ है कि सिगरेट स्मोकिंग कॉजेस कैंसर, तो वो बता रहा है कि मैं क्या करता हूँ कि ये जितना एनसेड है ये बॉडी को कितना नुकसान पहुंचा सकता है. तो अगर कोई डॉक्टर ये बोल रहा है कि भाई साहब गूगल से पढ़ के मत आओ, बिल्कुल सही बोल रहा है. See, there is an expert to everything. If you keep on doing self treatment out of Google, you are in a deep shit. आपको ज्यादा जुकाम हो रहा है, गूगल पे टाइप करो, वो बोलेगा कैंसर है आपको. आपका कहीं स्टमक पेन हो रहा है, वो बोलेगा आपको कोई बहुत बड़ी बीमारी. तो अनलेस एंड अनटिल द राइट डायग्नोसिस हैज हैपेंड, कैसे हो सकता है ये? तो बिल्कुल सही सवाल है डॉक्टर का कि आप गूगल डोंट बी ए व्हाट्सएप प्रेन्योर, फेसबुक प्रेन्योर और गूगल प्रेन्योर.
नहीं सर,
उसकी डिग्री किस काम की है? थैंक यू.
Basically bringing the issue to the awareness. Preventive medicine is a very vacuum space. If we are going on to Google and trying to understand our diseases, and we are trying to understand what can be the adverse effects, तो आधी चीज तो मैं वहीं पे सीखने की और समझने की कोशिश करता हूँ. Suppose if I take something and if I have certain comorbidities, it can create a reaction. So I am basically kind of informing a doctor that I have certain comorbidities and what I have read from the Google that it may create it. Now a system in our tertiary care is like this. Sorry to say, but doctors are moving on the targets. आपको एंजियोग्राफी करवानी है, 30 seconds में डॉक्टर डिसाइड कर लेते हैं आपको एंजियोग्राफी करवानी है. Whereas if we look into the YouTube and what the people in US say, it is not really necessary to go in for angiography.
Sir, I think, sir, your point is taken.
I'm trying to just
your point is taken, but you're going across quite a few points. So I'm going to ask Dr. Bajaj
for one question. We're really out of
Okay,
time
we'll
now.
wrap
Yeah.
up.
I can answer a bit of your question. Of course, आपकी problems बहुत genuine, and I think this all boils down to trust. See, if you trust someone, you will take their advice implicitly. If you don't trust them, then you will of course look for second, third, fourth opinions. That is very, very understandable. और ये बहुत एक बड़ी चीज है कि power of balance जो है interaction में with the doctor and the patient is completely skewed and in favor of the doctor. So the patient is right in feeling helpless. अगर वो आपको कह रहे हैं आपको एंजियोग्राफी करानी है, अब आप क्या कर सकते हो? आपके पास पावर ही नहीं है कुछ करने की. आप बोलो ठीक है साहब कर दो. और क्योंकि आप उस टाइम हेल्पलेस फील कर रहे थे जब डिसीजन हुआ, that angst will keep climbing up and up and up levels till the time you get out of the hospital. अगर कुछ प्रॉब्लम हो जाएगी तो कहोगे देखो डॉक्टर ने मार दिया, बिकॉज सारा मॉडल ही स्क्यूड है फी फॉर सर्विस के लिए. तो फी फॉर सर्विस में आपको लगता है वो तो पैसे कमाने के लिए बोल रहा है. तो दिस होल structure is very faulted and flawed. This fee for service model in healthcare and education should never be there. It is an ad nauseum thing. We can keep discussing about it, but the main problem is of trust, and I agree doctors need to build much more trust into the community for their advice to be taken more seriously.
Thank you, Dr. Bajaj. Sorry, as she said, we are short on time, so we're going to wrap up the session now. Just a quick one line from all five of you, just one line. for all the budding entrepreneurs here, if you have to give them one line, one important piece of advice, maybe just 2-3 words, what would be? I'll go around, starting with Dr. Pinnock.
My advice would be listen to the genuine problem. And if you are able to create that solution for that genuine problem, then you will have a success story.
Ankit?
I think I'll piggyback on that. I mean, definitely listen to both users and doctors, but I'd also reiterate, the future is ripe for health and health tech. So if you have the passion, I think sky is the limit for this sector.
Dr. Bajaj?
Don't jump to solutions at all. Just identify the problem correctly is something that I would advise them always. The problem is that you identify a bit of the problem, you build the solution and fall in love with your solution, which is not the right way to do it.
So true. I think entrepreneurs tend to do that a lot. We fall in love with our product and we forget what we made it for. Sorry, over to Raghavendra. One line.
My advice is to focus on rural India. I think the problems of rural India and the solutions that will come out there will set the trend for what is going to be healthcare innovation in the world. So I think that's going to define not just us, but how healthcare is going to get delivered across the world. So focus on that if possible.
Thank you. Abhishek ji?
I would say, जब भी आप कोई प्रोडक्ट बना रहे हैं, आप कोई स्टार्टअप बना रहे हैं, आप कोई सोल्यूशन बना रहे हैं, आप कोई टेक्निकल सोल्यूशन बना रहे हैं, इस देश के प्रधानमंत्री को देखिए, मोदी जी को, जब वो बोलते हैं तो वो गांव में बैठे एक बहुत छोटे से कस्बे आदमी को भी समझ में आता है. तो अगर आपने ऐसा प्रोडक्ट बना लिया जो उसको भी समझ में आएगा, तो आपको everybody would want to have that solution. Why not? Why not?
Right.
So people want solution, लेकिन वो समझ में आना चाहिए. वो सर जो मेरे से जिन्होंने डिस्कस किया कि मैंने गूगल से पढ़ लिया, वो समझदार हैं तो वो जाके वहां पे उसके इल इफेक्ट्स देखेंगे, लेकिन यहाँ ज्यादातर लोग नहीं देखते. तो इतने समझदार लोग इस देश में है नहीं. उनको अभी एजुकेट करना, एजुकेशन और हेल्थ ये दो सबसे बड़े सेक्टर हैं. अभी भी देश को एजुकेशन की जरूरत है. थैंक यू.
Thank you, Ji. Thank you. I'd like to thank all the panelists. Thank you all for this discussion. I hope all the budding entrepreneurs here have got at least a few tips and a few things to work on. Okay. Thank you all for your time.
Thank you so much for conducting the session. And my request our speakers who are present here virtually, not virtually, but join in offline, to kindly stay put. And we'll be now having our transformer podium starter pitch. So request you to kindly be online. And at this juncture, I would like to thank all our esteemed speakers, dignitaries who conducted the session so beautifully and shared the investors' perspective on raising the capital. We would like to present a small token of appreciation to commemorate the occasion. And may I please now invite upon stage Mr. Kamal Narayan to kindly present a small token of appreciation, a memento to all our esteemed guests upon the stage. Would like to present a memento to Mr. Bharat Radhakrishnan. Dr. Pinak Shikhande. Mr. Ankit Gupta. And Dr. Shuchin Bajaj. Thank you so much. Can we please have a group photograph? And thank you so much. May I request all our speakers to kindly take your seats in the front table, as we are now going to have the Transformer Pitch podium, where we have our startups who would be pitching their ideas. And each startup will be given a time of 10 minutes. I'll request them to kindly adhere to the time of 10 minutes as we have a beautiful evening lined up ahead for us. We really run on short of time, but we would be giving them 10 minutes, of course, as promised. So we are all set to start with the Transformer Pitch Podium to hear the startups' innovative ideas, hear them pitch their ideas. We're starting first with Ms. Basudha, COO and co-founder, Field Force Monitor app. Please welcome Ms. Basudha up on the stage. And we will be having the timer visible up on here on the screen in the center. Welcome on stage, Ms. Basudha. You have 10 minutes, and once the 10 minutes are over, you will hear an alarm, and I would request you to kindly finish it upon time, as we have other presenters as well. And all the best. Thank you.
Good evening, everyone. I'm waiting for my pitch. Okay, yeah, working fine. Thank you for having me here. I am Basudha, co-founder of mFly. We are a team of product excellence which bring orders to work life. We are revolutionizing and reimagining field force management. Can you relate to this picture in your operation management? If yes, then you definitely had a bad time. So we are here to solve it. Now, let's take an example. Now, imagine me that I'm an operation manager and I have a lot of different work to do. So I'll start with, let's have a communication platform where I will be connecting to my field management and field staff. And we are yet to finalize, what would be our communication for our collection, for our client visits, for our clinic visits, and of course to, have some notes collections or maybe other type of information. So I'll ask my team to take a selfie or maybe, use a geolocation, send me the current location and all that features. And I'm yet to finalize whether I would be using WhatsApp or Telegram. Thanks to my relatives and family, I have more notification there. So it took me 2 weeks to finalize WhatsApp. Now, there are other things that I have to also think apart from communication. So I would also guide my team to have a task management, having a communication channel. You should also, update your CRM so that, I should not lose my client. And field monitoring, I need everyone to be monitored. You need to be notifying me on the emails, then meeting notes, inventory updation of how many, tubes you have taken, for example, and learning. You have to keep on learning as well. And at attendance, I need it for the payroll. And did I miss something? Yeah, of course. I missed to add that by end of the day, you will have to also file the right expense because I will not claim that bill unless I have that hard copy with me. So in all these, different tasks using different communication channel, different tools with a lot of complexities which are there in the market, we are losing very important point, that is client. Now client helps to drive sales, it helps to drive revenue and find. In this whole conversation, now everybody thinks that operation and business is two different vertical. And we have to see that how can this be, treated separately by different separate manager. But this is not the case. We need to find a solution called business operation excellence that can only happen when you have a very well-connected platform and you don't have to switch to different application at different part of your, day. mFly has a closed network. Okay, yeah. So mFly has reimagined the closed network field operation, and we are AI-driven field management company. Our easy plug and play organization to build 99% transparency in field operation, 50% saving on operational cost, and 28% on your performance, increase in your performance. So monitoring your staff, having a productivity in place, on-spot learning is on, waiting for a client or waiting for a doctor. By that time, a learning material. And because time your team is not active or it's not very productive, so only on that particular time you can send out the LMS part. The rest of the time he has other, and one click to convert all your day into one right expense that is claimable. You have all the data nodes from different applications to just one. And yes, I forgot. Now, he is one of our clients. They are leading healthcare company. They have more than 1,000 clinics all across India. And they're also soon opening in other part of the countries. Now, I know why Saurabh said that mFly is a transformational application. It helped them to manage their operation, to manage their finance, their HR works, their complex roster management system at different clinics, and finally, to empower with them with the sales, more sales. Now, we empower teams and individuals to manage all these broken links from a single epicenter. I am proud to introduce Field Force Monitor app. Now, our application has day planning, field visibility, right expense, well-connected workflow, and recording task. And I must say that it's a plug and play application. So even if I'm using any of the HRMS CRM tool to manage your discreted workforce, you still can have a plug and play system where you can connect all these things together and have one interface to interact. Now, going with the same example, Meadow has a very complex cluster management. So he is Vijay, who is transforming, giving the task to their cluster manager, who is spread across Bangalore, Jaipur, Gurgaon, and Delhi NCR, other part of the region, including Chandigarh. He transformed all these information, and their cluster manager has to assign a different locations, create private system location, their client location, so that nobody knows what clinics are, if that's such something secretive that they want to know, and then they assign and create. Now, Vijay is very happy because he has a very interactive dashboard, and he can see all the performance, the nearest locator of the employee. He or she needs to be at that particular doctor or a clinic, then he can see the nearest, or maybe in that particular area, that's fuel and increases the productivity. Ultimately, this beautiful dashboards will also gives you, performance, who is performing well, what is your expenses in each quarter, and then by status wise, how your company health is. And I miss it works in offline mode also. We know that a lot of health workers are working in remote areas, Naxalite. So their network is not too high. So there we have given the facility that, most of the features can also work in offline mode. What we offer is a centralized data center, I would say. A one unified solution that helps ultimately gives you a fast. So of information. Meadow is not alone. we are targeting every single healthcare, like pharmaceutical companies, field driving companies, and startups and corporates who would love to field force application to manage their staff. And why we chosen this? Because this field is literally lucrative. It has 5.7 million of business, and it is increasing at the rate of 11.59%. So there is a lot of scope, and it's good time to invest here. Loves and fly. This is some data, and the company is already operating in this section. Microsoft is always there. Now, our traction of employees, how we track companies, we give them a free premium package wherein they can use a tool, have a feel of it, and then finally they can go for a premium version or a paid version, a SaaS model. This is our team behind. I am COO members who have excellent experience of more than cumulative of 26 years in the same field, and we are managing this through our different perspectives that we have for management of the field staff. We are available in both laptop and both in Windows, applications as well as in mobile application, App Store and Play Store. And to build this technology more stronger, and as per the vision that we have, we are looking out to raise 125K to make a strong team, make a strong company, provide a solution globally, and also to increase our R&D research and everything. Thank you for listening to me. If you would like to be part of this journey, we are happy to onboard you. Thank you.
Thank you so much, Ms. Basudha. It was wonderful to hear your pitch, and I'm sure our investors sitting out here are also impressed with your pitch. And of course, yes, thank you so much for sticking on to the time, precise 10-minute slot, and I do hope our other pitchers also stick on, our other startups also stick on to the time. Well, moving on, now we have our next pitch from Mr. Sunil Kumar, founder, COO, IEE ARC Technologies. Do we have him here? There he is. And all the very best to you, Mr. Sunil Kumar.
A very warm good evening to all of you. I'm Sunil Kumar, founder and CEO of IHW Technologies Private Limited. So I will be presenting here my health tech startup. It's been a 5-year journey. By education, I'm an engineer. And by profession, I'm a health tech startup entrepreneur since last 5 years. During my college, I have initiated my journey. So can we have my presentation? So we have developed this Enigma cloud diagnosis platform. So before that, I just wanted to give you a very small incident that I have personally experienced. I used to be working in the lab, and there was a lab attendant, like a 27-year-old guy. So he suddenly got the news for the kidney failure. And after that, he died within a week. The treatment was supposed to be happening in Noida nearby hospital. And we have seen since last 5 years during my first year of college. Imagine the possibilities if we can identify this complication before, like somebody can be fall into kidney failure and the heart attack by just understanding into the primary screening. Because as we know, information is a key which can unlock all the problems, majority of the problems, to identify the complicated disease like which is sudden heart attack, kidney failure. So that made me understand that this is not going to be developed within a 1 day or 2 days. It's not like malaria or any vector-borne diseases which is developed within a just mosquito bite. Lifestyle disease is something, a progression of disease. It take a very small step which in over the course of time, it gradually develop in our system, then suddenly transform into this condition. So next slide. Okay, so this is the something that we already know. Any patient, we go to the doctor, and after some time doctors say okay, that you need to go for the bypass surgeries or the dialysis condition. It's not like something doctors are making that I used to take the annual health checkup also the doctor. How can I be affected with this thing, because I used to go for the gym and all the physical activities. But this is certain condition which is not something that make you indication, okay, that someday you're gonna get a heart attack or kidney failure. So this is the something which is progression is very complex. Sorry. So this is the current complication and the challenges that we have seen. It's a lifestyle diseases like all these things. It's a very complex. And from the doctor and the patient perspective, it is very tedious to monitor because it's required the continuous monitoring. And we have that post-treatment monitoring, which is lacking, that I find it out in during my patient case journey, because once the medication process is begin, they have taken the medicine, but after that, nobody care for that one, whether the medicine is suited for that group of patients or not. And obviously, we have a lot of EMR and EHR kind of software. The data is stored in PDF or a Word format in radiology, but still it is an unstructured and uninformative way for the patient and the doctor as well. So this is the kind of thing, the journey we have traveled from the files to that is storing into the any platform, whether it is in an application or Google Drive, but still that we have lacking in some part, where we require the ML data set for the predictive analytics, and the enterprises like pharmaceutical companies, healthcare expert, they can analyze the data and much more effective way. So this is the solution that we come up with, digital twin. We just map that completely individual into, transform into complete digital information, all the kind of information from the primary health BMI to vaccination and what kind of medication they are more frequently they are taking. As the previous session that we have seen, over-the-counter medicine is very frequent for the patient. So we are mapping all this gap information, which is from the doctor perspective, they needed to know whether my patient is taking what kind of medication more frequently, and physiological changes, which is very much high matching with that particular disease that we are mapping in our SaaS system. So this is the ML data set that we have. So it do the complete digital profiling of the patient to complete deep analysis. The doctors can take a better decision out of it. The patient also can be add a value. Okay, what is my health currently, whether I'm taking the medicine, whether it is suited to me or not. So that all information we are giving to the patient in order to make them understand. And this ML dataset can be further utilized for the pharmaceutical companies for the drug delivery. Since after the COVID, we know that the changes are very high. So definitely pharmaceutical looking for this kind of dataset. So, and I'm giving you the last 1 year of my blood sugar or BP device, BP data in hard copies, or whether it is in a PDF format, how much time it will take you to download and read all these files. But as a graphical representation, it will just take a 30 to 40 seconds to extract that information, take the decision, and give the better patient. So this is the market size only for. In India, we know every second person is the diabetic or BP. Lifestyle diseases progression is very high, especially after the COVID. By the Mayo Clinic as well. So we have this lifestyle disease management channel. So this is our competitor landscape. So we are into the low cost, high value proposition model. We are trying to add the value to the enterprises. So this is something that we are looking for. And that we have subscription based B2B and B2C as well. Directly we are pitching to the customer, they become our subscriber, and our team is monitor their health and giving them annual health reports. So we also have the sample, anybody wanted to look into that. So the two institutions we have deployed in Chennai, Savita Engineering College, Danish Ahmed College overall. And okay, 3 minutes. So this is our team. So my slide is also in. So we've been initiated and currently we are part of NASCOM Microsoft Accelerator. We got selected in MIT stall, get the validation from CSIR Toxicology Department, and I think that's it. Any questions?
Can I ask you a question?
Somebody is the back.
Can I ask a question?
We would like to hear the comments and feedback from our esteemed members who were judging our starters for the pitches. You would like to take the comments? You're through with it?
Yeah.
Okay, and we would request Ms. Basuda also, to kindly join up on the stage. And we would like our members to kindly give their comments. We would like to hear the feedback and comments for our startups who just made their pitches. Ms. Basuda and Sunil, please be on stage. Yeah.
Was there at the back somebody wanted to ask? Okay. All right.
Kamal, I want to ask a question.
Yes, Sunil, you mentioned about the lifestyle several times. I'm over here.
Okay.
You mentioned lifestyle several times. How you are building the lifestyle changes the patterns in the lifestyle into your recordings.
Lifestyle patterns.
Yeah.
Lifestyle patterns we are not recording. We are recording that the physiological changes and the data basically that people do it in home also, like BP, blood sugar they are taking
You
in
started on the very first slide. You mentioned that there are certain diseases which are in slow progression because of the lifestyle, and they are lifestyle diseases.
Basically, this diabetes, blood pressure, and the cardiology kind of problem, it called as a lifestyle disease because it is not something which can be derived automatically. It is a lifestyle changes. So its name itself is a lifestyle.
Yeah.
disease.
So are you building changes in the lifestyle patterns, improving the lifestyle patterns into your program?
A lifestyle pattern, not precisely, but we are working into the health data analytics in order to understand the more deeper information of the patient health.
So I just have one follow-on question to that. So I understand how you're doing data analytics to identify risk patterns, right? The digital twin. But how do you then close loop to make sure that patients who get access to your risk reports then actually make the lifestyle changes?
Basically, it is a fall into the category that you possibly trying to edit out into the preventive care. How we can make them preventive. Our system is surrounding and based on we connect to the doctor. Also, doctor is going to be keep on get connected with them because as a directly enterprises, we connect with certain patients to drive with something. So they're possibly having the two thoughts that they are trying to make the money out of it. Our business model completely confined within to make the patient aware about their health in a much more. It's a cloud diagnosis. It means we are trying to make them understand more effectively. It is almost 10 to 25 times more cheaper where the patient can understand about their diseases progression rate, immunity factor, because diabetes is something, it is a slowly, gradually, it's killing your immune system. So we are trying to understand how much rate it is trying to degrade it. So more like into the patient understanding side, then there is a prevention. We can definitely connect with certain entities. There's a lot of people are working, but our focused only into this cloud diagnosis management thing. And this solution can be given to the doctors so they can manage their patient in a much more effective way. Because one doctor is having very limited time to see the patient, the number of patients they are seeing. And to get this 1 year of data, they look into, okay, that I have prescribed metamorphin, 12 hours, 40, what is the BP variation is happened during this course of time. It is a very complex thing. So we are saving the time, making the decision-making process is way more smoother and a very fraction of time.
So I understood your business model you said was a SaaS model, and
Yeah.
you do both B2B as well as B2C customer acquisitions.
True, sir.
Are you at a revenue stage right now? What is
So,
your, are you pre-revenue right now?
Right now, we get a little bit of revenue, but it is a very less because B2C, we are trying to get connected 1200 premium that we are charging. So through webinar, we are getting a paid client. It's a conversion rate at 10%. Slightly, we don't have that much of fund because seed investment done by initially government side. So definitely looking for funding for the marketing and get the, but B2C, we have 2 to 3 enterprises that we have deployed under a school wellness program, which is initiated by Government of India in 2017 under Ministry of Health and Ministry of Education, where they need to monitor the student health. In our platform, it is very easily they can monitor multiple parameters instead of just BMI. So we're completely digitally clone this kind of children's because these are the some way they are going to become adult and also they're trying to make these things done.
So
we
how
have
how many customers do you have on your app, right? Is there an app for this?
It's a web app technology, web app. It is there.
So how many customers are there?
Right now we are onboarding. We have the 3,000 according to the 2 institution. They have a total 3,000 student, 2 institution. And MP government, I have initiated the talk for their school wellness program. So there is thousands of schools are there. We are planning to onboard. So this kind of data also going to be monitored in our system. So this is also Government of India initiative. So we are trying to plug in with them because there's a lack of system infrastructure in government that, so that is the part we are trying to fulfill.
Well, I'm sure there are many more questions lined up for Sunil. We can take offline one-to-one. We would like to have questions, comments for Ms. Basudha as well for her pitch, for her ideas which she presented before him.
Vasudha, thank you very much for your presentation. I think most of us are beginning to love Mfly in addition to Saurabh. You said you had calculated that this using this app saves you 50% in cost, 28% increased performance, and 99% increased transparency. Just curious to understand, how are these metrics arrived at? What are you tracking, and are you tracking pre and post, or can you give us an example on that?
Absolutely. We are tracking pre and post of implementation of our application. So we have 12 clients onboarded, and we have a routine of maintaining a relationship with the client, understanding how they are progressing after using Field Force. So that data point, that is being collected, it should be not only useful for them, but for us to grow in the right direction. So all these points that has been taken from that pre and post analysis.
But what are you analyzing was my question. How do you analyze 99% increase in transparency is something that I'm very curious about.
So there are different mode of communication that they were earlier using, like email, chatbots, and you can say there are other mediums, WhatsApp and all that. And that was a very discreet way of communication. And also writing down notes and having different tools to manage, like CRM updation and your lead management, your attendance and all that of sort. So that was not clear because there was no clear transparency dashboard where I can go and see the performance of these field staff. I can only as a company, I only believe my ops manager, and they gives us a feedback whether the certain X person is doing well than the Y person. But after implementation of the application, now they have a full transparency. This is there where Briaj said that, after implementation, there is a complete transparency. The owner of the company is also well aware.
Thank you. Understood. What is your current shareholding structure?
So 51% stake I'm holding. Himanshu is holding 27% stake. We have another co-founder. He's a CTO and sits in Bangalore. So he has 7%. We have put 15% approximately for our ESOPs and advisory board. And rest, we are looking out to raise funds to distribute and little lesser down our shares holding.
So you're completely bootstrapped till now?
Yes, we are completely bootstrapped. And yes, we have also received some grant.
What is your revenue run rate right now?
So we are generating 1.5 lakh revenue per month as of today.
And how much are you burning?
Our burn rate is quite high right now. It's around 2.5 lakh rupees. But yes, we have multiple, good pipeline. So we'll be able to cope up with.
What valuation are you looking for at 125K? What are you looking to dilute?
10 to 12%.
Thank you.
Wonderful. Thank you, Vasudha. And thank you, Sunil, for putting forth your ideas, your pitch. And moving ahead, ladies and gentlemen, we have 4 more startups who would be pitching their ideas. Now, I would like to invite upon stage Mr. Hiram Poddar, founder of Reach for Health. Please welcome Mr. Poddar up on the stage.
Excuse me. So can I request to complete your pitch in 5 minutes so that we have more time to ask questions? Okay.
Yeah, I can try.
Yeah.
Sure.
A quick introduction about what business idea you have. Okay.
Sure. So I think I would like to start by alluding that information is of vital importance in our day and age. We talked about information channels, especially during one of the last sessions. So on that note, we are Reach for Help. We are a tech non-profit connecting people to volunteers and volunteer organizations to resources and people in need. So it's just give us a second. Yeah. So we are primarily born out of the pandemic. We are a bunch of different students across the world, and we decided that hey, this is quite the whole third sector with all of its mechanisms right now is really, really inefficient. So what are like the main problems we're trying to solve? So as like a volunteer organization, you are having a lot of inefficiency in your resource allocation and your costings. So we are trying to help with that. That is one. Secondly, you don't really know where to allocate your resources in the first place. And thirdly, there's like, as a person in need in a disaster-struck region, you don't really know where should I go and what kind of resources are available in that region, right? Yeah, so this is like the most prominent kind of example. This is actually a real life thing we encountered in 2020. So we have like Monu, and he needs like oxygen cylinders basically. The problem is there's like a bunch of different organizations across India. One has like oxygen tanks. The other knows that Monu needs these oxygen tanks, and Monu is in a third different city. So we actually had to coordinate all of these three organizations using our platform and get the oxygen cylinders to Monu. Right? So this is like basically our solution, right? So we're trying to coordinate using like one platform, mapping out all of the resources which are available, making them as accessible to people as possible, and being as transparent, giving like a lot of amplification to grassroots organizations out there with all of the excess supplies they might have, and trying to bring about efficiency in this system. So this is like basically our product. So the global map of aid. You can see that we have a bunch of different, it's almost like Google Maps, because it does use like a Google Maps API integrated with Algolia to map out like all the different kinds of resources near you. And this is like available for people to also input any kind of organizations they know, and that would be then processed further by our team. So you can, yeah. COVID-19, we had about 70,000 daily basis. Like received 120,000 from Google for nonprofits to conduct our outreach. We had signal markers for different kinds of resources, including centers, masking resources, centers, and blood testing facilities all over India, which you can see right now. Yeah, so this is like basically the admin side where we would approve any organizations submitted by our community. Yeah, so we have had like quite a lot of partners, and this is largely how we get a lot of reach and traction across the globe. We have many organizations which we reach out to, and yeah, as like we are helping other people reach out for help, we have had to reach out for help quite a lot ourselves. From like the UN to like AIESCC, we have been tapping into all of these kinds of resources. And more importantly, like this is not just restricted to healthcare, right? Like this basic framework provides a platform for any kind of disaster addressal, from floods in Bangladesh, which we are helping out with right now, to refugees fleeing from Ukraine right now into Western Europe. So as we like grow forward, we're basically looking to partner with more and more organizations, coordinating any kinds of resources between them, partnering with larger, mainly like governments, because they have their own distribution mechanisms, which would be very helpful to leverage. And yeah, basically we are raising like 150K, and a bunch of that has already been like done in terms of like non-profit. As I mentioned, at the Google program, we also raised 165,000 for Ukrainian medical aid through in-kind donations. We also raised through Slack's program and through like Algolia's program in-kind donations. Yeah, so what does like our competition look like, right? So I think the main limitation of our competition is A, it's like really, really limited in scope, or B, it has like really, really bad reach, or it is not like tailored to what the consumers or what the people in need really want. And Reach for Help is like more business to consumer, and most of our competitors which you see are like more oriented in like a B2B model rather. Yeah, so we have a founding team, all across like different kinds of countries, from like helping with refugees in Ukraine to floods in Bangladesh, and obviously healthcare crises, particularly like COVID-19, for example, in India. Yeah, so these are like some of our supporters. Obviously, like it would have not been possible without all of their support. Yeah, big shout out to Hamid QA, which is basically like work day and night with us to make sure that the platform is smooth. It does not experience bugs with many users. Yeah, thank you.
Any questions?
All right, the floor is
What
open.
what
Yeah.
what are you using this platform for? Because now there is no COVID, no oxygen exchange required.
Right. So right now, one of the major hot button issues is A, floods in Bangladesh, and B, there's actually quite a big medicine shortage right now in Ukraine. So we are actually raising funds and helping funnel those medicine channels primarily in Western Ukraine because those like regions are still not like under relative attack. Yeah.
Thank you.
One more question. So is your platform more of a crowdsourcing of information, or are you actually doing also on the ground triaging? So for example, I think the earlier example you quoted of COVID was you guys actually were involved in finding the oxygen.
Yes.
Right.
So we do have a logistics team, and often we would step in wherever we would see like an opportunity in terms of like connecting people. So often we have like this list of travel organizations. In Monu's case, for example, which is the one I showed, we knew a specific organization which was able to connect buses from Jaipur to Delhi to carry out the oxygen cylinders. It's just that they didn't know. And those oxygen cylinders would have gone to absolute waste. Our lives would have been probably lost. So that is where we step in. Our team comes in, our network of volunteers steps up. Yeah.
What's the technology that you're using for the platform? Have you built it yourself, or is it an off-the-shelf technology that you use?
So we have largely like built it ourselves with a couple of different tools. We have used Twitter APIs, for example, to scrape some data, and then obviously it requires some verification. We have had some help from developers from Google for nonprofits as well. We have used Algolia and a Google Maps API to set up the dashboard, and obviously Hermit QA has helped out a lot with setting up the whole scheme, which is the site I showed. Yeah.
Thank you.
Thank you.
Thank you so much for your presentation, and it was wonderfully
Doing good job.
Yeah.
Good work globally.
Wonderfully presented in a short time. At the nick of a moment, he was told to cut short his presentation, and he wonderfully adapted to it. Well, moving on, we now have Mr. Bharitisha, PL, co-founder and CEO, Medi Impact Healthcare, who would be presenting his idea. He'll be putting forth his pitch to us, please. And you know the time limit?
Yeah, I'll be for.
Sure. And all the best to you, sir.
Hi everyone, good evening. Thanks IHW for the opportunity. So I'll be super fast. So I'll try to cover in 5 minutes. Okay. So basically, MedPass is India's only health digital wallet app. It is a digital platform that supports consumer to save money on every transaction, which make across all healthcare service providers. Okay. So we are actually Bangalore-based organization. This is our okay. Yeah. Thank you. So basically, MedPass is India's only health digital wallet. It's a digital platform that supports consumer to improve the management of health expenses. So what we do is we save money on every transaction across all healthcare service providers. So I'll just take a minute and explain the business model. Ours is a B2B2C. So what we do is we engage one-side healthcare service providers such as your super specialty hospital, multi-specialty hospital, labs, pharmacies, doctor-to-door services, doctor-on-call services, physiotherapy services, almost all the healthcare services on one side. On the other side, we engage end customers. So being a healthcare platform, MedPass, so people will download our app and make a transaction. It is a wallet. So every time when they make a transaction, so they will save money across all healthcare service providers. So this is our team. Myself, so I entered my 16 years in healthcare industry. I worked for the good corporates earlier. So last 2 years back, we started. My colleague, Mr. Ali is here. I have my one more senior colleague in Bangalore now. So basically, the problem what we are trying to solve is unable to fund healthcare. So as per the survey says 1.3 billion, 65% is out of pocket. What that means is they're not prepared for the emergency healthcare. So and also access to quality healthcare. This is the main the problem we try to solve. So what we built in is basically it's a wallet based platform for B2B and B2C, and also we come as also as the emergency emergency medical fund. So what we do is if someone is looking for emergency medical loan, so we also try to help them with a medical loan. So these are the healthcare markets, so we'll not spend much time on this. So this is our journey. We started in Jan 2020 and December we launched our product. So we started the transaction at the volume of around 9 lakhs. Last 17 months, if you see, so we have processed more than 23 CR and made around 1.71 CR as a revenue, and our customers saved around 1.51 CR through our platform. So currently we operate in Bangalore and Mumbai, where we have around 53 service providers, which is like breakup of hospital, labs, pharmacies, and almost all the healthcare services. It includes your home care, doctor on call, almost all healthcare services. So B2B, we also connect with medical devices providers. So what we do is once we have the hospitals in place, so we'll also help them is the one side is customer is an emergency medical loan, and the other side business loan for an hospital. For example, some hospital is 100 bed, you want to extend to 200 bed, so we'll also come and facilitate for their business loan. And hospital and corporates also we are working at. So this is our app. Basically, it is a healthcare wallet, and it's a combination of emergency medical loan. So one side you save money on every transaction, other side we also help them with the emergency medical loan. This is the main thing. And the majority of our concentration on the hospitals, the rest other things, there are many players in the market. So we are majorly 80-85% of our transaction we do in hospital. The roadmap basically, so we want to expand both B2B and B2C. That's why we are raising funds now. So we have to have customized insurance once we have the data. We also want to provide the medical loan, which I talked about. And currently we are in Android, so we want to have iOS development as well. So currently the traction, we have 12,000 plus customers, in around 41% of repeat customers. So as I told, we have done around 23 crores of transaction. So 1.71 is our revenue, and our customers saved around 1.51 CR through our platform. So this is a revenue generation. So we have seen month-on-month growth there. So we do around 1.1 crore to 1.25 crores in a month, and we revenue we generate around anywhere between 8 to 12 lakhs. Currently our burn rate is around 12 lakhs. So we are revenue positive. So these are achievements in numbers. These are the projections. So currently catch is around 29 rupees. This is the thing. So EBITDA, if you see in the next 5 years, so we want to reach around 8 crores, which is a decent thing we are projecting, and we are sure that definitely we will achieve these numbers. The ask is currently we are in 3 CR, majorly for customer acquisition, which is like 55% for marketing, and 25% for operation, and 20% for IT operations. So these are the few recognition rewards we received from IHW. We received last year award as well. So these are our power pattern investors. So we have angel investors, and these are the people power pattern investors on the board. They also help us with a few decisions and IT stuffs. Thank you so much.
So I know we spoke a bit earlier, so I have a good understanding, but when do you expect to be profitable?
See,
Currently we are making enough revenue, but we are pumping the same money into marketing. So if I stop pumping in, I'm revenue positive. The reason I'm not revenue positive is because I'm using the same money for more marketing. And that's the reason we have grown from 9 lakh to now 1.25 CR.
Right, but what I mean is, you cannot stop marketing. So when do you, with all the marketing effort that you have to put in and all the fundraising, when do you expect there would be some financial projections?
Whenever I believe that I should stop growing, that's when I'll stop marketing, I'll stop pumping money. Because I believe there is never a stoppage. You should always, once you've done business in India, you should move abroad. Once you've done one country, you should move another country, and you should keep growing. That's how you should grow. Yes, you may ask me that maybe the money that you are pumping in today, and what is the percentage you will, so that will come down day by day, that will come down. But however, if you'll ask me that still when I'll keep pumping money for marketing, that I'll keep doing.
We have Mr. Abhishek Mishra also, who has been online, virtually online. We would like to ask him, sir, would you like to put forth any comments, questions?
Yes, please. Yes, please.
Please go ahead, sir.
Can I please know the gentleman's name?
Yeah, the gentleman upon the stage.
My name is Ali.
Ali.
Yes.
Hi, Ali. Namaskar. Ali, I have a question. If there is a company which has got some 50,000 employees,
correct,
how can you help the employees of the company in achieving what you are saying in this emergency fund for any sort of illness?
Okay.
And what are these sizes? I just also want to know what type of amount are we talking about? What is this ticket size?
Let me first brief you in a nutshell that what's our business model. So what I do is today I have 12,000 plus users. So I approach a hospital, I tell them that I have 12,000 plus users, and this 12,000 plus users could become your prospect business. So it's an additional footfall business for you. And in return, what I'm asking is a discount percentage for my users. Say, for example, hospital agrees for a 10% discount for my users. So I'll pass on 5% to my customer as a cashback to my users, and I'll keep 5% as my revenue. And for a hospital, it is an additional 12,000 business. Apart from that, whatever cashback that goes to the user goes back in a virtual form, that goes back in his wallet. Now that wallet, what happens is that create repeat business for the hospital. For example, someone paid 1 lakh rupees, he got a cashback of 5,000 rupees. To use that 5,000 rupees, he will have to use the hospital pharmacy. He will, if there is any investigation that is suggested, he will use the hospital diagnostics center. Now, in spite of 2 steps away from the hospital, there are 10 different pharmacies, there are 10 different diagnostic centers, but the patient would still prefer to use the hospital services because he has a cashback in his wallet. Now there is a repeat transaction that happens for the hospital. Also, whatever follow-up treatment or follow-up visit user has to come back to the same hospital. So that again increases business. Not only that, we also provide emergency loan. Now, when I say I provide emergency loan, it's not me. I again tie up with 40 different banking and financial institutes who will provide medical loan. So I, as a platform, will bring together the loan seeker and the loan giver under my roof, and they both, if the conditions match, he will provide the loan. So I am just a provider, a facilitator.
So there you're working as a new banking partner, I would say.
K2K Fintech in Bangalore, they are based. So they again have tie-up with 40 different.
Okay, so you have partnered with somebody else who has partnered with somebody else.
Correct.
Okay, no, you have not directly partnered. I got it.
Fintech company, in terms they have like 40 banks and NBFCs and other stuff.
We actually want to add value add to our services for the hospital so that the patient who has walked into the hospital should not go back. So this is a value add services that we provide, which is for the hospital and the sake of the patient as well. So both go home happy with additional business, and he will get his treatment done, the user.
And you've got 12,000 users. You have done, how much revs you guys have done? How much are you doing year on year?
Yeah, till now.
How much revs?
How much funds you have raised? Is that your question?
I am asking how much revenues you guys are doing year on year.
We have last year we have done 1.7 CR, 1.71 CR.
1.7 CR. Okay. And how much savings these 12,000 people have got out of you guys?
So saving, as I said, we have not 1.5 such a cashback, that is 1.5 CR. Our users have saved money.
1.5 CR, so approximately 1200, 1250 types.
Correct.
Are all these 12,000 people, those who are there on the platform, active, or what is it like?
We are not able to hear you clearly.
I'm asking, am I audible to you?
12,000 users active, or how many active users do you have? Daily active, monthly active users?
So this is a need-based app, but any time of the day, as of now, we have 35% active users. And if you'll ask me, in a span of 9 months, there are 60% repeat users. And for 1 year, 100% repeat users. So since this is a medical healthcare needs services, so you will not find anybody going every day to a hospital or every second day. So usually monthly once, or sometimes twice in a month, or sometimes once in 3 months.
Okay. Thank you, Ali. Thank you so much.
Yes.
Who are your main competitors, sir?
As of now, someone who has all the services under one roof. I don't know anybody. I have not come across anyone who has all this facility under one roof. However, if you'll ask me individually, someone who does home delivery, yes, we have 1mg pharmacy. Someone who has lab services, we have SRL, Thyrocare and all that. Someone who has doctor on call, we have Practos and all that. So we don't have anyone who has all the services under one roof and who has his existence, who has his presence within the hospital, who has a desk within the hospital.
Have you heard of a company called Afford Plan?
Yes. Afford Plan is very different. I mean,
how are they different from you?
So they collect money upfront. So for example, they are mostly into OPD and they are into Gynac. So they collect money month-wise, and when required, they pay it. So it's basically a subscription kind of model. But however, we are wallet. We are purely wallet, where a user loads money, he makes a payment, and he gets a cashback on every transaction. And also similarly, we also make revenue. So my hospital is happy, he's getting additional business. My user is happy, he's getting cashback on every transaction. From my end, I'm also making revenue out of every transaction that we do.
I'm sorry, the time is up. We can take the queries offline.
Thank you, Mr. Ali. Thank you.
Thank you. Thank you.
Thank you so much. Wonderfully presented, both of you. And all the very best. Well, moving on, ladies and gentlemen, I would now like to invite up on stage Mr. Milind Meshe, CEO and Managing Director of VCall. All the best, sir.
Yeah, good evening, everyone. My name is Milind, and the company name is Infisol. And today I'm going to talk to you about our one of our platform services, that is VCall. Okay, something about myself. I was born and brought up in Mumbai when the ocean water was blue, and did my schooling and graduation from Institute of Chemical Technology, which was then UDCT, University Department of Chemical Technology, in the field of pharmacy. Completed my post-graduation in medical chemistry from Bombay College of Pharmacy. And then for the first 12 years, I was working with the pharmaceutical industry in various capacities, right from sales to marketing management. And then I worked with Tata Consultancy Services from 2007 to 2018, where I was, did a whole range of projects, consulting and pre-sales to project management, etc. After that, I founded Infosegen, which was more of a one-person company because, from TCS, I just did not want to jump into a private limited and end up into compliance issues. So I started off myself as an Infosegen, a small one-person company. We tied up with one Chennai-based pharmaceutical organization, Shield Healthcare Private Limited, and which is a 100 crore company, and we were a strategic partner for them for about 3 years now. In that, we gave them products which won, Confederation of Indian Industry Award for one of our platform service, which is a business intelligence platform. We won the last year's award, IWH award for one of their our product, that is basically our service which we are offering. And after that, in the last 3 months, I founded Infosolve India Private Limited. So this is actually a private limited company. So today I'm going to talk about something about a product or a platform service which is called as a vCall. We also have BizIntel, which has won the CII award for our client last year. We have this Jumpinar, which is another platform award, IHW award last year in women health. And which is called as a SMS or scheme management system. So basically, I just wanted to point out the need, what is there today, that many of the pharmaceutical companies are facing intense competition from other companies. And there is a need for some differential, channel to connect with the doctors. So there is a general pushback from the doctors because the doctors feel that, the sales reps are not adding value. There's the 30 seconds they are there. And there is a limitation to what the representative can talk to the doctor in those 30 seconds. And that is the reason why we have developed this product, which is more like an e-detailing platform, where the representative and a medical doctor, they connect over a virtual call, a video call. And this mobile application has been developed keeping in mind the needs of the doctor. So this is technology agnostic. This is not a browser-based system. This is like an Android and an iOS application, which is there on Play Store and Apple Store. So the problem again with these medical pharmaceutical companies is when they launch a new product, it takes a lot of time for the product to reach to the end users, that is the doctors. Then there are vacant territories which remain vacant for 3 months, 6 months, and it bleeds because the doctor just forgets about the brand and there is no one to come and remind them of the brand name. When the cost of, the matured products, like for example, if I want to Dalcolax, if I want to promote, why should I spend money on medical representative to go and talk to the doctor, right? So I can always have this call made from a head office asking the doctor, reminding the doctor about Dalcolax because it's mostly like an OTC product. There is a constant increase in the sales personnel cost. This cost keeps on going up, and one-to-one call per call range is anywhere between 350 rupees per call for a small company to more than 1,000 rupees per call between a doctor and a sales rep. So these are the issues that the pharmaceutical companies are facing. There is a parallel line or parallel stream which I'm targeting at, is that the patient from the rural areas reach PHCs, the primary healthcare center, for their treatments. If the secondary or tertiary intervention is needed, they are referred to city hospitals. The patient may not have the time or money to reach, the city hospital, spend money and time, because when he goes to the city hospital, it may be late. He could have to wait for a day, and his appointment gets cancelled. So PHC physician cannot get a second opinion from this specialist while treating the patient. Like for example, if a PHC doctor needs some urgent advice or an advice on how to manage this particular, it's a unique case. So he does not have that kind of visibility as to who to talk to and seek advice from. So to overcome this, basically, super app for professional use, that is for the doctors, where the teleconsultations can be done with prior appointments, teleconsultations with PHC physicians for rural patients, detailing channel for scheduled appointment pharma community, and case management during the clinical studies between the pharma, the medical departments, and the pharmaceutical companies. So this product, the service is available on vCall. We have developed it to a certain level. Now we want to take it further up. So the planned upgrades are, what is ready is this particular, the video call is ready, where a doctor can schedule an appointment with the salesperson and they can have a detailing call. Now, why will the doctor do that? Is because whenever he gets a free time, like 10 minutes, 15 minutes, he can schedule that call with the representative. They come on the call for 3 minutes, 1 minute, whatever the doctor decides, and that call concludes, and the detailing is complete. The product explanation is complete. So this is much better than the 30 seconds or 15 seconds or 10 seconds which the representative gets in the doctor's chamber. So that is one thing. So that is ready. The second one that is ready is basically the scheduling of the call between the PHCs to the doctors. So that section is also ready. So after that, we have some planned, upgrades like a payment gateway integration for the payments to the doctor from the patients and e-prescriptions for the patients as per the NITI guidelines, NITI Aayog guidelines. So video call plus telemedicine plus analytics. This will help us to build database of the patients. And then of course is the retail coverage. The last one is the retail coverage, where even you involve the retailers. Yeah. Okay, this is the market. Yeah. So,
you are saying that it is coming up. Is it already being used or it is, there's plan?
Right. So the company which we have exclusive tie-up, like, the strategic partnership, Shield Healthcare, is planning to roll this out sometimes in the last quarter, October, November, December. Yeah.
So there is no success case study about doctors booking the call for sales reps?
No, there is no such. But, they have used it with some of the doctors. That is, the beta testing has been done. But actually the live, thing has to be looked into, the feedback.
Thank you.
All right, ladies and gentlemen, slowly we have proceeded towards our last pitch by the startup. And I request Mr. Bhavya Madan, co-founder and CTO, Nufoni, to kindly come up on stage and pitch his idea. All the very best to you.
Hi, good evening, everyone. So let's just wait for the pitch to come up. Am I not audible? Okay. How is it now? Better. So by the time the pitch comes up, I'll give you a brief description of what I am going to present today. So we are creating a wireless EEG headset called Nufoni. I think they are facing some issue. Yeah. So it's a wireless EEG headset, and the main aim, the vision that we have created it with is that we want to reach to the end consumer, take the EEG out of clinics and research and bring it to the end user. So the basic idea or the vision behind this product is that a normal consumer can track and understand what's happening with their brain. So I started with this in 2018 December as a master's project when I was doing my master's in Germany in human computer interfaces. And along with me, there is the problem that we are trying to address right now with the device is how we are trying to measure your performance and your stress and give you a graph or visualize how your stress can have an effect on your performance. But that's not actually a very unknown thing. Everybody knows that the stress can have an effect on the performance. But the idea is that we want to create a more proactive approach towards mental health, that if you're trying to understand what's happening with you, for example, if there's a change in your circadian rhythm or what kind of food that you're having, what kind of effect does it have, every small thing that you did on a day before is exactly our plan. That we have already seen what happens when the average age of a country grows. The expense on the mental health care system is huge. It grows exponentially. And that is what we are trying to prevent to happen in India. Right now, we are a very young country. As soon as the average age goes up, we are trying to prevent and make people give them the data that they can act upon it beforehand. So that's the idea behind this, that the performance is your focus. We give you certain tasks like meditations, music. We'll provide you different things to do. And along with that, we'll measure how your different brain lobes are interacting. So measuring the stress from the brain, not from heart rate variability or Kpmg. So the technology that we have based our device and our software is on neurofeedback. But right now, bringing or asking a consumer to spend 49,000, 50,000 rupees on a device is not something which is feasible. So we have already pivoted like a couple of times. Initially, we went to B2C.
figured out that it's not going to work out. So we pivoted towards businesses. Now on business end, because of the chip shortage, we couldn't create as many devices. So in the end, what we did was we created a service model where what we are trying to do is there's the device, the consumer or the end user is going to use the application, where the more you use the application, the more information we can capture, like what did you do before the session, and based on that we start recommending you meditative practices and music. And this music is not something that we own. It's licensed from people like Brain FM, and even we are partnered with different organizations. Some one of them which is coming up is Level. So we take the music from and meditation from them, and we create a platform just for that. Now, at the end is something that we see is going to be our major winner, and that's the dashboard and the information that we can provide a corporate about their organizational health. Now, how do we do that? I think it's unaligned. Yes. No worries. I'll give you the introduction myself. So the idea there is that we went to a meditation retreat, International Yoga Day, and that's the graph of people who are at the top. Now, unfortunately, you cannot see the graph of the people who are at the bottom. And we went to entrepreneurs workshop as well, and did the same thing. We asked them to do the same graphs, and now you see their performance, how the performance is changing between a meditator and a entrepreneur. And supposedly we are supposed to be the one who are taking a lot of decisions, have to be always active and everything. So our idea with the corporate model is that we come to your organization based on our technology, where we understand how each and every person is performing. We give you a report, and the feedback is how the user is performing. So for example, in the performance stress curve, you saw that there is an optimal level of stress that you need to achieve, but everybody has a different state. So for me, a higher amount of stress can be optimal, but for somebody else, they cannot handle stress at all. In that scenario, we try to understand from the user how is their performance, or from their managers how is their performance, and how to optimize certain exercises for the corporates themselves. Now, this was one of the case studies supposedly where we did the study on 15 people. It was a small organization where we saw in which zone do they fall on the day one, and how it was changing throughout the 2-week session. Now, the idea here was that do we see actually an improvement with what we are trying to do, and what information a corporate, for a person who owns or runs that particular organization, gets from that. Now, one thing which we oppose certainly is that you give everybody holidays on a fixed basis. For example, for a person like me, I don't like to have breaks in my work. If I'm doing something important, I cannot take a break because it's difficult for me to push myself back into the zone. So, and similarly for some people, it's like they have to have a routine. They have to come office at 9, they have to go by 5, and they have to do it every Monday to Friday. So that's the rhythm in everybody, and we are trying to personalize that for the corporates. It's about to end itself. Yeah. So the last page I'm going to end. Sorry, it's not going to work out. So no worries. I'm going to tell you what are the things people we have partnered with. Yeah, I think I have the PPT there as well, but now it's perfect. Okay.
All right. So how much time you have to spend on every person to get this report done in a corporate setting?
Okay, so the pilot study that we do is minimum of 3 days.
3 days?
Yeah.
They have to wear this?
No. They don't have to wear it for 3 days. We have to be there for 3 days. And for an organization size of 30 people. So they have to wear it for 20-25 minutes.
One person for 20-25 minutes.
Yeah. And it can range from different people because we take a psychological test as well. So we take that information, and then from my actually mentor who taught me neuroscience and everything. So he has recommended different types of meditations because he's a meditator himself. So we give you different exercises, and we track your performance basically over.
So you guarantee some performance to the corporates that after these steps.
What we guarantee them is we can tell you what is the right type of approach to manage this particular team. So, for example, in one of our examples, we have seen that the tech team of that particular organization, the relaxation scores were very low, but the focus and the performance was very high. It was higher than the managerial team, even though they were not relaxed. I mean, it might be because of the job that they have to do, occupational hazard, but what is the right time to give them a break? It should not be based on if they are relaxed or not. So that is the kind of information that we are trying to reach out. I will not talk much about the vision because I have already overrun the time. But the person you see on the right, she's my co-founder and my wife. So we have started this particular organization called Punktech on her sister's name, Pankuri. She actually passed away because of a brain fever in 2016, and that was one of the driving force for her to join me and be a part of this. That's my team and my mentors as well. So Dr. G. Ramachandran is the first promoter of Gold Gym. Ashutosh is one who have a huge amount of number of patents and experience in RF and those things. Similarly, Dr. Terrent, he is the one who taught me neuroscience while I was doing my master's. And Shantanu takes care of financials, so we don't mess up in terms of anything regarding money as well. These are some of the testimonials which you'll find on our website as well. So right now, this is going to be our bridge round. We are looking for a $1 million raise. The majority of the raise is going towards that we want to create a new device now, because initially the goal was that we can create something and we can show the research community can validate that. But right now the aim is that we come up with a smaller and a sleeker model, which we can go out and give it to the direct consumer, where we don't have to intervene and show them how to wear it. So for example, if it is a headphone, nobody here needs to know how to wear a headphone. But in that, if we have EEG included and extract those features, that's the aim of this fundraise. That's it. Thank you. So,
has this been tested, and do you have regulatory approvals for this?
So in TestSet, we have already done 3 research studies. One was in Government College of Yoga, Education and Health. The other one was in DRDO, Delhi. And the third one, which is going on, actually 2 of them are going on. One is in IISc Bangalore. And the third one is actually, we are doing it with one of our partners. So they have a meditation app. We are providing the data solution. We are trying to see this particular meditation, what effect does it have quantitatively on your brain. So that research is going on, and I think we are closing the research on 16th. So the large data collection is on that day.
Thank you.
Thank you so much.
Thank you so much, Bhavya, for your idea, and I do hope all the very best for your future ventures as well. Well, with this, ladies and gentlemen, we have come to the end of our summit, to the end of the 2nd edition of IHW Digital Health Summit. We would like to thank all our esteemed panelists, speakers who graced us on the occasion with their valuable presence and shared the valuable insights. We have important takeaways from the session, which will definitely ease the way in the healthcare delivery and empower the health and healthcare infrastructure. Before we wind up for the day, we would like to once again thank our sponsors for the summit. We thank our supporting partners who have been with us on the mission to ensure good health for all. IHW Council is delighted to have Niti Aayog, National Health Authority, and Invest India, who had been our supporting partners. Support Connect as our powered by partner, Optum as our health tech partner, Infosys as our healthcare intelligence partner, Ipsos as our insights partner, Exotel as our customer engagement partner, Genes2Me, Care Expert, Zoho, and Healthfluencer as our associate partners, Transformer as our pitch podium partner, IHW TV as our digital partner, and Teamwork Communications Group as a communications partner. Ladies and gentlemen, we now take a break of approximately half an hour. We expect you to be all charged up, powered up for our next most awaited, anticipated part of the evening, where we will be recognizing and felicitating the awardees. And yes, we hope to see you in half an hour for the awards presentation ceremony of second edition of IHW Digital Health Awards. We hope to see you back and enjoy the evening.